Thank you. Good morning. Welcome to this adjudicated Board of Supervisors meeting. We're going to be going into a closed session right after the pledge, but I am asking if anyone has any comments they would like to make on the closed session items. Please call in now, and the clerk will get to your comments or questions prior to our going into closed session. If you all could, please stand for the pledge. Mr. Stopper, please.
Thank you, Madam Chair. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Ms. Glanville, could you please read closed session item 1?
Item number 1 is conference with real property negotiator Joshua Pack pursuant to Government Code Section 54956.8 regarding price and terms of payment for the following properties affected by the State Route 4 Wagon Trail Realignment Project Phase 1. County negotiators are Joshua Pack and Doken Engineering. Number 1 is Jordan Revocable Trust. Number 2, Wendell and Mary Ender. Number 3, Stephen and Gloria Strange Revocable Trust. Number 4 is Scott Frazier. Number 5 is the Titus Revocable Living Trust. Number 6 is the Tiscornia Ranches LP.
If there are any public comments, we'll wait a moment before we go to item 2. Ms. Glanville, could you go to closed session item 2, please?
Item number 2 is conference with legal counsel, exposure to litigation, one case pursuant to Government Code Section 54956.9 D2.
Again, if there are any public comments, please call in now. Are you out of power, Jack? Oh, there's a little bit in yours. There's a little bit on West Point. Okay. No public comment. We are going to adjourn into closed session. We'll reconvene at 9 o'clock.
Report.
I'd like to reconvene the Board of Supervisors meetings. Could you please report out on closed sessions, Ms. Glanville?
I have closed session items from the August 25th meeting. I'll read that one and then the one from today.
Okay.
The August 25th meeting, the closed session report out pursuant to Government Code Section 54956.9 D1, conference with legal counsel regarding existing litigation, California Sport Fishing Protection Alliance versus Eastern San Joaquin Groundwater Subbasin Sustainability Plan et al. Board action, no reportable action. Report of closed session items for today. Item number 1, conference with real property negotiator Joshua Pack pursuant to Government Code 54956.8 regarding price and terms of payment for the following properties. Board action, none. Item number 2, conference with legal counsel, exposure to litigation, one case pursuant to Government Code Section 54956.9 D2. Board action, none.
Thank you. Ms. Lample, are there any staff announcements this morning?
Yes, Lisa Medina would like to make an announcement.
Ms. Medina?
Good morning, Chair, Madam Chair, and respective board members. Happy Tuesday morning. I would like to share a few events. Oh, I'm sorry. Lisa with the Interim Environmental Management Agency Administrator. Nice to see everybody. So we have a couple great events that are going to be coming up here over the next few weekends, and I would like to announce them for our community. The first event is our annual hazardous waste collection event taking place next weekend, Saturday, September 12th from 9 to 1 here at the Government Center and also in Arnold at the County Yard. On Sunday, September 13th, the hazardous waste collection will take place in West Point at the Caltrans Yard. Items that can be dropped off include batteries, fluorescent bulbs, paints, stains, and solvents, pesticides and fertilizers, household batteries, lawn and pool chemicals, motor oil in containers of 5 gallons or less, and they cannot drop off any more than 15 gallons. Over-the-counter medication, needles and syringes in sharps containers or another plastic rigid container. Items that will not be accepted include prescribed medications, appliances, tires this year. Last year they did accept tires. This year we are not accepting tires. Electronics, biological waste, ammunition, and explosives. And for any additional questions, you can contact the Integrated Waste Management Department at 754-6403. Our next event that we have scheduled on September 19th, that's Saturday, is our second free rabies clinic that's going to be held in Angels Camp at Spence Feed and Supply from 9 to noon. This event is being supported by Friends of Calaveras Animal Services, Focus, Dr. Jenny Ringett, and also Calaveras County Animal Services. We truly could not be successful without our friends and volunteers from Focus. They continue to contribute and support animal service with the caring of our animals and assist with funding special projects and services. We are truly grateful for their countless hours they have assisted us with. We'd also like to give thanks to the Calaveras Animal Service Disaster CADS. Last week, CADS dropped off several needed donations to our animals in need at the shelter. That's it. Thank you.
Thank you, Ms. Medina. Are there any other staff comments?
I'm not aware of any, but if anybody would like to, they can do so at this time. They're all unmuted, so I don't know.
Staff's muted or unmuted? Oh, okay. Staff, do you have any comments you'd like to make? All right, let's move to item 3. Report from Public Health Services, Ms. Stranger, Dr. Kaleda.
Okay.
It's their choice, they're called.
All right. Hi, this is Dr. Kaleda. I can give a report, and we're also going to be joined by Doug Archer, who's the president of Mark Twain Medical Center, who can provide us an update on hospital impacts from the COVID-19 pandemic and preparedness activities that the hospital is conducting. All right, so as of today, September 8th, 2020, California has reported 732,000 confirmed COVID-19 cases with 13,700 fatalities statewide. Calaveras Public Health confirms 273 coronavirus cases with 2 deaths. Public Health is in the process of confirming several additional suspect coronavirus deaths in connection to the outbreak at Avalon San Andreas Skilled Nursing Home. So an outbreak of COVID-19 infections continues to develop at Avalon San Andreas Convalescent Facility after an initial identification of an asymptomatic staff member working at the facility was picked up on routine surveillance testing on July 22nd. To date, infections in 52 residents and 21 staff members have been confirmed through enhanced testing of all residents and care staff. This represents the most significant challenge to our community posed by the pandemic to date. The mortality rate among nursing home residents has been significant in other similar settings throughout the country.
and throughout California. Last week, Avalon reported 5 deaths in connection with the increasing incidence of positive cases. Public Health is in the process of officially verifying the exact causes of death for at least 6 individuals associated with the Avalon outbreak. So as of this time today, our official death count for Calaveras stands at 2, and Public Health will release updated statistics as they become available, including our Tuesday afternoon press release later today. So at this time, positive residents at Avalon are being temporarily placed in a COVID-19 unit for isolation within the facility until recovered, so as to prevent ongoing transmission to other residents within the facility. The facility's infection prevention staff has been working closely with our public health department, and we've both been in consultation with the California Department of Public Health, and they've dispatched what they call a rapid response team from Sacramento to pay a site visit to the facility and to provide specific infection prevention guidance and technical assistance, which has been very helpful. The facility is undergoing close surveillance for the prompt identification of any new cases in the residents and staff, and the infection prevention activities that have been scaled up will continue. We're in regular communication with Mark Twain Medical Center regarding this situation and the potential need for additional hospital bed space in the event that the outbreak causes individuals to become sick and require hospital care. There's currently 4 Calaveras County residents hospitalized. Local hospital capacity remains adequate, and ventilator availability was at 100% yesterday. And Mr. Archer can comment on the hospital implications and role during the COVID-19 pandemic when I'm finished. Governor Newsom unveiled on Friday, August 28th, that the blueprint for a safer economy would replace the county data monitoring list system for determining what businesses can or can't be open in California counties. So every county in California has been assigned to a tier based on its rate of new cases at least 3 weeks before moving forward. So what that means is that the data is reviewed weekly and the tiers are updated every Tuesday. But once we're in a tier, we'll typically remain there for 3 weeks in order to give businesses a little bit of stability. To move forward, a county must meet the next tier's criteria, the lower tier's criteria, for 2 consecutive weeks. If a county's metric worsens for 2 consecutive weeks, it'll be assigned to a more restrictive tier. So the tiers are purple, which is widespread, that's the highest, substantial, red, that's 1 lower, moderate, orange, and minimal, yellow. So each one of those tiers requires a little bit more potential for business and economic activities to be taking place. Calaveras County is currently in the substantial or red tier. And it'll remain at this tier based on our current rates of disease for the time being. This means that some non-essential indoor business operations are now allowed to be open, and some remain closed. Under this new framework, many recently closed businesses may resume activity with modifications. For example, ones that people ask about a lot are dine-in restaurants. Dine-in restaurant service may resume indoors at a maximum of 25% capacity, or 100 people, whichever's fewer. Likewise, movie theaters can open at 25% capacity. Hair salons and barber shops, personal services like tattoo, massage, cosmetology services may also open with specific modifications and limitations on the numbers of customers and the procedures that are necessary to prevent disease transmission. Gyms and fitness centers can resume indoor operation with capacity limited to 10% of their normal capacity. So the way to know what's open is the best way is to visit the state's covid19.ca.gov website and just click on the link that says what's open in my county. And then you choose Calaveras County. It tells you what tier we're in, and all of the different specific business sectors are listed for people to explore. You can also visit our local Calaveras County COVID-19 website, and we link to the state website. The best ways to avoid exposure to the virus, and I've mentioned this several times: stay home if you're sick, Stay at least 6 feet away from people outside your household. Wash your hands often with soap and water for at least 20 seconds, and wearing a face covering over one's nose and mouth when around others. Testing remains available at the Calaveras County Fairgrounds OptumServe test site. That's open Tuesday through Saturday from 7 a.m. to 7 p.m. And testing is now available for those down to age 3. People are encouraged to register online. You can go to the website that's linked on our county website, as well as calling a toll-free number, which is 888-634-1123. We need to remain cautious in how we move forward. To continue in a positive direction, the public is urged to continue to wear the face mask, keep 6 feet apart, get tested, and wear a face covering. Stay home when you're sick. Avoid gatherings if physical distancing and mask wearing cannot be followed. There's no doubt that our current situation is further strengthened when we work together to help in the fight against COVID-19 and keep us from moving to a more restrictive tier when that reassesses in the next coming week or two. So I'd like to introduce Doug Archer to give you some information specific to the hospital's impacts during this pandemic.
Thanks, Dr. Kaleda. Can everybody hear me?
Yes.
Great. All right, so I'll kind of start out with the current state of the hospital. This morning we have a census of 17. For reference, our average daily census is usually about 8.5. So we're about double our normal volume. But it's not all COVID related. So of our 17 patients we currently have in house, only 2 are related. 1 is positive and 1 is what we call a PUI. We should get those results back later today. 11 of the 17 patients are in med-surg, 6 in ICU. So it's interesting because we're seeing a general uptick in census, but not, like I mentioned, not all COVID related. All of our vents are available, meaning we have no patients currently on ventilator, which is a good thing. Visits have been kind of all over the place over the past few months. Yesterday we had 25 visits, and about 9 of those were COVID type visits, pneumonias, fevers, COVID type symptoms. Generally, on average, our ED visits would be 25 to 30 a day. Over the past month and a half, we've seen a high of 42 patients in the ED. But, like I said, yesterday was about our average. In terms of supplies, we're actually doing very well in supplies. And I think a lot of this is due to our partnership with the county, being able to acquire things like remdesivir. That's been a big help. So we've got 100 vials of remdesivir on site right now. We've treated roughly 10 patients with remdesivir so far. We've also been using convalescent plasma for our patients, and that's been a really beneficial treatment for our patients. Most have done very well. We've treated about 10 with the convalescent plasma. To date, we've discharged around 30 patients that have had COVID, and we've had 1 confirmed death in the hospital. There are a couple that related to what Dr. Kaleda had mentioned from the nursing home that are being investigated. But we had 1, and they were actually a San Joaquin County resident. So that death does not show up in our statistics for our county. Our surge plan is still available if needed. We haven't had to activate our full surge plan yet, but if needed to, we have a 2-step surge plan. First step, we can go up to about 35 patients, and then second step, full surge, would be about 42 beds. I think one of the benefits to call out, being part of a larger health system, we've really had no issues, knock on wood, with PPE, personal protective equipment. we're pretty well supplied. We did lean on the county a little bit for a couple of items in the past, but I think we've done pretty well keeping in stock of PPE, medications. We also have some mutual aid type agreements within Dignity Health, where we can rely on our partners for staffing and transferring patients to, say, St. Joe's, for instance. Thankfully, our sister hospitals in the Dignity system have had a little bit of a break. Their COVID volumes have declined quite a bit since about a month ago. And just real quick, I did want to mention a few thank yous or call outs. Dr. Kaleda, Chris Edgerly, Kristen, the whole public health team have been great partners for us. We have a weekly call with Dr. Kaleda and our infection prevention team, and that's been a huge help, just to improve communications. And then I'd be remiss if I didn't just have a shout out to our frontline healthcare workers and our first responders that are, dealing with not only pandemics, but power outages and, a pretty threatening fire season coming up. So those are the highlights I wanted to share, but I'd be happy to answer any questions if anybody has any.
Thank you, Mr. Archer. I think we'll wait till the end.
Okay.
Okay, thank you. I do want to remind people, if you have questions, to please go ahead and call in, and when it's available, Ms. Glanville will connect you to the boardroom. Thank you. We'll come back to Mr. Archer if there's any questions. Dr. Kaleda, Ms. Stranger, do you have anything else you'd like to add?
Good morning, Madam Chair, members of the board. This is Kristen Stranger, Health and Human Services Agency. So Dr. Kaleda and Doug have done a fantastic job of covering the current status. I just wanted to reemphasize, as we've moved to this new tier system, away from the monitoring list, which was the old system of evaluation, we will get weekly updates as to what tier Calaveras data metrics are going to prescribe us from the state. We receive that information, and that data is run at the first part of the week. For the current week that we're in, Calaveras remains in the red tier, which is the tier we were originally assigned. So I just wanted to make that abundantly clear to the community that for the coming week, we will remain in the red tier. And with that, any of us can take any questions.
Okay, thank you. Do any of the board members have questions? Mr. Mills.
Yes, good morning, Kristen. Are the 30 beds still active over there at Calaveras High?
At Calaveras High School, we have deployed some medical supplies in advance. In the event that they're needed in a hurry, we'll be able to set them up the rest of the way and utilize them. So I would say that the supplies at the high school, including about 25 beds, are deployed and staged, and they would still need to be set up and activated in the event that they're needed. But by just having the assets there and ready to go, it would cut down the time significantly if they're needed in a hurry.
Yeah, I just wanted to be sure that was still part of the system here. Thank you.
Mr. Stopper.
Good morning. The Avalon situation, it's sad, and I'm glad we're bringing as much resources in as possible to deal with it. As we move forward with this situation developing in Avalon, have some of these people been not positive in the past and moved up here in the past more recently, and are they all registered as citizens of Calaveras County, the ones that are currently at the Avalon Center, or do they have mailing addresses elsewhere, so they technically are residents of other counties?
I can comment on some of that, Supervisor Stopper. So the residents that are at Avalon in San Andreas, we estimate acquired their infection from staff who brought the illness into the facility, as opposed to an infected patient or resident who was transferred there. and was responsible for the infection start.
I'm sorry, Dean. I wasn't asking if the patients were the ones that infected the people there. I was asking if any of them had been moved up this year and if they technically live someplace else on paper and they are currently being housed at Avalon.
So I think what you're referring to is if they do get the infection, and let's say there was a fatality associated with the infection, would that person be considered a Calaveras resident? Let's say that they lived in Amador County and they had surgery and they were transferred to Avalon just for a short-term basis for rehabilitation, but they were an Amador County resident. Would that case be counted back to Amador, or would that be a Calaveras case? So the way that the cases get assigned is where the infection is occurred, or where the infection is acquired, is the locale that the case gets counted towards. So, for example, if somebody is a resident of Sonora and they're admitted to Avalon and they get the infection once they're in Avalon, even though they were only there on a short-term basis, that counts towards Calaveras County because that's where the person acquired the infection.
So it's not applied the same as to everyone else and every other business within the county. It's just because they were shipped into Avalon here and they got sick here, then it gets applied here. Because in the past, you've been on video here saying that cases have been applied to Calaveras. In the very beginning, there was someone that worked outside the county. They were outside the county when they got it, and the case was applied to the county. So we're playing with two different things here. If they're technically a residents of Amador and you're applying them because they're at Avalon here, are they being applied to the other county at the same time because they're a resident there? Are we counting the numbers twice?
No, the numbers would never be counted twice, Supervisor Stopper. So you are right in the sense that typically, let's say someone is not a resident in a skilled nursing facility, the case count would go back to their county of origin. But in terms of residents in a skilled nursing facility, the cases get counted towards the local jurisdiction in which the infection is acquired, which is different than people who are not in skilled nursing facilities. That's a unique aspect of being in a SNF.
Yeah, it's a little confusing on how the statistics are being applied and how the standards being applied in different areas. So thank you for the clarity on that, Dr. Clada. I have another issue. Are you currently still working with a school boards and everyone else on how we're opening up and everything?
Well, I'm not sure what you mean specifically.
Well,
I can
you
say
give
that
recommendations as the public health director.
in general terms, we work very closely with the school communities. Public health and schools are very closely connected. And we have regular calls with the school officials, primarily through the County Office of Education as the communicating entity to the individual school districts, as opposed to dealing with the individual district school boards directly. So our main conduit of communication and messaging is through the County Office of Education.
Okay. I'd like to add just a couple more points to that, Supervisor Stopper. We do have weekly calls, as Dr. Clada just said, with Office of Education, and those calls also include all of the school nurses. And we go over things like the preparation documents, the site-specific protection plans were developed. The template was developed in consultation with public health. So yes, we have very close connection with the schools through our incident command structure of utilizing our contact and liaison at the Office of Education.
Okay. I'm getting to a point on a specific question. I've been recently talked to one of the parents that have children in school, and with developing things for COVID-19 and everything, immunizations are a key element moving forward. SB 714 provides for existing law generally prohibits the governing authority of a school or other institution from admitting for attendance any pupil who fails to obtain required immunizations within the timelines prescribed by the state. To go on there, except for in cases where, except when the pupil has an exemption from the requirement existing law. And it requires the department by January 1st, 2021 to develop and make available use by licensed physicians and surgeons an electronic standardized statewide medical exemption certification. Recently, some kids have been removed from COSD while they're distance learning because they have some of these prior exemptions. This isn't due until 2021. January 1st of 2021. And because it's distance learning, these kids are removed from school. They're not allowed to transfer by the governor's order right now. And if you don't have your kid in school and they are not attending, which, being expelled from distance learning means you're not attending, the parents can be taken to court and fined for not having their kid in school right now. So, is there a solve, Dr. Kaleda, for this? I mean, this law isn't up. The schools are removing kids from school. The exemption doesn't only applies to kids that are online learning, but distance learning doesn't fall within that definition. Is there any way we can get our system here in Calaveras County to move forward on these kids that already have these exemptions because they've been through everything with their doctors and everything, providing proof that immunizations may be detrimental to these students?
There's been regulation regarding the requirement for immunizations for school attendance for many years, even before the COVID-19 pandemic. There's a process for parents to get an exemption if they don't want their kids immunized, but it has to be only for medical purposes now. The personal belief exemption was removed by the California legislature about a year ago. So at this point, parents can opt for a medical exemption if they have a medical provider that says that there's a legitimate medical reason why a child cannot be immunized. Otherwise, it's a requirement for children to receive immunizations to attend school. Now that there's distance learning, I'm not sure exactly what the impacts would be for children who already have a prior medical exemption to participate in distance learning. I don't know that that would be impacted or treated differently necessarily. I don't think the requirements are being more lax now, but I don't think that those children with a medical exemption are not having that honored when it comes to distance learning requirements.
Right.
And Supervisor Stopper, I just wanted to add also that that this question could probably be added to and given more of a proper response to by hearing from the school districts or the school administrators. They probably have more clarity. From Calaveras Public Health, one of our roles and one of the functions that we take very seriously is helping to connect community members and their entire families to their medical homes, to their primary care providers, and helping them to obtain access to the needed immunizations, either through their primary care provider or for the underinsured or non-insured. Calaveras Public Health does help to meet that need as well. So that's our primary role in this particular matter.
If you don't mind, Dr. Kaleda, I'd like to take this conversation possibly after the meeting offline with you and get bring up some specifics because it's preemptive to what law says and almost contradictive. So I'll bring it up offline later and get a more defined response, if you don't mind.
Fine.
Thank you, sir.
Is there anyone online? Okay. I have a couple of questions The people within Avalon who have the virus, are they housed in a special unit here in San Andreas, or are they at another Avalon center?
Originally, when the first cases were identified among the residents of Avalon, they were sent to a separate facility outside of our community even. And the goal with that was to remove those patients from the environment and to reduce the risk of transmission to other residents near them, and also position those patients to larger medical care systems where community hospitals that are larger than ours would be able to help care for them in the event that they got sicker and required hospitalization. That was able to be done up to a point, but at this point, the potential or the availability of other facilities has run out. They can't take any more patients within the Avalon network. And so now further cases are housed within Avalon San Andreas in what's called a COVID-19 unit. So there's been a specific part of the facility that's been cordoned off, and there's a plastic sheet that divides that. The staff that take care of those residents are dedicated only to those residents. They can't be going back and forth and taking care of other non-COVID patients and COVID patients back and forth. So they have dedicated staff. The facility's been able to create a COVID-19 unit, and there are environmental controls that are in place to prevent transmission within the facility. And only COVID-19 diagnosed patients are allowed to be cared for in the COVID-19 unit. That's called cohorting of infected patients.
Thank you. I have one more question. When it comes time to review the county status, whether we're red or go into purple, if I remember a week or two ago when you or Ms. Stranger talked, we could withdraw, that's not the right word, the Avalon patients from our statistics. We could get like an exemption so that instead of showing 20 patients, we only had 14 because we excluded Avalon. Could you please explain that?
Ms. Stranger's more knowledgeable about this than I am, but I can say that when it comes to certain high-risk institutions like prisons,
Right.
those are specifically excluded from the counts in a county. But skilled nursing facilities, nursing homes, are not excluded. So the case counts that we experience as part of the outbreak in Avalon, those get counted towards Calaveras County, and there's no process that we can activate to exclude those patients from our data set.
Oh, I thought we could under the blueprint. It was my misunderstanding.
That's okay.
Thank you.
Yeah, Dr. Clade is correct. Guidance has been the same since throughout the pandemic. Now to
Ms. Stranger, you're breaking up.
Oh, I was just reiterating what Dr. Clade said is correct, and that has been the case through the monitoring as well as the blueprint.
Okay, thank you. Any other questions or comments from the board? Any from the public? Ms. McBride.
Good morning, Terry McBride, District 2, New California State, Calaveras County Committee Chair and Senator. First thing I'd like to do is thank Ben, Gary, and Dennis for common sense, for your vote 2 weeks ago, remembering your oath of office. I appreciated that. I have a little story in my head, and these two guys are driving down the road. They're in town. They drive by a bank. One guy says, "Hey, pull over. I need to run into the bank." The driver of the car hears bang, bang, and his buddy runs out with a big bag of loot. He jumps in the car and says, "Drive, here they come." "What'd you do?" "Well, I robbed the bank. I had to shoot somebody." Thankfully, especially here in Calaveras, we got a really good sheriff and deputies, and they caught him. Do you know what? Even though that driver had no idea what he got himself involved in, he was held accountable. So right here, if you go and look at the California legislative information, then you can inform yourself. And what I'm going to read to you is Section 1026 Government Code, Title 1, Division 4, Chapter 1, General 1000 to 1241, Article 2, disqualification for office or employment, just in case you don't think that oath of office means something. And this is 1026, every person who exercises the duties of any office in violation of the provisions of this article relative to oaths, and every person who knowingly appoints to office a person ineligible by reason of the provisions of this article relative to oaths is guilty of a felony. So please remember that as you make your further decisions in regards to COVID. Something else that was there, and I'm going to read this until my time's up. Be nice if that timer was on again. If you look at 1027.5, the legislature of the state of California finds that there exists a worldwide revolutionary movement to establish a totalitarian dictatorship based upon force and violence rather than upon law. Do we see what's going on in our country? This worldwide revolutionary movement is predicted upon and is designed and intended to carry into execution the basic precepts of communism as espoused by Marx, Lenin, and Stalin, and Mao. Pursuant to the objective of the world communism movement, where they take away your rights, close your business, decide who stays open, decides who's important. In numerous foreign countries, the legally constituted governments have been overthrown and totalitarianism, dictatorships established therein against the will of the people, and the establishment of similar dictatorships in other countries is eminently threatening. The successful establishment of totalitarian dictatorships has consistently been aided, accompanied, or accomplished by repeated acts of treachery, deceit, teachings. Thank you.
Thank you, Ms. McBride. Are there any public comments on the line? Yes, please, thank you.
Madam Chair, just a point. Approximately one-third of our county probably won't have access to the information that's on the screen or the ability to view the meetings today.
Well, they could
making a
go
point.
to the centers in Arnold and Murphy's and West Point and San Andreas.
So that's their option,
Yeah, unless they're already
Unless-
charged.
unless they're housebound.
Or they're charged. You could charge up your computer and still get access.
They could come here.
That's what I said, San Andreas, West Point, Murphy's and Arnold. Or they could send Susan an email.
Hard to imagine they did business for 150 years before the internet.
I know. No comments? Okay, thank you. Ms. Archer, thank you very much for joining us today. Ms. Stranger, Dr. Kaleda, we appreciate your comments as always.
Thank you.
Thank you. Okay, I'd like to go to the next item. I don't even like to call this recognition. It's a lot more serious than that. It's really a proclamation from our Mental Health Board, and I've asked Supervisor Garamendi to please read this. Thank you, Supervisor.
Do you want to read that?
Item number 4 is from Behavioral Health Services Mental Health Program, proclaimed the month of September 2020 as Suicide Prevention Awareness Month in the County of Calaveras, recognizing the role of promoting awareness and resources around suicide prevention.
Thank you very much, Ms. Conville, and thank you very much, Madam Chair. It's been my privilege to serve for the last 4 years on the Mental Health Advisory Board. It's been really an educational opportunity for me, and I have learned a great deal, and I encourage you all to continue to support it as you all always have. So what I am reading is a proclaiming the month of September 2020 as Suicide Prevention Awareness Month in the County of Calaveras. So, Madam Chair, I'd like to read it, and then we'll do a vote. You can have comments, obviously, before we vote. Whereas September is National Suicide Prevention Awareness Month, which helps promote awareness and resources around suicide prevention. And whereas according to the Center for Disease Control, suicide is the 10th leading cause of death overall in the United States, claiming the lives of more than 48,000 people in 2018, with approximately one death every 11 minutes. And whereas every death by suicide directly impacts family members, friends, loved ones, and by extension the entire community. And whereas we must encourage relatives, friends, coworkers, and providers to recognize the signs of a problem and guide those in need to appropriate services and support. And whereas Health and Human Services Agency, HHSA, Behavioral Health Services, BHS, is committed to raising awareness, providing education and training on suicide prevention, and helping to reduce the stigma associated with suicide and attempted suicide. And whereas Behavioral Health Sciences Services will conduct suicide prevention trainings in September using video conferencing technology that teaches participants how to help others at risk of suicide and how to talk about suicide while decreasing the risk of harm. And whereas BHS has operated a warm line to support mental health needs of the community since the start of the COVID-19 pandemic. This warm line can be reached Monday through Friday, 8 a.m. to 5 p.m. at 209-754-6807 or 209-754-2805. And whereas crisis intervention services are available 24 hours a day, 7 days a week by calling 1-800-499-3030 or 209-754-3239. The call will be connected to a crisis counselor who will assist with mental health needs or refer to call to a crisis worker in the community. Are there any public comment on this item? Kristen?
Yes, actually, Susan Sells has joined the line to prepare a few staff remarks, if that's okay.
Yes, please.
Susan, you're on mute. Susan? Okay, hold on one moment. I have her notes just in case, as she is part of the power outages currently. Hold on one moment, apologies. So good morning, Madam Chair, members of the board. This is Kristen Stranger, Health and Human Services. Oh, Susan, you're on. Go ahead and take it over. I was going to read your notes.
So I'm sorry. This has been very challenging with no power and not accessing Zoom. But can you all hear me?
We can.
Okay. Good morning, Madam Chairman and the members of the board. I'm Susan Sells, and I'm the Mental Health Services Act analyst for Behavioral Health Services Division of Health and Human Services Agency of Calaveras. So I'm here my presentation today is to request that you proclaim the month of September 2020 as National Suicide Prevention Month. National Suicide Prevention Awareness Month each year helps to promote awareness and resources around suicide prevention. According to the Center for Disease Control, since 2008, suicide has been the 10th leading cause of death overall in the United States. It's twice the number of homicides, which I've discovered as I've been researching. In 2018, suicide claimed the lives of more than 48,000 people in the U.S. The annual U.S. suicide rate increased by 24% between 1999 and 2014, from 10.5 to 13.5 suicides per 100,000 people. This is the highest rate recorded in 28 years. Locally, again, the source here is CDC, from 2012 to 2016, which is a 5-year span, the rate of suicide for Calaveras County is 22.4 per 100,000 persons, or 59 suicides over this 5-year period. This is the most current information that we can locate. So Compare the 22.4 to Tuolumne County, which is 16.1 per 100,000, and Amador County, which is 25.4 per 100,000. California, 10.8 per 100,000, and the U.S. 13.5 per 100,000. Just thought these statistics would be helpful in painting that picture of where we stand in our community. So every death by suicide directly impacts all of us as family members, friends, loved ones, and by extension, the entire community. Because this affects all of us, we must encourage relatives, friends, coworkers, and providers to recognize the signs of a problem and guide those in need to appropriate services and supports. The COVID-19 pandemic crisis may increase suicide rates during and after the pandemic. Mental health consequences of the COVID-19 crisis, including suicide behavior, are likely to persist for months and years to come. Suicide warning signs include sudden mood changes, withdrawal, or giving away possessions. They may also include an increase or decrease in sleep or appetite. A person thinking about suicide may also use more drugs and alcohol. Signs differ for each person, but most people who die by suicide communicate their intentions in some way. The County of Calaveras Health and Human Services Behavioral Health Services is committed to raising awareness by providing education and training on suicide prevention. Calaveras County Behavioral Health conducts annual suicide prevention trainings at no cost to the community for individuals of all ages, and this of course includes churches, schools, any community group. These free trainings are available. The suicide prevention training we provide is called Question, Persuade, Refer, or QPR. And it's one way that we can raise awareness and help to reduce the stigma associated with suicide and attempted suicide. Behavioral Health will be conducting a QPR suicide prevention training via Zoom on September 23rd, 2020 from 1 to 2:30 p.m. This training teaches participants how to help others at risk of suicide and how to talk about suicide while decreasing the risk of harm. If you'd like to participate in this training, I'm hoping that the QPR flyer is attached as a handout for the board meeting today. Is that true? If
Susan,
not, we'll get it out to everyone.
Yes, Susan, it's Kristen. So I cannot share the flyer at the moment, but we have it on our website. We will be dispersing it largely throughout the community, making this training opportunity aware for the entire community. And just as a refresher, this QPR, which is a Question, Persuade, Refer training, it's a suicide prevention training. It will be occurring via Zoom on Wednesday, September 23rd, 2020 at 1 p.m. There's an opportunity to register, and we encourage our community to educate themselves further to help recognize the signs of suicide and be able to help a community member to access proper resources in the event that they are in need. So again, that information will be posted to our website. We will disperse it largely throughout the community as well.
And on the flyer is the link to access Zoom. And it's also important, our contracted trainer, Ken Baldwin, a retired teacher, excellent trainer, we're asking that people contact his personal email to let them know they're going to be joining so that he can get a sense of how many people will be participating on the 23rd. Also, if anyone is interested in the community in holding or participating in a Question, Persuade, Refer suicide prevention training at any time this year at no cost, please contact Susan Sells at MHSA office at 209-754-2810. And we can set that up for you throughout the year, as we have Ken Baldwin on a year-long contract to provide these trainings. So I'd like to also go over real quickly where to get help. Even though this was in the proclamation, I just want to reinforce it. by saying that one, if you're concerned for yourself or someone else, first you can contact the National Suicide Prevention Lifeline at 800-273-8255. Secondly, you can contact our local crisis intervention services, which are available 24 hours a day, 7 days a week, by calling 1-800-499-3030 or 209-754-3239. The call will be connected to a crisis counselor who will assist with mental health needs and or refer to a local crisis worker in the community. So the person can speak to someone locally to access help. And third, we have opened up a warm line when we closed our wellness center for our behavioral health clients and consumers. The same week, we opened up a warm line 8 to 5 days a week to support the mental health needs of the community since the start of the COVID pandemic. And this number is either 209-754-6807 or 209-754-2805.
Thank you, Susan. We appreciate it.
Okay, you're welcome.
Thank you.
Thank you very much. And
Mr. Garamendi, did
no,
you
ma'am.
want to ask for any
Is there any-
public comment
is there any-
before you ask for the vote?
Yes, ma'am. I would like to thank Ms. Sells for her continuing dedication to this county. She is a real treasure. It's been a pleasure to work with, and I appreciate her dedication to helping on this. So, Madam Chair, I suppose if there's no further comment, we should call the vote. First.
Madam Chair, so moved.
Motion by Supervisor Stopper.
Second.
Second by Supervisor Toffenelli. Mr. Garamendi.
All in favor?
Aye.
Opposed? Carries 5-0. Now therefore be it proclaimed, the County of Calaveras Board of Supervisors proclaims the month of September 2020 as Suicide Prevention Awareness Month in the County of Calaveras and welcomes community members to take part in suicide prevention training and learn about local resources that pertain to suicide prevention. Passed and adopted by the Board of Supervisors of the County of Calaveras, State of California, 8th day of September 2020. Thank you very much.
Thank you, Mr. Garamendi. Thank you, Ms. Stranger, for bringing this forward. Is there anything else, Ms. Stranger? Guess not.
No. Nope.
Okay, thank you.
Thank you.
I've made a agenda change on regular agenda part 2. I'm taking item 20, which is the fire district's JPA request, and I'm moving it before item 16. Okay, I'd like to go back to public comment. Consent agenda. Is there any item on consent that the board would like to pull? Mr. Mills?
Yes, item 15.
Any staff member of the public like to pull a consent agenda item? Okay, may I have a motion on the balance of the consent agenda, please?
So moved, Madam Chair.
Motion by Supervisor Toffenelli. Is there a second?
Second.
Second by Supervisor Stopper. All in favor?
Aye.
Aye. Opposed? Passes on a 5-0. Item 15. Mr. Mills.
Yes, Madam Chair.
I'm sorry. Oh, sure. Go
Please.
ahead.
Item number 15 is from District 3, authorize the board chair to sign a letter of support for Bill 4431 for Emergency Wildfire and Public Safety Act on behalf of the Board of Supervisors.
Okay. Mr. Mills.
Yes, I do understand that this is a bipartisan effort here on the part of 2 senators, one from California, one from Montana. But what seems to be missing here is any response from the U.S. Forest Service, Vicki Christensen, or the people who would be charged with the work. I have had an opportunity to discuss this with various members of that organization as well as others. There is a delicate balance that is in relationship building that's occurred over decades between the U.S. Forest Service and its various partners. This particular effort is to develop 3 projects and to eliminate NEPA from those projects. The question would be how those projects would fit within the existing work. And the big concern would be if money is given to this particular effort without an appropriation, it's most definitely going to take from other work, and that should be raising a red flag. I'm more concerned that this might be an action that is developed through the smoke and haze of the moment, rather than through having a conversation with the partners that would be responsible for it, and without their input from the U.S. Forest Service, without something from OMB about what the appropriation would be for it, I'm not prepared at this time to support it.
Okay, thank you. Any other comments from the board? This item has been going on for several years, Mr. Mills, and it's finally gotten support. And I thought it was time. It was a step. We might not get a project, but it's a step to trying to reduce some of the litigation and some of the requirements for Forest Service projects.
Additionally, Madam Chair, the letter that is here has a spelling error in it.
Is that Diane? Let me look at the letter.
It would be go through RES 4431 senators.
Wait, I got to get the letter up. Just
The senator is Murkowski, not Murkowski.
Senator MUR. That's what it is on her website. Oh. Oh, I am. Oh. Okay. Could you please correct that? Thank you. Okay. Any other comments on this item? Are there any comments from the public? Okay. All right. Seeing no public comment, I'll bring it back to the board. I would like a motion on this. I think if we don't start doing something, nothing gets done.
So moved.
Thank you, Supervisor Garamendi. Is there a second? No second? All right. This motion dies for a lack of a second. I will tell the board that I will be writing the letter. If you read the bill, I cannot see how you would not support something like this that's a bipartisan basis that helps our U.S. forests and gets rid of a lot of the things that some of you in this room keep talking or get in the way of getting things done. Okay. I'd like to move now to the regular agenda. We will take a 5-minute recess and let the fire chiefs come in. Oh, I'm sorry. Thank you. Yeah, thank you.
I saw it somewhere.
Okay, I appreciate your
I didn't bring the
catching me on
agenda.
that. Okay, we ready? Okay, Ms. McBride.
Terry McBride, Calaveras County Chair of New California State and Senator, reading grievance 20, Chapter 2, Declaration of Grievance, Statement of Facts that California violates the following United States Constitutional Article 4, Section 4, Article 6, First Amendment, and the 14th Amendment. Order of the day, insurrection. You guys hear what President Trump's been saying? The government of California, the current socialist governor, dictator, and mono-party system, along with local officials, are following a coordinated design with the intent to actively engage in acts of insurrection against the U.S. Constitution. The Insurrection Act of 1807 and the Emergency Economic Powers Act are United States federal laws that govern the ability of the President of the United States to deploy military troops within the United States to put down lawlessness, insurrection, and rebellion. The California government, in conjunction with the socialist state executive, instituted wherever the current socialist governor dictator has usurped power, has actively engaged in acts of secession, and have created a reign of terror on United States citizens living in California with the intent to secede from the United States of America, to thus destroy the very United States which secures our liberties and freedoms. Betrayal by the sitting socialist governor dictator of California, the mono-party legislator, and the local elected officials is evidence of abdication of their responsibilities of authority and sovereignty over the citizens of the United States living in California state. In an article from Mike Adams about insurrection, he states, the 14th Amendment speaks directly to the powers of the federal government in dealing with officials, individuals, and states that are engaged in rebellion against the United States of America. Specifically, the 14th Amendment grants the U.S. President the power to arrest and indefinitely hold all public officials, including mayors, governors, state legislators, federal judges, and law enforcement officials who support rebellion against the United States or who have given aid or comfort to enemies of America, Section 3. And eliminate House of Representative positions for California and other states which are engaged in supporting big tech censorship to platforms that are supporting rebellion against the United States of America and abridging the right of voting age citizens to participate in elections via censorship. This implies that electoral college votes would also be proportionally reduced in these states. Section 2, it would also apply to states like Oregon, which are reportedly funding war encampment installations that house insurrections who are unleashed each night to attack federal buildings and federal law enforcement officers. Eliminate all federal financial support for cities and states which are engaged in insurrection or rebellion against the United States. Section 3 specifically states that all such claim of federal money obligation to the state shall be held illegal and void.
Thank you, Ms.
Thank you.
McBride. Are there any other public comments? Okay. We will take a 5-minute recess to allow the fire chiefs to come in if they so choose. Jack? Ben, are you ready? Okay. I'd like to reconvene the meeting, please. I'd like to move to item 20. We will go back to item 16 when the chiefs are finished. The Calaveras County Fire Chiefs JPA request for funding for ground ambulance service. And who's speaking on behalf of the JPA?
Fire Chief John Orbaugh.
Thank you, Chief.
I have some handouts here if you can want to pass them out. This will be the sort of the presentation. I'll go through it. Oh, this is interesting. I'll try to follow all this. What do you say? No, I'll figure it out. It's all good. All right, so Madam Chair, Supervisors, thank you for this opportunity to speak with you again today. I want to start off by thanking the board for listening to us last month. That was very appreciative, and I appreciate the 5-0 vote to make some recommendations to Mountain Valley EMS. I want to give a special thanks to Supervisor Tofinelli for working hard with Mountain Valley EMS and with their board. They did make 2 addendums to the RFP that made it clear that us as a JPA can participate in that RFP, and we thank you very much for that. So that brings us to where we're at today. What I'd like to do is I'll just give you a quick overview. I'm just going to breeze through it, and then we'll get to the topic that's at point. As you know, the reason that we started to get into this was that there was an RFP that nobody bid for. Then they decided to have another RFP. We felt that that was a decrease in service or staying the same. We were happy with the original RFP. We felt that we could meet that standard if we had the opportunity to do that. Then after that, obviously the RFP came out. You guys helped us move along with that process and allowed us to continue to participate. They extended some dates to allow us to move forward with that. We think that we have a system that's designed that will drastically improve service to the citizens of Calaveras County, and I will elaborate that shortly here. Make sure I'm covering everything. We do think that our program will decrease response time and saves lives, for sure. The biggest difference between us and a private provider right now is that we have the ability to be made whole on the Medicare and Medi-Cal payments. We also have an opportunity to have some other first responder charges that we have not received in the past that we have the ability to obtain. With our projections, looking through ALA's information and from our experts and us looking at all the revenue stream and the possibilities, we feel that we could bring in about $1.3 million in revenue more into the county for ambulance service, which would allow us to improve that service and decrease response times. So what we're here for today, without going through a lot of this stuff that I know you guys are familiar with, is that we're sort of at a decision point on what we need to do and what we can do. Unfortunately, as a new JPA, we do not have any money, we do not have any current funding, and we would have to have some way to fund the program, at least for the first 8 months for sure, because we've been told by the billing companies that we may not receive bills for 8 months. So we have to project a 0 revenue for those 8 months. If you turn to the last page, and I'll come back to anything else after this and be glad to answer any questions. The last page is really where we're at today. So it really sets the tone. If you look at the last page with all the numbers on it, it starts off the first sentence. It says a new fire-based system will increase from 3.5 paramedics a day to 7 paramedics a day. So it's the very last page with the numbers on it. So what we're saying is we will be able to double the amount of paramedics that are in Calaveras County on a daily basis. The new fire-based system that we're designing right now will have 5 ambulances in your system for 24 hours a day and have 2 QRVs or 2 engine medics, 2 additional paramedics in service 24 hours a day. So again, we're going from 3.5 paramedics a day currently to 7. We're changing from 3.5 ambulances a day to 5, and we're going to add additional 2 QRVs into the system. What we anticipate doing on that is that we would staff an ambulance in Mountain Ranch, we would staff a paramedic in West Point, we would staff a paramedic in Murphys, and we'd staff an additional ambulance in Copperopolis. The other 3 ambulances that are currently in play with Angels Camp, San Andreas, and Valley Springs would stay the same. So again, the addition to, right now they staff Valley Springs, San Andreas, and Angels Camp. We would staff an ambulance in addition to those 3 areas. In Mountain Ranch, we'd put a paramedic in West Point, a paramedic in Murphys, and an ambulance in Copperopolis. The reason for the ambulance in Copperopolis, just to let you guys know, they do have assessment paramedics. They do have the ability to transport on very minuscule situations. And the response time to get the ambulance down there is roughly 30 minutes. in most scenarios, and sometimes it can be longer. And those ambulances and those paramedics would move around in the system, depend on call volume at the time of day. We'd have a system status management plan to move those around. But we feel that our plan will double the amount of paramedics. Now, if we're looking at the numbers, which I think is probably the most important thing to see if we're worthy of a loan, and just to talk about that, we're willing to work with you on that. It's not money that we want you to give us. We feel we could pay that back on a schedule that is acceptable to both of us. But we also feel that we might be able to pay all the money back to you the second year of service. So we might only be asking for money to get the first year going, and in the second year we could pay you back all the money that we're requesting. So we'd like to have $3 million is what we're asking for. If you look at line number 1, for the first 8 months, it's a little, we know our cost will be over $2.5 million. So we'd like to have a little bit of buffer in there just to make sure that everything goes through fine and we don't have any issues and we're not super tight. So that's why we're asking for the $3 million. After the first 8 months, you can see we start making revenue. So months 9, 10, 11, and 12, we'll bring in about $1.5 million. We'll be positive in those 4 months, about $260,000. And for that whole year, we'll be short about $2.2 million after the revenue comes in. Now here's the key point. In that first year of service, since we're not collecting money for that first 8 months, that money is going to come in the second year, and it's going to come in quick. So what we anticipate the second year of service, we would have a profit of $4.35 million, so a little over $4.3 million. That's why we're thinking that second year, when all the money comes in from the first year, we'll be able to pay you guys back the $3 million in the second year, and we'd still have a profit of about $1.5 million. So as we move along in the system, if that is the truth in the second year and we're still projecting on these, and I can tell you our projections are conservative on revenue, and we've inflated our cost on here. So we're not trying to just put it right there. We've increased our cost, and we're decreasing our projections on revenue. We think it actually would be better than this. This has been vetted by multiple people, and if we're able to continue making 1.3 million in extra, then we're going to increase the system more. So that system that you're seeing right now, where I'm saying I can double it, we could add another ambulance in the system. We could add 1 or 2 more QRVs in the system, potentially in the second year. So we think it'd be an awesome program for the county. Again, the main purpose of this is decrease response times when you call 911. If we decrease response time, we save lives. I went through that scenario with you last time. I don't want to take all your time today, but that's just a fact. Every minute of a delay decreases your chance of survival by 10%. So we're really excited about decreasing response times by 50% or even more in certain areas, and that's going to lead to saving lives. With that, I was going to talk a whole bunch of stuff, but I know you guys have heard most of the information. Most of you guys are well versed on it. And if you have any questions, I'd be glad to answer them at this time.
Mr. Stalker?
A couple things. Let's talk about the money coming in as revenue, not
Sure.
profit.
Sure, sorry, I apologize, and I agree with you, sir.
So the billing companies, and you talk with them, there's going to be at least an 8-month wait. And
So conservatively, what they were saying, when you start up a new business into that kind of sector, they say you need to plan for 6 to 9 months of a lag time in billing. I personally don't understand it. That was told to me by the experts in the companies, so that's what we're planning for.
So, yeah, 8 months would have been conservative. So with a 6-month lag time, that I mean, even starting up, that continues down the road, some to a certain degree. I mean, you don't
Correct.
pick someone up and then the insurance company pays you day one. So, I think you addressed it partially here because you have it on your sheet here. First year
Right.
projected revenue in months 9 through 12. It's not like that's all going to come in right then. But you did bring up that it would be definitely coming in second year.
Correct.
Minimal amount in the 9 to 12
Correct, sir.
month moving forward. I have lots of questions because We expect to see a business plan today. Or at least I do.
Okay.
You know, I'm gonna leave it at that for right now, and I'll run back around because I'm reading this, and I definitely, I have all my heart into supporting our fire districts and reducing times, giving the best benefit to our constituents and residents of Calaveras County. But you know, this is short for a business plan, and we're on a very short runway if this is going to work at all. So I'll stop there, and I'll leave it to
Mr. Mills?
Yes, thank you, Chair. John, something that maybe Joel can answer the question, and I'm not certain what the answer is, Joel, and that is that Ebbets Pass and Copper both, and I know you just recently went through a GAN limit change because your voters approved providing this type of service into your specific districts, and there's an assessment that was put in place for that reason. Is there some of this that may end up having to go back to the voters of your districts to provide an additional level of service? In other words, you're no transport right now. How are you going to work out the details of suddenly becoming transport? And
in all of the conversations we've had, Copper will always have paramedics 24 hours a day, 7 days a week. They will never leave the district. They're covered. When the transport comes down there, it's going to be a separate entity. But we will always have the paramedics there 24/7. That's our obligation, and we won't shirk from that.
So you don't feel that there would be any issue with the voters, so to speak, with the original agreement that they made with you and
Not
Ebbets
in the
Pass?
least. We won't break that obligation to the constituency. Not at all.
And the plan that we're providing is in addition to, not part of, in lieu of, or anything like that. It would be in addition to the current service that they're providing.
So you're figuring an overlay rather than...
Correct.
Okay, that's kind of what I was looking at here.
Yeah, we don't want to disrupt or modify anything with the Copper's paramedic program that's already been put in place by the citizens and voted many times over. So that's not our intention to make an adjustment there. It's in addition to, sir.
I know that you need to win the RFP first.
Correct.
And then once that, there's a lot of other things that need to happen very quickly.
Correct.
I know Supervisor Stopper referred to it as short runway. What assurances is there that the staffing that's currently in place would transfer, or that they might seek options in other locations, et cetera? We got any assurances at all?
Well, our intention and what we would do is offer a job to every single paramedic and EMT that is currently working for the current provider. That would be our position. So every single paramedic and EMT that's currently working for the current provider will be offered a job in the startup of the new JPA. And you're correct on there's no assurances that we would get the RFP right now. We have to do what Supervisor Stopper said. We have to write up a business plan and have all that presented in the RFP that's due in about 40 days. But we know that we can't participate in that at all if we don't have the finances. So that's sort of where we're at. It's sort of like, is this a possibility? If it's not, then we really can't move forward because we wouldn't have any money. There would be nothing in that financial category. We know we'd get a zero. We also know that it's going to be tough for us to compete in this as well. We do have 2 paramedic providers that are in the JPA, one that does transport on a regular basis. A lot of the other categories that will be evaluated, we have minimal experience in. So we understand that's going to be a tough process. We know that we may not, let's say hypothetically, the decision was made that we can make a loan for $3 million. That doesn't mean that we're going to get the RFP because it's going to be rated by objective people, unbiased, have nothing to do with the program, and they're just going to score based on what we put down on paper. And each category, finances, past contracts, QA, all kinds of stuff will be scored in there. So we understand that, it's going to be a tough fight for us to do that. We're hoping to be a big player in that and hopefully get a chance, an opportunity to provide, but we're not sure.
Well, the concept of creating a loan in advance of is a little difficult to deal with. So if you talk about the time to create a loan agreement post-award, there's going to also be costs and obligations that are going to occur very quickly. Are the districts capable of using some of their reserves that they have to help create the seed money that you would need to kind of tide you through to the point of getting this pulled together? Because, talking about 90 days or 120 days, government doesn't work fast, as you know.
I understand that.
I just, has your boards discussed the option of what kind of reserve funds you might have available?
We have not had a discussion with the board about them putting financial backing into the JPA in any way whatsoever. We don't feel that we would have any cost outlay until after the JPA award happened. We think that we would be able to do everything up to the RFP to that without any cost to the county or any of the districts. After that, then costs will start coming really quick. If we were get awarded the RFP, then we'd have to instantly start doing many, many, many things, many things.
And if a loan couldn't be put together quickly enough, the districts in essence are going to be created, there's an obligation that's going to be created here whether you like it or not.
Well, what I think was going to happen personally, when the RFP goes in to get vetted by the Mountain Valley EMS agency and the board and their evaluators, they're going to look to see if a company is financially, or the public provider has the funds to do what they say they're going to do. My opinion, if there's no account, there's nothing that shows that there's money in it to do it, and Supervisor Tofinelli might have some more information on this, I would think they would say that you're not financially capable of doing it. So that's the reason why we're trying to figure out a way to show that we have the money to start to do this, because we don't have any money as a JPA. And I can assure you that the districts itself is not going to probably want, it would be very difficult for districts to say they want to put money into something that may not happen.
Okay.
And as far as here, let's just say it hypothetically panned out that there's a way that this could be done. If we don't get awarded, obviously, then we never really take receipt of those monies, or it gets transferred back right away. So I just want to say, I understand that this is a very tough ask. It's a very tough ask in a very short amount of time. I understand what's going on in our county. I understand what's going on in the state, the United States, the world. It is a very tough time to come to the Board of Supervisors and ask for money in the current situation with COVID and wildfires. We understand that. So I want to let you guys know that we understand that. Our goal is going to be to continue to provide service, to improve service. 80% of our calls are EMS calls, so we're going to keep striving to make changes in this county as much as we can with the availability of funds that we do have for whatever that may be, and we will keep doing that. And I don't know how that may look in the future, but we're going to keep doing that. We're going to keep striving. But we understand the position you're in, and I get it. I understand that. So I just wanted to share that.
Yeah,
but we appreciate everything you've done up to this point.
I'm just, the timing.
It's really difficult. And again, maybe Supervisor Tofinelli might have some information on how that would look or what would happen at the board. But I just think that there has to be a way to show that a public agency or a private company is financially viable to do what they say they're going to do. I can show them the program in detail. We can write them the business plan. But if there's nothing there that can financially back up that plan on paper somewhere, I would imagine, that would be a no-go for the evaluation at the RFP process.
Okay, thanks, Chief.
I'll go ahead. A couple things that were touched on there. Break it down. You said up to the RFP. Now, is that the RFP being awarded? Because there's a cost that goes into producing RFP and a business plan that's substantial. And I think this is one of our biggest hurdles here. So if you're going through the process and let's say that the board awarded you this loan, so let's say, for instance, that in my mind, it would be something that would be awarded at the point where you're awarded the RFP, so, at that point. So there's an initial cost for the RFP that I think I heard from you that you possibly were willing to bear as the JPA. You also did bring up another valid point that this is not going to be an easy process, that through all good work and everything moving forward, that you may not be awarded the contract. Can you afford to not be awarded the contract after investing into a RFP and a business plan that those cost substantial amount of money?
Yeah, I understand it, and I agree with you. And, if we had the ability to spend money, it would be a lot different. You might see something major right now in front of you. We don't have that. We do have experienced people that have written up RFPs, that have done the exact thing that we're being asked to do. We do, I think, have the ability to do that ourselves without having to spend money. So I feel comfortable that we can do it that way. Would that RFP look a little different if we were able to spend $100,000 or $200,000 to someone to do it? Sure, I believe it would. But I think that we can, based on the knowledge that's in this room with people that have done this in the past, I believe that we can put an RFP together that will look as good as the providers that are going to do it. I think we can.
And I do have confidence in our people across the county, and I am very pleased at how you've all come together in these recent years as a JPA and everything you're moving forward on. These are concerns of mine moving forward. Also, even with all your experience there's outside vetting by council, and there's going to be certain hurdles with the county being able to help you through that process because of the loan and other issues. So I think there will be a cost regardless of the good intent and the good work that a majority of you can be put in, that we have to consider right now.
I understand, sir. Thank you.
Mr. Toffenelli.
Thank you, Madam Chair. Is there a plan to put together a business plan?
Yes.
Because it may be a requirement when it comes to the RFP.
Yes, sir.
Yeah, exactly what your business plan is. Do you have any? Is there a time frame on when that will be complete?
Well, we're trying to do everything in steps, and I understand what you're saying. I can tell you that honestly, I don't have a timeline for that right now, and I think the position of the ALS committee was, if we don't have some type of agreement on some type of format of some way that we may be able to show them that we have access to money or actually have the money, there's really not any reason for us to move forward. I mean, if we know that we don't have the money or we can't get the money or there's no way to do that, it's really impossible for us to move forward. And it wouldn't be prudent for us to spend hours and hours and hours to propose a plan that we know we can't get because we don't have any money. So I apologize for that, but we sort of took this in a step-by-step approach when we came to you last time. Hey, we don't think we can actually apply right now, and talking to you guys about we're going to need money in the future somehow. We got to work on that, and I know there's been lots of conversation with supervisors about ways to do that. We know the hurdles. I get it. And then when we come back to this point right now, it's like, if we don't have some type of agreement, or I'm not sure how to say it, where we know we might have access to that money, I really don't think there wouldn't be any reason for us to move forward with the RFP. We might move forward with something else to improve service in the community in some form, way, or whatever. But I don't think it'd be prudent to walk out of this room not knowing and say, okay, let's keep moving forward the timeline is really tough, and I apologize for that. I wish we'd have known all this stuff when the very first RFP came out. We would have had 6 months, 7 months. We could have worked stuff out. We could have tried to figure things out. Unfortunately, it just didn't play out that way, and we also didn't think that the second RFP was going to play out the way that it did. So that crunched our timeline. It isn't something that we would have done if we had known all the information that we have now. If we'd have known it 6 months ago, it would have been totally different. And we apologize for that. And again, I understand it's a huge ask, but we have to make a decision. We're all very busy. We're all working. I'm the chief of 2 departments. I've got lots of stuff going on, plus trying to do this. And you sort of check the boxes, and if we don't have this, then we can't go to that point. So that's just sort of where we're at. And if you guys have any ideas, any recommendations, any ways it could be different than what we're asking for or how to do that, we're open to anything. We'd like to participate in the RFP process, but we understand we might not be able to. And we also understand even if we do get some agreement on money, we still might not win the RFP.
Well, the reason I ask is your statements here that you're going to increase from 3.5 paramedics to 7.
Correct.
That's a big step, because right now, even if you were to get all of the paramedics from ALA, which I don't think you're going to, because ALA services Amador also, that's a total of at least 11 right there for the 24-hour period. You're asking to put on another 11 to get up to where you're saying you're going to be in order to get to this presentation of the money issue here. And it's very difficult without some type of business plan showing how you're going to get to that level in steps or however you're going to do it. I mean, I'm sure there's not 22 unemployed paramedics out there looking for a job right now. So we're talking about some type of plan coming forward. And I'm not saying it has to be a specific plan detailed completely out. But if you're going to come and ask for a loan anywhere, I don't care if you're I'm going to get a car loan. There's certain requirements that I have to have in order to qualify for that loan. And I'm certainly not opposed, but I need a little bit more information than what's being presented here to us about how we're going to get to this level. If you get the RFP and you're successful in your bid for the RFP, you're only going to have about 90 days to get everything in line to go into service. Somewhere in that neighborhood, well, maybe a little bit more. I think it opens October. You have till March 31st, so you're going to have a little bit more time than that. Once March 31st comes and you're online, you have to be a provider at that point, completely in line, completely ready to go, completely ready to service. And that's, you have to be, because you've signed the agreement for the RFP. And you know, I have full faith in all of you to do it. I'm willing to support all of you. I always have. I supported this whole thing from the beginning.
Thank you.
I thought we would have a little bit better of a presentation here when you came forward, at least explaining some more about. I mean, I've read through this, and
I understand what you're saying, sir.
And I'm hearing what you're saying, and the JPA is 7 districts?
9.
9 districts. Of the 9 districts that are willing to participate in this and put together this that shows the amount of money that they will be bringing in order to get to a certain point. They're not willing to put a dime in to at least go forward on it is a little disheartening to me. You're asking somebody else to put in all the money, and if it doesn't work, it doesn't work. I mean, there's got to be something coming forward here to where, I know you guys are on a very, very tight, very strict budget. Some of you, we just had an election here in San Andreas, and it didn't go through. But there's got to be something here, and I was maybe under misconception of what was happening on the first part funding of it to get a regular RFP and a business plan together, the $125,000 or whatever it was that was needed to do that. Is there any other way that you guys could come up with some funding to put forward initially, to put together, that you can show the county that you are willing, you guys are all serious about this, that you're all wanting to go forward with this, and you're do your due diligence on your part to make sure that we can have a good RFP coming forward and a good business plan coming forward that's going to be vital to any RFP, regardless, when you present it and if you win it.
Okay. I'll let Rich talk here in just a minute. I just want to comment on a couple of things you said. As far as the money goes, we can't even staff our fire stations right now. So I pay my guys $4.90 an hour. Okay, we all know that's just unreasonable. So to go to ask the departments, and you know who they are, people just lost funding stuff, I think that is just not a revenue stream for us. There may be other revenue streams, but the districts are having a hard time just covering their own calls in their own district and covering the dirt. So I think that's a very hard ask. I don't believe that would happen if I went to all 9 departments and asked for that. I think they probably wouldn't want to do that at all. But I understand that. As far as employees and hiring, exactly what you said about some people might go from here over to Amador. I think we'll have Amador ALA medics want to come over here. I think that when you put out a fire department's running a paramedic program, it's very rare that you don't have multiple people wanting to come up and to apply for that. It's a little bit different than a private company. We can all speak for that. We've all been in private companies. We've all worked for the public. We understand the difference when there's a job announcement for private paramedic and fire department paramedic. Everybody goes for that job over there. So I feel strongly that when we know we have the ability to move forward on day one, all the things that you're talking about, before we even get the RFP going, all these things are going to be happening super, super quick. And it has to be quick. As you said, we're in a very short timeline. But there's that decision tree for us on if these are possibilities, if it's not a possibility. Again, if there's another way, other ideas that the board has to help us with that or anything, we'd be willing to listen to that. But there just comes a point where we can only go so far knowing objectively what we're capable of providing. I mean, right now we're not capable of providing anything. We don't have any money. You know? So I apologize for that. I know that's maybe not the best response, but I can assure you that this team here is dedicated, that if we are given the opportunity, we will write an amazing RFP that you will be proud of coming from your fire departments in this county. I know that Mountain Valley will look at it and go, man, this is their first RFP. This is a pretty good job. I mean, they're probably, I think they'll like it.
Chief Johnson, I'm already proud of all of you.
Oh, thank you, sir.
Immensely so.
Thank you. And I can't overemphasize, I appreciate just the first meeting to have the discussion and what the board did for us to allow us to have the opportunity. It's just unfortunate that now we're at the point where if we don't have an idea on how we're going to be able to fund it, it's really not possible for us. And then we need to look up for other ways, other avenues, or other ideas. And we understand that. We're realists. And our relationship with you guys and us working together as a team has grown so much, and we're enjoying the current environment.
So let me ask you this, Chief Johnson, giving what this you gave us and your projections.
Yes, sir.
What is the amount that you are asking for?
That's not my fire chief.
It's actually Chief Rohrbacher.
Oh, I'm sorry.
That's okay.
I'm sorry.
Okay.
I had Mike on my mind for some reason. What is
It's all good.
what is the amount that you're asking for as you stand there today?
Okay, so our initial, if you look at the numbers, you can look at them yourself, you can see. The reason why we asked for 3 million, excuse me, and it is in the document that I gave to you, but the reason why is you can see the first 8 months we're looking at 2.5. So, and we do think that covers it. So we feel, I mean, when it comes down to it, we could probably do it for a little bit less than 3 million, but we want to make sure, like some of the things that Supervisor Stopper is talking about, in that money, I'd like to be able to use to help create maybe a better product. Doesn't have to be. But I can tell you the drop dead number that we would need really is, 2.5. I mean, that would be the drop dead number.
Okay.
You know, but 3 million would make it so we wouldn't be stressed out. And I've already pulled all my hair out, so I can't pull any more out.
The next question is, under your projected cost for the first year, vehicle and lease equipment, $408,000. Projected $612 for the first year.
Correct.
Initial startup for the first 8 months. What is that?
So what we did is we took the overall for vehicles and equipment. So to try to keep the price down, instead of purchasing all brand new apparatus, which was substantially, it would be another $1 million that we'd have to ask for, we worked with leasing companies to figure out how we could lease these ambulances and what that cost would be. So that is a cost for basically a 5-year lease. We have to do 20% down and then do a 5-year lease. And it's also the cost for equipment that would be on the ambulances. So that's what that is. And it's divided, it gives you the total annual at the end, and it shows what it will be in the first 8 months, and then the last 4 months.
And those vehicles are there's requirements in the RFP for those vehicles.
Yes.
And so when you got your quote for the leased vehicles, you went forward with those?
That is correct.
Okay.
We're perfectly aware of all the requirements for California ambulances.
Okay. And your projection for fuel and maintenance was based on those vehicles versus the amount of calls in the call logs?
Correct. It was the history. We put that between 2 different agencies, between ALA and also Ebbets Pass, and we sort of merged that together with the numbers. And we believe we've overinflated that cost. So one thing, well, I don't want to get into that, but
it's okay. Yeah. And under billing, you plan on hiring a new employee specifically to do billing?
Correct. And it depends. We will have to design how the overhead positions are. That plan was set up by an outside firm to do the billing for us. It's the same company that does Ebbets Pass, and that's how we came up with that figure based on the call volume, based on what they're charging Ebbets Pass.
I don't have any more questions right now. Thank you, Chief.
Thank you, sir.
Yes, I do understand the value that firefighter paramedics bring to the overall organization and how it helps to actually draw new people into the system and provide you a more robust working underneath, because these people, once they develop a work history, have an option or an opportunity to go anywhere. It's really a great challenge. Let me throw out 3 options here. What about an agreement in principle? In other words, if this board was to work on bringing forward some type of an agreement in principle that wouldn't be activated unless you actually you won the contract, that would be one way. Another option would be a letter of credit.
I'm sorry, what did you say?
A letter of credit.
Okay.
In other words, what we'd be saying here is that what assets could we encumber within the district, such as maybe all those $250,000 Butte Fire money, where could we go to encumber some assets to give us some, like a bank would?
Okay.
The third way would be, think of it like a construction loan, where you would be drawing on the progress. But again, you'd be looking at an asset. You have to have some assets to back it up. For us to just throw $3 million on the table without having anything as an asset to back it up is going to be a very difficult situation to explain to our voters or to anybody.
Sure.
And I fully support what you're trying to do. But I'm trying to work out how it would structurally work in the time windows that we have to work it.
Right.
So I'm just throwing these three options out, and maybe the rest of the board would have some ideas based on what I just said.
Yeah, I would say, Supervisor Mills, that we would be open to any possible ideas. I would probably defer to Supervisor Tofinelli and the Mountain Valley EMS board, or for him to say, is that something that would be reasonable in an RFP? If they show, and I understand what you're saying, I get it. If it shows that they have $3 million of credit available with the county, and maybe there's a way that the county keeps the money, we'd make draws as needed to do whatever we need to do, whatever. But I would defer to Supervisor Tofinelli on how that would be looked at Mountain Valley. Do they have to have the money in an account? Do they have to have it maybe available? Is the county committed? Do we have a letter from the county that they will fund them? I wouldn't know how to, but I mean, all three of these options, I understand what you're saying. And again, we're open to any possible way to potentially make it work, because the ultimate goal is for us to save lives here. And it would just be amazing to see the medics in places they've never been in before for your...
I didn't just throw this out there to you. I threw it out to the rest of the board for them to discuss as well. Thank you.
Thank you, sir.
I have some questions that maybe the CAO or Krista could help answer. Where are we at with the PG&E money right now? How far off are a lot of the projects moving forward with that? Because those are our first obligations as a board, as we've already given our word that we're going to fall forward with that. That's a question I strongly have right now through this process. And then, out of those three things that Supervisor Mills just brought up, the only one I personally am willing to consider moving forward is the intention of loan on reward of RFP. At this time, without anything being provided further on. But my question to the CAO: where are we at with the PG&E money?
I'm not sure of the specifics of the question, but if you recall, for the PG&E money, the largest sum of money was committed to public works and road repairs in the burn scar area. And so we haven't really started to draw that down at this point in time. And I see that Director Pack is also in the meeting, but that's the majority of the money that remains from that which was committed by the board about a year and a half ago. Most of the monies committed to outside entities has been expended to this point. And if you recall, much of it was to the fire districts, and many of them have already procured their various fire engines and response vehicles. So that which we have committed to anything other than roads is primarily expended, and the roads, the commitment to the roads and the expenditures for the roads, I'll oversimplify it, and Josh can clarify more if need be, but that our expenditure plan for roads funds from the PG&E settlement has been advanced, basically, I think, on concern that we wouldn't have the same state dollars that we would have had pre-COVID. So Josh has kind of flipped into action on expending the PG&E money.
I'll defer to Mr. Pack on where he's at with the PG&E roads going forward, please. If you're willing, Mr. Pack.
Sure. First of all, good morning, Madam Chair and Supervisor. So, as a matter of fact, as you came in this morning, you saw one of the projects of the Butte Fire Road Recovery and PG&E affecting your time in, because Mountain Ranch Road is part of that. Construction started this morning. We are in the middle of phase one. We have a large number of projects that are either under contract or already started construction. We are anticipating at the end of this year to have expended roughly 90% of the funds. We anticipate having about 1.5 million left in available PG&E reimbursement funds for a phase two project that'll begin in 2021. So we have expended most. We have a couple of projects that are either online or starting online here in the next week or two. Again, between all the efforts that we've done this year and what we're anticipating to finish by the end of the calendar year, early into 2021, about 1.5 million is scheduled to be left.
Thank you.
Yeah, I want to clarify a couple things. Your intent to serve the two districts that this covers, this RFP covers, is your intent to at least put one ambulance in each fire district?
Well,
Or
that would be 10 ambulances. So I'll tell you, we go through this one more time. So we have an ambulance in Valley Springs,
correct.
ambulance in San Andreas,
Correct.
ambulance in Angels Camp. Those are there all the time, right
Right.
now. We staff those exactly the same way. In addition to that, we would put an ambulance in Mountain Ranch.
At the fire station?
At the fire station. We would put a QRV at West Point. Either that means they'd be in a separate vehicle up there so they can respond to calls, or on the fire engine, a paramedic up there. Okay, figure that out. And then we would have a paramedic in Murphy's. So either a QRV or a paramedic on an engine. And then we'd also have an additional ambulance in Copperopolis. And basically, then they would move around a little bit. So the only place that wouldn't have a paramedic, as I'm looking at it right now, thinking about it, is probably McCollum Hill, unfortunately, right now. I mean, but that could change. I mean, if our projections are correct, which we believe they are, and we think we've underdone it, so there would be no reason why the second year we could actually put a paramedic in Moke Hill. I mean, we could be able to do that. I mean, as our projections on revenue are, we could potentially add 3 more paramedics in the system if the system maintains itself the way it currently is, and with an increase of 3 to 6% on call volume a year. That's potential for more funds available.
Okay, and I want to be specific. Thank you for that information, but I'm not specifically talking about paramedics.
Okay.
I'm talking about transport vehicals.
Transport?
Because paramedic is one thing that can go and administer.
Right.
But if that person needs to be transported,
Right.
the transport times are
So we would add 2 paramedic ambulances, 2 ambulances into the current system. So we go from 3 to 5.
Okay.
So we're going to add those 2. Your question on ambulances versus a paramedic, I understand your point.
Yeah.
Okay.
Yeah.
The most important thing, if someone has a problem here right now, is for me as a paramedic to start working on you right away to do stuff. It might take 15 or 20 minutes. So if that ambulance is coming from the next jurisdiction over, when they get there, when I would be ready to load my patient, we're going to be doing the same kind of thing. But that paramedic will be there. And up here, what we want to encourage our paramedics to do, anytime there's a critical patient, we try to do that right now, that the helicopter needs to be responding to transport those critical patients to the valley as soon as possible.
well,
So
not
we would
always.
add ambulances to the system.
Not all those transports are helicopter. So with
no,
the 5
I
ambulances
agree.
that you have, you may have 1 or 2 transporting out of county to San Joaquin or to Sacramento or whatever.
It could,
And the others have to cover the area that's there while those are in transport.
yes, I completely agree with that. And it's the same right now. They have 3 ambulances on 24. Every once in a while, they have a 12-hour car during the day. It's the same thing. We hear it all the time. I mean, we know when it's happening. We hear their ambulances transport to UC Davis, transport over there, and then we know we're down, and we know we're waiting for an ambulance. So that's why I think it's important for us to increase the amount of ambulances. So by increasing by 2, we wouldn't have the draw on it as of right now with only 3.5 or 3, depending on what time of day it is. So I think that it's a major benefit to the system.
Well, I will say that I support the fact that you guys are willing to come forward and tackle this RFP. I think it's a benefit to constituents in this county that the more paramedics we have available will save more lives. Even the transport vehicles that are here, willing to put those in, will save lives. Having a paramedic there, yes, will save lives. But if you can only do so much. If that person needs to be transported, the quicker he can be transported, it may save his life.
Right. No, I completely agree with you, sir. And as let's say the second year of the program goes in, then that could change easily, because a QRV is going to cost about $240,000 a year for that one paramedic. So we could add another $200,000 to that and make that an ambulance the next year. The ambulance or the QRV that maybe is in Murphy's, the next year we could put $240,000 into that and make that an ambulance. Now we have 7 ambulances, and based on the current data, we would still have over $1 million in revenue coming in to keep working on the system and improve it. Our plan is to make sure that we can pay for everything, cover some of the key positions at the top level, and then continually use that money to improve the system. And that's all of our money. We're not trying to make money for the fire departments or the JPA. We want to take all of that revenue, put back into the system. So when there's money that when we do our reviews and we look at stuff and go, oh, we're doing really good here, then we would improve the service. It would go right back into that. It wouldn't go into any other thing, sir.
As far as the RFP and the qualifications for the RFP, they're spelled out in that RFP specifically.
Yes.
So there won't be any deviation from that as far as being qualified for it. I would be interested in, of the 3 items Supervisor Mills brought up, provided that you are awarded the RFP, that we have a line of credit as you use it and invoice it. We could go forward.
Yeah, I understand that. And again, I mean, you're probably the most knowledgeable person for Mountain Valley MSA board. If you think that that's something that would work out in the RFP where they would say, oh, okay, we understand. They have a line of credit to do whatever they need to do to make this.
Well, the line of credit would mean you have the money basically in the bank.
Yep.
So, yep.
Can I ask you a quick question? Thanks. I haven't asked a question yet, but thank you guys very much. Hey, we're putting you guys through the 10th degree here on asking some very specific questions.
Sure.
But I think we better ask ourselves a question. Where is this money coming from? I spent my weekend looking at this budget, trying to find the hidden pile of money that has no obligation for the next 2 years at least. And maybe before we put you guys on the spot anymore, we ought to go on the spot rather than, you're looking for clarity for your business purpose.
Yes, sir.
And we're asking you a lot of questions, but we don't even know if we could step up.
I understand.
That's not really fair to you. So let's take it back on us. And I'd like to know who's got $3 million sitting around.
Thank you, Jack. That's why I asked Mr. Pack about where we're at with the PG&E funds. And, it's as simple as $1.5 million going into 2021, and that money's already obligated, which is within your 2-year period. And it makes it as simple as this. Unless we got a special tree or fairy dust, as some people will say, we don't have it. Pixie dust. Sweet. We don't have it.
Right. So we can't do a line of credit or any of these things. So I'd like to know what you got planned.
Yeah, sorry.
I'd like to know what you guys got.
What about the option of talking to the auditor and find out what she might have as ideas, if that's an option?
Well,
We're sitting here right now.
We're going into budget hearings this afternoon and tomorrow. Why can't we address this? I understand what the chief is saying. He doesn't, or the JPA does not want to go in and do all this work if they don't have any kind of financial backing.
Absolutely.
So what I'm hearing him say is if there's some kind of commitment on behalf of the county, they could proceed. We are saying we want to see a business plan. So who's out there first? If we could say, yes, we would consider funding or anting up some kind of money based on your business plan. If we don't care for the business plan, as Mr. Stopper asked first thing out this morning, then we're not obligated. So there's two parts. There's, do we have the money? I don't think there's any question that we support the intent of the JPA. But the question is one, we want to see a business plan. They don't want to do a business plan unless we can somewhat commit to the money. We cannot commit to the money until maybe we look at and keep that in mind when we do the budget hearing today and tomorrow. That's kind of
Right.
how I see this.
I don't want to waste people's time.
I don't either.
We could talk about this all day, and it's a great idea, but unless we got any money, it's skin to put in the game.
I know. Chief Dickerson, did you want
Yeah, thanks for letting me talk for a minute. I want to thank John.
1 minute? Okay.
Yeah, and bottom line is, I feel like you are wasting my time. I got a lot going on right now. With PG&E shut down, with all my crews out, with everything else I got going on, all we ask for is can you loan us some money? That's all we asked for, nothing more. We gave you a brief plan, and the bottom line is the other provider, they didn't come through on the original RFP. That's the bottom line. We wouldn't be standing here if that happened. Now, with all of our experience, 40 years of mine at paramedics, I told you, and I said it over and over, we'll get it done. We're better than we ever have been before. We're unified with all the boards out there, the directors. We want to move forward. This is about saving lives. But what we're trying to show you is we're not standing here like ALA, and I don't care if they hear me, but I'm renting a spot with them in my firehouse down at Company 3. I have a good relationship with them. They can't make any money. They're not going to make any money. They're watching us because we have positive cash flow when we get started. But we need to have seed money. And I am not going to put up any of my money when I know that I'm probably not going to get it back. We'll write the RFP on our own. That's your business plan. That's your business plan. That's going to be a lot of time that I'm going to willing to give, but I'm not going to write an RFP and put it from you right now as a business plan when I don't have any seed money. That'd be stupid on my part. I got to have backing. It's no different than me going to a loan company to put a pool in my backyard. It's all I'm asking for, a good credit. Give me the loan. I'll put the pool in. Your job is to make sure that we pay you back. That's all. My plan, how I'm going to do it, all I'm required to do in this RFP is do exactly what it calls for is, sorry, but 3.5 paramedics. The extra paramedics we're showing you with the money, that's forward thinking where we're going to go. We're building a roadmap for success. Everybody else is just coming to the RFP, 3.5. That's all we're obligated to do on this RFP, is 3.5. The extra, we're not going to talk about that in that RFP. That's going to come with the extra money flow that we have. So yes, I feel like you're wasting my time. All I needed to hear was, we got the money, we don't got the money. You don't got the money? Thank you very much. We're on our way. But I promise you this, we're going to move forward. We're going to come with something. I'm not going to stand down as a fire chief and let this community continue to erode the level of ambulance service that is going on in this district. And you can see the numbers and watch what goes on with it. So I'm here to make each one of your districts better. I'm here to make sure that everybody in this community, in the Calaveras County, gets a better level of service. That's what I want. That's what I'm pledging. Just give us the money. If you don't have it, we'll find a different way to do business. But we're not going to give up. We're not. That's my minute.
Thank you, Chief. Mr. Garamendi?
Just
where's the money? Okay. Mr. Mills, did you have something?
Yeah, I think that we include this in our budget discussion, and we will find out then exactly where we're at and what options we have. We'll play those out. You'll know by the time we're done with budget where we're going to go.
When will that be, Supervisor Mills?
Tomorrow.
Today and tomorrow.
Okay. All right, so that sounds fine. I mean, if somebody can, people, I mean, I know Dennis, you know, you've got my information, you can let me know. I know people have Rich's information. I just want to close with, again, thank you guys very much. And we know it's a tough ask, I get it. I can guarantee you, you know, I was a paramedic in the Bay Area for 30 years. I was a county supervisor down there running a system that ran 250 calls a day. That's how many calls my paramedic service ran down there. We can design a Cadillac system for your community, and we can constantly improve that and save lives for all the citizens within your district. So in closing, I just want to thank you. I understand the position. I respect it. I get it. And we will move forward, though. I want to let you know that. That's what we're all about. Again, 80% of our calls are emergency medical services, and we want to improve the service to those patients. So we'll be continuing to work on that. So
Thank you, Chief.
thank you, guys. Have a great day. Thank you.
Mr. Stopper.
Was this, I'm sorry. We have it as an action item, or as a matter of process, I'm asking, Madam Chair, do we want to push this till after the budget, to continue this till after we're done with the
My
budget?
recommendation is that we make it part of our budget discussion.
Okay.
So that we have some kind of feel of where we are. They're asking for 3 million or 2.5. Let's go for his bottom line and see where we are in the budget, and then we'll get back to him and make it an action item, yes or no, through the budget process.
Thank you. I was curious as to where you're going with it.
That's where I'm going.
I'll agree with that.
I definitely agree with that. And one other thing to address all of you is there's no doubt that you're working to do better services across the county. You know, and the very question that we have to ourselves is, do we have the money to do it? Because if we had $20 million extra dollars out there, I'm sure we wouldn't be sitting here nitpicking it to death right now. That's where I'm at.
Thank you, Chiefs.
Thank you, guys. And just for information, this is the RFP that we're working on. It's that thick, so we put a lot of effort into it already. Thank you, guys. Have a good day.
Thank you. Is there any public comment on this item? Okay. All right. None. Thank you, Chief.
All right, take care, guys.
All right. Okay, I want to just leave the number up, please. Again, I want to remind the public, if you have any questions or comments on any of the regular agenda item that we're going to, please call in, and Ms. Glanville will open it up when we get to that particular item. All right, I'd like to move back to item 16, board letter to California Governor Gavin Newsom. I believe Supervisor Stopper wanted this. Mr. Stopper, did you want to take the lead?
As we know, moving forward, it's been very fluid. Things change week to week. You know, there was definitely more questions. Some clarity was provided by the governor the following Friday, but you know, there's ongoing questions moving forward, different applications of where we're going, and better definition to be asked for. I sat down and I started to write multiple ideas of letters, but I thought, you know, I kept going a little strong, in my opinion. So I, you know, deferred to, especially after the update by the governor on the tiered system, I deferred to talk with the board and see if it still had the intent, and then if it does have the intent or the want to, what do we all want in it as a whole, and then draft it from there.
Is there anything you want particularly in a letter?
Well, yeah, definitely. There's a myriad of things here. I could go to a few things I have asked before that I have written here in my notes. I can go to, the application to businesses is one of my biggest issues moving forward on how it's defined. I mean, from very day one, everyone, when the governor came forward, everyone jumped right in. I mean, he said jump, and everyone's like, how high? And we bottlenecked everyone into grocery stores because they're there, and there was no masks in the beginning. Of course, people need to eat. That was it. But these other places, it's basically designed to hurt small businesses. Corporations are pretty much immune to it for the most part when it comes to like Walmart, Target. None of those have been closed down. Even if they don't provide food. So, it's the design of it, how it applies to different areas. I see constantly people bantering back and forth, masks, no masks. I believe masks work. I believe masks help to a certain degree. It's not a question in my mind. What it comes down to is all these areas that have been more strict, San Joaquin County, you can go down to the Bay Area, they're all in worse condition than we are when it comes to the tiers that have been moved forward. Rural California is different geographically and everything else compared to everywhere else. And I think something to that point is more leeway for us to apply the safety standards in rural California as opposed to urban areas is the way the letter needs to go. Also, I brought up that none of this has been brought to the legislative process, which, is in part due process. There's been conflicting things with the law moving forward that have been brought up multiple times on different issues. And, like I said, Marita, I started to write multiple things. I think I was being a little too strong. And I don't think, I'd rather not shoot myself in the foot trying to project, and I would like to provide answers instead of complaints moving forward. So,
So are you recommending that the rural areas, in particular Calaveras, can set our own definitions for businesses that are open and closed?
Yeah, partially. I do think it is an idea that needs to be considered. Far too often laws are put forward in California with a one-size-fits-all. And California is far too large and far too diverse to put forward something like that.
But in this case for COVID, do you want to make the decision, or do you want Dr. Kaleda? I mean, what are we asking the governor?
That's a conversation for the board to have, Marita. And if they aren't interested in writing the letter, then so be it.
Okay. Any supervisors have any comments? Mr. Mills?
Yes, I've, maybe the word is harped for quite some time, that not everybody is having this imposition on them equally. That, if you're a Lowe's or a Home Depot or, I remember the parking lot being full at Lowe's and Sonora to where they literally had to find ways to move cars around because we weren't applying the rules equally throughout the system. When you're in the EMS and doing medical aid calls, you do the same thing no matter where you are. Everybody does it all. But when we and I've referred to the point of hotspots, is that you try to identify where is it that, what's creating your problem, and how do you focus in on that? So is it a district? Is it a healthcare system or like Avalon? Where are we most likely to have the problem? But the point is that whether you're talking about going out and recreating in our national forests or our state parks or local resources, whatever, are we all doing it the same way every time? No, we're not. And that's part of the problem is that, you know, I'm seeing a creation of this, you can do it, but you can't, and this piece can do it, but this is limited to do that. And it's micromanaged down to the point of, why can't there just be a blanket statement? Everybody does it the same way. I don't care what kind of business or what activity you're in, everybody does it the same way, and that's it. But this idea of staying up at night thinking about all these different ways to make different businesses do different things is almost a sanity check to some degree. So I'd like to have some kind of discussion about how do we are rural, but we have people who go into urban environments. And if they get so used to doing it their way here, are they continuing to do it that way when they get into the urban environments and, in essence, creating an additional issue? So equality has to be part of this discussion.
Mr. Garamendi.
Thank you, Madam Chair. And Ben, you and I have talked about this for months. The level of frustration is incredibly high for everybody. I think we all recognize that we're different and we think we could do things a little bit better than I think the state, and I would agree with that. However, as you also aware, RCRC sent out a letter, and we went through a very long deliberative process of 36 rural counties with all kinds of very angry ideas and feelings about equality, how things are rolling out. We finally scoped out a letter to the governor that led to the general, let us try to figure things out, a little more flexibility for the rural. And I'm pretty sure that 36 counties didn't get a response from the governor's office. So while I share the frustration big time, I'm just not so sure we could go through a really long process. And I don't know, I don't know if it's going to do any good. I'm not so sure the governor particularly cares about Calaveras County and how we feel about everything. So I'm willing to go through the process, but I would like to know what we expect as an outcome. If we expect to make a statement to our constituents, that's one thing. If we expect to change what the state of California is doing, that's another thing.
Well, we already made a statement when we said we weren't going to enforce anything.
I would agree.
I don't think anybody here other than you said we aren't going to enforce anything. I think we have a educational enforcement approach right now, Marita.
No, we don't. We didn't
we don't?
support it.
No, we did support an educational approach. We didn't support a fine process and a business prosecution approach.
We had an item before us, which is what
Right.
you wanted, not what I wanted. It's what you wanted, and there was no support for it. So, there is no process. As I have, and I don't want to go into that because that's not the issue. The one before us a week ago was what you all wanted. So what is to be gained? We did the attestation. We have accepted the CARES funding. The rural counties have done their job through RCRC. I know we're frustrated. I know Mrs. Stranger is frustrated. And I know Dr. Calaveras frustrated. So unless we want to say that we will manage the COVID-19 scenarios ourselves, then I'm not sure what writing a letter. Going to the tiers has helped. At least we're sort of evolving in this very frustrating process. For the most part, I think the businesses, we're having to rely on the businesses to help us through this process. Do I think it's fair to the businesses? Absolutely not. because most of the businesses, that's not where we're getting the virus, or that's not where it is. And listening to Dr. K, it was, 1/3 were family gatherings, or gatherings, 1/3 were from outside the county, and 1/3 he hadn't a clue where they were coming from. But it's taking the businesses to help us through the process. Do I want to go purple? Absolutely not. It takes all of us as a county. So going back, what is it that we are asking the governor to let us do? If it's just to make comments that we think we need more clarification, I think RCRC's done that. Also, as a sidebar, the Rural County Caucus is meeting with Dr. Gailey, did I pronounce that correctly, tomorrow. And I am more than happy to submit comments to the doctor on behalf of Calaveras through the Rural Caucus, if you would like to give me some.
I mean, I've written a letter, like Ben has probably drafted as well, a very angry letter many times. The problem is by noon the next day, half the things I was complaining about might change. So it's a little hard to keep a moving target on this. So I feel the frustration.
Right. Well,
I just don't know.
What is it we're asking for? I mean,
What do we do?
yeah, Ben's comments had come before we went from the monitoring system to the tier system, and as he said, the tier system had kind of changed things. But again, what are we asking?
I think more so, that comes with the comments that were made during that board meeting. I think the governor is partially listening and not necessarily always answering, other than with action to put out fires after they're started, because we weren't the only ones to bring it up. Orange County was one. I can bring up a couple other counties that brought it up at the very same time, that the frustration was there. Santa Cruz County had just come off the monitoring list at that time. They had no clear path to opening businesses up further. I'm going to go back to Jack's point, because I do agree with him. And to the point where things have changed so significantly since 2 weeks ago when I brought this up, that, are we wasting our time right now discussing this? We can come back to it again later. We can write something up and they might address it by Friday, and the fire put out, and then we're just, a bunch of words on a piece of paper that, that's never going to be answered again. So, frustration's there. I think that did need to be discussed. I'm willing to retract the request to write a letter if that's the intent of the board. And we have so much other work we need to get to that I'm willing to put it to the side right now so we can get to it.
Well, I think we have two options. One, we can always go through RCRC. And if you have some things you want, I will submit them today so they can be discussed with Dr. Gailey tomorrow.
I mean, Madam Chair, things are moving so quickly. The fact that you're going to talk to them tomorrow is great. Having watched the birth of a letter from RCRC with 36 different opinions,
I know.
5 would seem relatively easy, but things are moving so quick, and we don't get too many asks.
Well, when we were at board meetings, CSAC board, he was at the board meeting, Zoom meeting. And the rural county supervisors, we all were saying the same thing, pretty much, again, what RCRC did. And he said he'd be willing to meet with the caucus. So that's what's going to happen tomorrow. We already have our budget meeting, so I can't be in on it, but I can submit some concerns or questions on behalf of the board, if you have some.
We can do the budget hearing without you. You can go.
Okay, that's fine.
Ben can be, he's vice chair. So.
I can do that. That's your pleasure.
I would certainly, when you go tomorrow, Madam Chair, I would certainly encourage them to give us some flexibility to deal with where we're at site-specific. I mean, you don't need to close, you don't, if I've got an isolated school, it's in an isolated community, we should be able to figure out a way to keep that community
That's
safe
correct.
and keep it going, or deal in places like West Point. It's a little more difficult when you get down closer to the San Joaquin border. But, I would like to have some flexibility. And I'd
And
like,
so, and what does that flexibility look like?
I would leave that to our experts, but I often feel like we're a bit constrained. So I don't feel like I'm qualified to say exactly what that looks like.
I don't know. Well, if any of you have any comments that you'd like me to submit on our behalf, you can give them to me today.
Most definitely. Thank you, Madam Chair.
Okay, so
It-
Mr.
is-
Stopper, did you want to withdraw this item at this time?
If the rest of the board's okay with that, I do want to withdraw it at this time.
Are you making a motion?
No,
Yeah.
he's just making a request.
It's an action item, got to make a motion.
No.
I'll make a motion.
Mr. Stopper pulled.
Look,
Go ahead.
because of the timing, I would like to make a motion to withdraw the item.
And I'll second it.
Motion by Supervisor Stopper, second by Supervisor Mills. All in favor?
Aye.
Opposed? Passes on a 5-0. What time is it? Oh, you do? I'm sorry. Thank you very much. Needed that. Okay. The vote might change. Thank you.
If you'd like to make your comment
Very
now, please
good.
go ahead.
I would like to make my comment. Thank you very much. I assume that you can hear me? Please
Yes,
respond.
we can.
Oh, very good. I want to address some things that you folks have just said. First off, I believe Mr. Garamendi said that in conversations with Mr. Stopper, they went over a few things and they thought they could do better. Well, the thing is, you did nothing. You didn't do better. And when it comes to this educational approach that Mr. Stopper talked about, that we do have a policy of educating, we did nothing. If you consider a few press releases education, I do not. There was no mailings, there were no postings, nothing that I would consider outreach to the public. Now, I think it was very brave of you folks to come forward with this idea of writing a letter because you thought you would get no response. Maybe you should write a letter. There are people that might listen to you there, and there are people that are harsher than me in this world. And I would love for you to write a letter and to see what kind of response you get. Thank you very much. I've been here all morning. I just took a trip into West Point to check out the PG&E Resource Center. The PG&E workers are not wearing their masks and not practicing social distance, but maybe they're in a social bubble or something going on and not expecting anybody to show up. Have a wonderful day. Take care, and best wishes.
Carl Stoughton, thank you very much. I recognize your voice even though you don't introduce yourself. Are there any other public comments? Okay, thank you. I'd like to move, maybe, just give me a moment, please. We'll be going into budget hearings on item 17. Mr. Alt, did you just want to do a brief introduction and then we will take a break for lunch?
Excuse me, Madam Chair, why are we doing 18 and 19 after?
Because we can't do 18, 19 until we discuss the budget.
Okay, all right.
Mr. Alt, did you want to you have 20 minutes if you want to make because we're going to stop at noon.
Well, yeah, I mean, that's your prerogative, Madam Chair, but you may also take a break early and come back 20 minutes early if you want to take it all in whole.
Okay. we'll take a break now, and we'll be back at 1 o'clock. Is that fine, gentlemen? Robin? Okay, thank you.
Usually when we get through the first paragraph, before I'm like, ooh, okay.
But yeah, you can just kick it straight to Krista when we start, so we don't waste any
Okay,
undue time.
got it. Thank you. Get the flower press out.
Yes, out of the back of my wife's car. This is, looks like a breast cancer test.
I'll stay out of the back of your wife.
Tell me. Okay, I'd like to reconvene the meeting. We're going to start the final 2021 budget hearings and direct staff to return on September 22 with county budget resolutions. To take us through this process, Ms. Von Lotta, would you like to proceed, please?
I will. One moment for me to share my screen. Do you all have the PowerPoint in front of you?
No.
Uh-huh.
You have the paper one.
Oops. Sorry, pardon me. Try again.
I can send Ms. Glanville over. She's become an expert.
There we go. I think
Okay,
I got
thank
it
you.
there. All right, you can see it now?
Yes.
Okay. Trying to, I do apologize for my technical difficulties here. Okay, so welcome everyone to the budget presentation for the fiscal year 2021 final budget. An overview of the presentation. We will begin with the overall budget message, move into the budget landscape, discuss influences on the recommended budget, give a revenue snapshot of the general fund, discuss budget requests, have the structural deficit conversation, and then present recommendations. And so with that, I will move forward into the overall budget message for this current fiscal year. So we directed and requested the department set forth a status quo budget. That generally was the case across departments. As you know, when we went to balance in order to make up the shortfall, we did recommend at the June budget hearings to make a 5.3% reduction in order to balance across general fund contributions to our departments. So we did not determine to revoke or rescind that recommendation, and that 5.3% cut remains. I'd like to note for the board and the public that the narratives have not been updated. So there were really, other than fund balance adjustments, a handful of changes made throughout the budgets, but those changes have not been included in the department narratives. So the budget overall is balanced. Reserves are above board policy level, which is actually 8%. So to more than 2.5% above the policy minimum. Contingencies are above the board approved policy level at 6%. And the policy minimum set by the board is 2%. so substantially overrun with respect to contingencies. The general fund reserve in dollars is at $5.4 million, and that's about $1.3 million more than the policy minimum. So we have continued with our conservative revenue assumptions. We have not revised any of the general fund revenue assumptions that were brought to you in the preliminary budget hearings. We are recommending an increase to contingencies in the amount of $4.17 million, which again is about $2.78 million more than the policy minimum. And we'll get to that later in the discussion, but the CARES Act funding has a lot to do with that number and our recommendation for it to be the delta of what hasn't been used in this current budget to be stored safely in contingencies until more information is known. And then generally recommending that we stay the course, and of course as new or material information becomes available, we will bring updates to the board as we move through this unusual year. So in terms of the actual budget landscape for our county, we have the CARES Act funding, the $4.59 million that we have budgeted as revenue in this budget. We are borrowing from special revenue funds, so examples of that are our teeter transfer to balance and our REM loans that we are currently budgeting in order to backstop the disaster budgets, and then generally other reductions that we've made, for example, with respect to our revenue assumptions in the light of coronavirus. And so just as a reminder to everyone, back on March 30th of this past fiscal year, in light of the economic uncertainty facing this and every other county, we directed departments to chill open positions. And so what that means is that when a department seeks to fill a position, they email the administrative office, the CAO, myself, and Human Resources, and we make a case-by-case determination about whether it is mission critical for that position to be posted and hopefully filled. And further, we directed departments to seek discretionary spending across all major expenditure categories: professional services, supplies, travel, facility CIP that hadn't been designated as a priority by the board, and fixed asset purchases that were not already subject to a purchase order at that time. So the budget includes, as we've discussed, the expenditure reduction of about 5.3%, so that equals $1.85 million. Just as a reminder, we did budget that as salary savings, but it is not necessary for the reductions to come via salary savings. We will be working with departments across this fiscal year in order to be more flexible than perhaps we've been in the past as it relates to moving monies around so that departments can achieve their business objectives while still absorbing the 5.3% cut to their budgets. So the general fund balance used to balance was $2.24 million. So that is 100% in the budget. We'll talk about that a bit more in a few minutes. And then the teeter transfer to balance was $6.4 million, and contingencies at 4.18 recommended, and the general fund reserve again is 5.4. So influences our general fund balance as of June 30, and just to take a step back, the primary difference between the budget that is brought to you in June and the budget that is brought to you in September is that we are using fund balance projections when we put the budget together in the spring for the board to review in June. Once we have those actual fund balances and they're known, they're no longer projections, which occurs somewhere usually in the third week of August, then we need to revisit the budget along with any other requested adjustments that are recommended by the CAO and adjust accordingly. So our closing fund balance for this year for the general fund was $2.24 million, which, and this is part of the structural deficit issue that this county is experiencing. So that was down from approximately $6.5 million in the prior year. So a $4.3 million hit in 1 year to our fund balance. The prior fiscal year, it was down $3.3 million. So we are definitely trending in a negative direction as it relates to our structural deficit. General revenues overall are on target, and we did not need to make a teeter transfer to balance. So that was what year end looked like for last year. So with that information, we then, as the board knows, as we discussed on at least 2 prior occasions, we have more information now about the CARES Act funding. Our allotment is approximately $4.59 million. The board previously directed staff and approved the $200,000 allocation to the learning hubs with the Calaveras County Office of Education, and that is included in this budget. So after taking into account the $2.24 million of our fund balance or of our contingencies theoretically would come from fund balance. I mean, there are different ways one can couch these numbers, but at the end of the day, if we were to deduct that $2.24 million from the $4.19 that's being recommended for contingencies, then this would be the delta of the $4.59 million that has not already been essentially absorbed into our budget in order to balance for this current fiscal year. As discussed, the excess funds are in contingencies, and we have received approximately $1.53 million to date. So we expect to receive another payment of it's approximately $750,000 sometime this month. We have submitted our initial report to the state, which was due last Friday. So what we expect is that the state will be reviewing the reports that have been submitted by the various counties, and then depending on their review, but it seems as if we should be expecting the remaining 50% of the allocation sometime after October 1. So that's pretty much where we're at as it relates to CARES Act funding.
Just a moment, Krista. Does the board have any questions or at this point? Krista, I do on the CARES Act. When you did the budget landscape, part of it was CARES Act funding that impacts the figures we're getting. The 1.93 goes toward the cost incurred from March till the end of June. Is that correct?
So it's actually the flip side of that. The 1.93 is the amount that remains after we essentially repay the general fund. Yeah. So it's that delta. So 2.6, 2.7 approximately that we are using to reimburse the general fund for appropriate COVID-related expenditures.
So we have used 2.6 for expenses incurred from March to the end of June, correct?
Essentially correct, yes.
Okay, so when you referred to balancing it, even though it's in contingencies, it's the 1.93, the board would then have to decide, do we want to use it to repay general fund expenses from July 1 through the end of December, correct? Or for something else?
So it's clearly up to the board in terms of how to allocate the remaining balance of contingency.
Okay.
What we have done is budget the amount of the CARES Act funding that we needed in order to not have to recommend additional reductions. And so we know that we are going to have sufficient, or we believe we're going to have sufficient appropriate expenditures to account for the entire 4.59 million. And of that, what is left remaining, the fraction of contingency that would not be accounted for by our general fund balance as of 6/30 is the 1.93 million.
Okay.
And so the board could determine to leave it in contingencies. The board could determine to allocate it. That's a discussion for the board to have.
Okay,
It was
thank
that. Did that clearly answer your question?
Yeah, close enough for right now. Thank you.
Okay.
Go ahead, continue. I don't see any other questions from the board. All right.
I have a question I can't let go. I'm a little, given what Marita is saying, that 2.5 of this, or whatever it is, 2.6, is from March to June.
So not exactly.
It can't be. We're already in a new year. The books are closed. You can't go back and say, we agreed to put the 4.5 in contingencies. That's what the board gave direction to do. And then we would allocate it as we needed it during the course of the year. So how are we getting to 1.3 million is unallocated when we allocated the whole 4.59 million into contingencies? And you can't go back and take 2.6 to fill in a gap from March to June on the year we've already passed. We're in the new year, the 2021 budget, not the 1920 budget. So I'm a little bit confused in what everything's being said here.
First of all, just to clarify, about 2.1 is what we believe we have for the prior fiscal year for appropriate expenditures for the CARES Act funding. But what I'd like the board to understand is that without making further cuts to our existing budget, that is the amount that we are recommending in order to balance our budget without making those further cuts. So, there are different ways you can look at it. We could, for example, we could reduce contingencies or we could leave them the same. I could tell you that we have zero general fund contingency, that 100% of that is otherwise absorbed in the budget, and that we have $4.1 million of CARES Act funding. But then we have zero contingency that wouldn't be CARES Act. So a little bit of this depends on how you want to look at it, and I understand that it's not an ideal situation, but we have a structural deficit in this county. I completely agree.
Okay. In June, we passed the budget for this year. Didn't include any of this $4.59 million at all. None of it. We passed the budget. Now we're here, and you're saying we needed another $2.5 million because that budget, it was deficit of $2.5 million in order to make it the way we passed it? It doesn't make sense what you're saying to me, and I'm trying to make sense of why we're not putting what the board directed, because we have a budget, and it was passed in June. what was directed by the board just to put the 4.59 million in contingencies. You're telling me we're only putting 1.93 million. I want to know where the rest of the money went, because we had a budget in June that we passed, a preliminary budget. And we're going over that budget now to finalize it. And if we've spent another 2.9 or allocated another 2.5 million or whatever it is, I want to know where it's allocated at.
So, Krista, maybe just a couple bullet points will help. In the first place, the budget that you passed in June did not have the policy level minimums met. And the board gave us direction to meet the policy level minimums. That's part of what happened with the CARES funds. In addition to the policy level minimums not having been met, the board, after our preliminary recommendation, authorized additional expenditures, further going below the policy level minimums. So again, that's what was backfilled with CARES Act funds. And then last, there was an additional liability from the RIMS that hadn't been recorded at preliminary that has now been recorded. So between that additional liability and the actions that we took that kept us below our policy level minimums, that is what is creating the deficit that you're talking about, Supervisor Toffanelli. And the way that we could address it is to take all of the contingencies out and put the 4.5 or $4.6 million aside in its own account for CARES and leave it sit there. If we do that, we haven't met your other directives, which were clearly to meet the contingency and reserve policy minimums, which has been facilitated here. So we've taken the direction and put it together, and this is the outcome. But there are other ways to go about doing it. We've been trying to meet all of the expectations to minimize the teeter fund transfer, meet the policy and contingency, the reserve and contingency policy minimums, and set the CARES Act funding aside as a remainder for other projects that the board may want to take on. So I know that it's complicated. We're trying to mesh them all together, and Krista did that.
Okay.
Is that the summary?
Yeah, that's exactly the summary.
Okay.
And the only thing that I would add in there is that while not the largest chunk, obviously the board also directed us to set aside the $200,000 for the learning hub. So
good point.
Okay. The policy levels that you are discussing and talking about was the reserve, and we were at the policy level at reserve at preliminary budget. The only thing we were below was on the contingencies.
Right.
So we said put $4.59 million into contingency. That would have put us above our minimum. Nothing was said. Wait. You just brought up the RIM, that we had to repay the RIM. Nothing was brought up to us about the RIM here. She's not saying the money and her PowerPoint here, anything about where that money's going, and if there's a RIM payback, how much was the RIM payback that we had to pay back that had to come out of contingencies? So we're all aware of what's going on, and then what other allocations of paying back teeter, I think that's a board discussion that needs to be had here, what to do with those, the 4.59 million, whether we want to use it to balance the budget somewhat and put money back into teeter or what. Just to do it is something I don't think admin has the ability to do without discussing it with the board, and it's not being discussed here.
So the presentation isn't completed, but your points are well taken, sir. This is budget hearings. The direction that the board gives us from this presentation get implemented for final budget. So there have been significant changes since we presented the preliminary budget, one of which is the RIMS payback, second of which is the CARES Act funding. And so we've taken all the direction from the board from multiple conversations and put them together for these budget hearings. But if the board is, as a body, is uncomfortable with any of the way that we've tried to implement the variety of direction that we've gotten from you since the preliminary budget, then this is exactly the forum for us to be able to unwind anything that you need us to do. One of which could be to say to go down just to the policy level minimums and contingency and reserve, and make a special account for the remainder for the CARES Act funding. You're right, we can make an adjustment to the teeter funds as well, but we needed to at least take some action to get it forward before you now to have the hearings. And Krista, at my direction, has done what she could to mesh the variety of direction that we had from preliminary and then the CARES Act discussion to put it in a package to create the opportunity for the discussion for the board to give policy direction for final budget.
Okay, why don't let Ms. Von Lott proceed.
Well, I just have one other question, Madam Chair, I'm sure. What is the amount of the RIM payback fee that you're talking about? Because I just went through all these PowerPoint and it's not on here.
So for the auditor to close the books, and just to kind of clarify a little bit, it was approximately $906,000 of loans that were made from REM to the disaster budgets, which then became a liability for the general fund and accordingly reduced the general fund balance. In addition, there was one other transfer, as the AO had correctly expressed as it relates to the REM loans. In both cases, those transfers had not been affected at the time of, or liabilities assessed at the time of preliminary budget.
So we have transferred that money?
In terms of the $906,000, that is it's a loan, so it hits, even though we haven't transferred the money, it still hits the general fund as a liability because it's technically money that the general fund owes to be paid back.
Okay,
the other project was budgeted out of teeter, and so that was a transfer.
Okay, thank you.
Supervisor Toffanelli, or yes, Madam Chair, if I might, Supervisor Toffanelli hit on an important point with regard to the liability that while we're here, I wouldn't mind touching on if you'll oblige me one more minute to do so.
Please, go ahead.
Madam Chair, I'm sorry, I couldn't hear you if you responded.
Yeah, please.
So part of what we're experiencing here with the liability from the RIMS is it's a policy that the board has already approved that Director Josh Pack brought to us. I don't recall when, but he brought a resolution forward to help us fund the work that he does in responding to the FEMA projects. And we've set, I've done it internally, we've set really pegged at the time with which we will record our anticipated FEMA revenues for payback for completing projects has been when we submit all of the paperwork to FEMA. So part of what you're experiencing, what you're seeing here that's causing a cross up in just the budget numbers is we're having to record the liability, but we're not recording a like revenue to offset that liability because the project hasn't been done yet. The paperwork hasn't been submitted to FEMA to get reimbursed, and then we know there's been a lag in FEMA reimbursement. So we don't know yet when the project will complete, when we'll submit the paperwork, and when we will be reimbursed this revenue. So right now we have a liability without an offsetting revenue, which makes the number look a little bit bigger. But those are also things we can discuss in how we approach our FEMA reimbursements as well. And that's all I have, Madam Chair. I just wanted to point out why I think that the RIMS liability is looking a little bit bigger than what it might otherwise.
Yeah, I remember that discussion. Mr. Mills, did you have something you wanted to talk about at this point?
Yeah, this whole discussion's got me absolutely baffled. I remember what the board clearly said about the $4.59 million and the $200,000. Beyond that, if there was to be a RIMS payback and you needed an asset to cover that liability, I don't recall the board actually allocating any particular asset to that liability as part of our discussion. So
the board actually did do that when they adopted the resolution that Mr. Pack brought forward that said when we borrow from RIMS, we'll pay it back. And right now, because we don't have a revenue stream for it, it's a general fund liability.
Mr. Alt, the point is that the board is the one that makes the decision on allocation of resources. It is not to be done based on a policy decision. The board has to see those things and actually make those decisions themselves. That's why we are in the position we're in.
So,
I'm having a real problem with this.
okay, so Mr. Mills, we can put on the list that you would like the accounting for the RIMS payback. We can do that in another way. We will put that on the list of things to work through. I don't remember it that way, but I'll take your word for it that it is. Ms. Von Lott.
So Madam Chair, I'll just leave us with this final thought, and I'll reiterate. When the board gives direction in separate and distinct meetings, and those directions conflict with one another, then we did the best we could to match up the conflicting directions that happened over 2 different periods of time. And we've brought it back here in preparation for this discussion. We haven't implemented this budget at all. The budget hearings are for the board. This is the place that the board makes the policy level decisions. We've mixed in this presentation and our proposed budget the direction that the board gave us to meet the policy minimums on contingency and reserve. And Supervisor Toffanelli is correct. The reserve was at minimums, contingency wasn't. But it is now, and the board can make a decision to go below the policy level minimums. I took the policy level direction straight from the policy that the board's already enacted. Only the board has the authority to go below that. And if the board chooses to do that in this hearing, we'll unwind meeting the policy level minimums. We'll reduce it to that which you've given us direction to do, and we'll move the money over into a CARES Act account. But this is the venue for us to be able to talk about the direction that we've had between preliminary and the CARES Act discussion and prior to us actually bringing a budget back for you to enact by vote.
Thank you, Mr. Olive. I think that's something the board needs to keep in mind when we recommend policies, and one policy might conflict with another, which we might not recognize at that time. But let's proceed through this, and we can revisit it when we discuss where and if we want to move or change any monies. Ms. Von Lott, could you please proceed?
Certainly. So I'll just quickly run down the same list of unknown factors that's been brought to your board before. COVID-19 clearly continues, and we anticipate will continue to be an issue for quite some time. The economic recovery rate, California budget impacts, collective bargaining, federal and state relief related to COVID that may or may not be forthcoming, local business impacts, unemployment, tourism recovery, CalPERS unfunded liability, and of course the things we don't know. So for our revenue reductions, sales and use taxes, as we previously discussed, we reduced by 25%. We did not change any of our assumptions that we brought to you for the preliminary budget. So these all remain as they were. With that 25% reduction from the budgeted amount, not the actual amount, but the budgeted amount for last fiscal year, was a general fund revenue reduction of $825,000 approximately. With respect to Prop 172, likewise, we made that reduction of 25% from the prior fiscal year's adopted budget. All told, that was a $475,000 reduction. After fire, that was equated to a $427,500 reduction to the general fund, which typically, which those monies go to offset the sheriff, or go to the sheriff's department as revenue. Transient occupancy tax, we reduced by 50% from the prior year's adopted budget, coming to a little more than $747,000 overall in terms of reduction, half of which hit the general fund directly, and the other half of which affected the Calaveras Visitors Bureau and the fire districts. As it relates to other revenues, not property tax, vehicle license fees, certain fees, tobacco settlement, PG&E franchise fees, those things we accepted based on what we thought were reasonable expectations related to those receipts for revenue. But otherwise, many other revenues in the general revenue account, we reduced by a third. So in terms of projected increases, Measure C, we've continued to leave in the budget for $1.1 million. That's something that we're going to be tracking along with the Director of Division of Cannabis Control as we move through this fiscal year. Disaster budgets for Butte fire reimbursement, we do reasonably anticipate approximately $2 million in revenue. So that is included in the budget. As CAO just indicated, we are continuing to monitor REM loans and REM revenues, or revenue reimbursement related to offsetting those REM loans, and will be bringing updates to the board either at mid-year or when it becomes appropriate to go ahead and book those additional revenues. CARES Act funding, clearly, we've talked a lot about this, $4.59 million. It is in your budget. And a general tax roll revenue increase of about $370,000. So the 4-year revenue trend here, as you can see, if we look over last year here, this is almost entirely CARES Act funding. If you look from here, 1819 to 1920, you'll see that this was, or you may recall that this was when we were budgeting the tier transfer to balance. So those are the kind of broad explanations for those increases over time in these numbers. So this number would include the $6.4 million for this year plus the $4.59 for the CARES Act funding. General fund breakdown of revenue. Taxes clearly are our largest outside revenue source, and I say outside revenue source here because if you come down to the operating transfers, then so technically, while it's an at this, they would be coming by definition from a different fund, but they're not revenues in the same respect. So here is where you see your $6.4 million teeter transfer to balance. Here's where you see the $4.59 million teeter or CARES Act funding transfer in. Here's where you see the PG&E settlement monies coming into the general fund for the public works work, etc. So taking this number out, clearly taxes are our highest revenue source. Here is where you would see here is where you would see our state and federal revenues and charges for services, etc. So move forward. That. Okay. So for your general expense trend, we came in very close actually to last year. So part of what happened there is that we got the CARES Act to offset a portion of the $1.85 million revenue reduction that offset the other revenue reductions that we made that we just discussed. And so this is actually coming quite flat as opposed to last year. yeah, and I neglected to mention, pardon me, that here, one of the things that we need to take into consideration is what this number is when we're looking at this number. So if you take out the contingencies, which is booking as an expense here, you can see that we're actually substantially lower than we were last year after backing out contingencies for the same reason. So it's an issue for us that we have gone down so much actually in this year. That's where departments are feeling this budget. So just to go over the budget recommendations for personnel and CIP. We've talked about this before. We spoke earlier about the personnel criteria that the administrative office uses in conjunction with human resources to evaluate requests to fill positions. We have not recommended any new positions in this budget. We did not do so at preliminary, and we have not changed that methodology here. Capital improvement projects, as we've discussed, generally projects previously approved by the board, and then we have the criteria here that we use internally in terms of determining whether we want to make a recommendation to the board for one of these projects. So no new positions for personnel are being recommended. Capital improvement projects are what they were, and they're on page 221 in the budget book. Capital assets, we did recommend the addition of rebudgeting for the animal services vehicle and outfitting, and that is included in this budget at approximately $73,000. And we have included the reimbursement to the Sheriff's Department for the $332,400 that had previously been budgeted to be paid for by AB 443 funding, and we received direction from the board to reimburse or to use general fund monies, which we are recommending to go ahead and do now at this point in this budget. We've included the debt service slide here just to, further to prior board requests, give a picture of where we are at with our debt service. So 31 million, almost 32 million for the GO bonds. Maturity is 2038, and for the COP 2037. Respectively. The COP balance as of the end of last fiscal year is approximately 6.5 million. We pay for this via the tobacco settlement monies that we get, which typically come in a little bit higher. And so we are actually, we do have some fund balance there should we need it for that debt service at some point. And then the HVAC loan, which is about 2.6 million as of June 30th of last year, and $292,000 a year general fund payment with maturity in 10 years. So Teeter, ending fund balance was $6.8 million. We have, what you see here is this is the typical Teeter transfer that has been budgeted for several years. I'm not entirely sure when that started, but that is the $500,000 transfer for this coming year. We budgeted $6.4 million approximately in order to balance the books, and then approximately $688,000 and change are budgeted for actual expenditures out of Teeter. So this would be transfers to CIP or departments for appropriate projects. Or authorized projects. So our estimated revenue, we actually increased here. This was one place where we felt like the original reduction, which had been 50%, 50% of the conservative number, and decided to adjust this up to 800,000. So with all of those budgeted transfers, Teeter is projected, if they were all made, to have a fund balance of zero at the end of this current fiscal year. Now, I say that, but want to remind the board with the caveat that, for example, this past fiscal year, we had, I believe, we had a very large Teeter transfer budgeted to balance, and we did not need to make any of it. So the hope is that we will not need to make a Teeter transfer at the end of this fiscal year. So I certainly hope that turns out to be the case. So moving into the structural deficit discussion, as discussed, we've got a fund balance of approximately $2.24 million. So this is down substantially from the $6.5 million that we had a year ago. The reason for this is very straightforward and simple, and it is that we have been in a position year over year where we are budgeting more expenditures than we have in revenues. And so when I talk to you about things like the Teeter transfer to balance, et cetera, those using up the general fund balance completely in the budget, when we were in the position at preliminary where we were well below our policy minimum for the contingencies, then those are all indicators of the structural deficit. So we had last year a Teeter transfer of $5.7 million to balance. This year it's 6.4. As you know, we had to do the $1.85 million reduction to balance. And so just for calibration's sake, the 2.4 approximately of CARES Act funding that is absorbed into this budget, we would need to make were the solution to that problem to be to ask departments to give up more general fund, more of their general fund allocation. We would be looking at substantially, we would be looking at much more of a reduction than they have already made. So more than 10%. In any event, or a total of 10% would not be sufficient to close that gap. And this is a trend. So the same year, just to reiterate, the prior year we went down 3.3 million. This year it was more than 4. So we're not trending in the right direction here, and that is something that we're going to need to address in future budgets. So I would like to thank the Board of Supervisors. I should say we would like to thank the board, the auditor controller, IT, the administrative office, staff, HR and risk management, department heads, and fiscal staff across the county. We know that this has been an exceedingly difficult year. There have been an unprecedented number of challenges and what's typically a challenging part of the year to start. So we want to really, really let everyone know how much we appreciate their working with us and their responsiveness and willingness to work as a team to get through this ever challenging year. In terms of our moving forward recommendations, clearly moving into the budget hearings on this budget that is before you. We have presentations from Environmental Health and the Sheriff's Department. On September 22nd, after the conclusion of the hearings, we recommend that the board adopt the county budget as recommended, and also further adopt the capital assets resolutions. So at this point, I would like to open it up to the board for any questions that they may have.
You mean after we already tore you apart? This is just, are there any questions or initial comments that the board members have on this?
I do. I have a
Go
question.
ahead, Gary.
Going back to your teeter fund balance slide that you had.
Yes. Would you like me to go back to it?
Can you put it back up? There you go. Thank you, Krista. We're ending up with a zero fund balance in teeter. We're taking $688,189 out for transfer for projects. What projects are we just talking about for that money?
I would need to check the capital assets or the CIP schedule and confer with Deputy CA or Rich, who does.
Okay.
Yes. Sorry.
The 6.4 million that's going to balance the budget does not include those projects? We need an additional 688,000 outside. I'm a little.
That's correct.
Well, aren't those part of the budget?
So the reason why and perhaps missed the mark, but the reason why we've broken these out in this way is such that, I mean, for example, the 500,000. Another way of saying this is that we have a budgeted general contribution from Teeter of 6.9 million. We've broken out the 500,000. Sorry. The 500,000 because this has been an ongoing year-over-year contribution that Teeter has made back to the general fund. The 688,000 is for particular board-approved projects, or expenditures, perhaps for capital, that have already been allocated throughout the budget unit. So this 6.4 is really, it's a balancing mechanism. If we had $10 million in general fund balance as of 6/30, we would still have this $688,000 request, and we would still have this $500,000 request, despite that we would not be using this transfer to balance, because we would have sufficient funds to avoid that. Does that help, or would you like to follow up with another question?
Okay, thank you.
Any other, Mr. Mills?
Krista, I got a question for you.
Okay.
If we're going to spend Teeter down to zero this year, what will we have available in Teeter next year? Because these issues that we're going to discuss here aren't going away.
Understood. So, sorry.
I can rephrase it if you'd like.
No, I think I understand you, and it's quite frankly, we were in exactly the same place this time last year. If you'll recall, we had something on the order of, I believe it was a projected fund balance of it was less than $80,000. So, where we hope we're going to be is in a position where we don't have to make any of the Teeter transfer, just like we didn't have to make any of it in order to close the books on this past fiscal year. As a practical matter, if we want to go worst case scenario and say we need 100% of the budgeted transfer in order to close the books, then we would be budgeting something probably, depending on how COVID goes and what we know then about how Teeter may or may not be affected, probably something on the order of $800,000 to $1 million in revenue for next year, and then depending on what the board directed and approved as it relates to those funds, we would know what our projected fund balance would be at that point.
You answered the question. Thank you.
Thanks.
Okay, if there's no other questions at this point, I'd like to open it up for Christopher, any staff people who would like to make a comment? What did, oh.
I do have one other question. I'm sorry, Madam Chair. Thank you. Krista, I have one other question for you. I'm sorry.
Okay.
On the general fund for your expense trend that you have,
Could you go make sure everybody's on the same page you are?
it's the general fund for your expense trend.
Yeah.
You have under this current fiscal year 2021 under debt service.
Huh?
You have no allocated funds for debt service. When
Yes.
we went into debt for HVAC, how are we making, where are the payments coming from if they're not listed under debt service here?
That's an excellent question. So it's actually not a mistake, although it's completely clear to me why you would ask that question. So our debt service fund is held outside of the general fund. So this snapshot is literally looking at just general fund debt service. So the HVAC special revenue fund does have debt service attached to it. And just by way of recollection, I'm not sure if any of you recall back when we had still some vehicles that had been leased through the sheriff's department. When you look back at these historical numbers, that's what they're reflecting. And when those leases were paid off, this figure went to zero. So unless we take on additional general fund debt, these numbers ultimately will continue to they will all be dashes as these prior years fall off.
Okay, but in your other presentation, the rest of your presentation on another one, it said that $292,000 payment was general fund for those HVAC units. Under debt service, under your debt, the other debt service chart says 2020 HVAC loan balance of 6/30/20 as of 6/30/20 was $2,585,000, including the cost of issuance. Payments will be approximately $292,000 from the general fund.
So hold on.
So wouldn't that be classified as a general fund debt service?
I am trying to get to that slide.
Right there, down at the bottom.
Right, so I'm looking now at the budget transfer that we did from, and I apologize because that is a mistake in this PowerPoint. Actually, what was approved back in, was a transfer, and it was a transfer from the general fund. And you're right about that. $192,000 of that was from our general revenues account, and $100,000 of that amount was from the deferred building maintenance fund, which is generally considered, and that fund will be at zero. General fund, it's kind of like teeter general fund monies that are on reserve accounts. However, it still wouldn't hit on the table that we just looked at, and the reason why, where it would hit would be, and I'll just go back if you don't mind. Where it would hit would be right here in your operating transfers out. And then if I were to show you a special revenue fund debt service chart, which I do not have, but if I were, that is where it would show up as debt service. So in this case, it's manifesting as a $292,000 and change transfer out of the general fund and into a special revenue fund, where there it is reflected as debt service.
Okay, thank
Does
you.
that,
Thank you, Kristen.
Mr. Mills, did you, before I do that, I forgot to open, this is a public hearing, and so all comments are, even though I didn't start, I want to do now. This is a public hearing, and I want to open the public hearing. Mr. Mills, do you want to be the first one to talk in the public hearing?
Madam Chair, it's been that way year over year. I will defer.
Okay.
I have feathers, but we can hold off.
Okay, thank you. You've sort of set the bar for all of us. We're all trying to figure out how many tabs we were going to have if we were going to beat you this year. Okay.
Just remember, next year I will only have 3 minutes.
Okay. Ms. Van Laat, is there anything else you wanted to add?
No, Madam Chair. If the board has questions, I was not intending to go through budgets individually. Rather, we were expecting to answer questions and then hear the presentations from Environmental Management Agency and the Sheriff's Department, but clearly we'll defer to the board in terms of how to move through the latter part of this budget hearing.
Mr. Alt, is there anything else you wanted to say before I ask staff if they'd like to make any presentations?
I guess a couple quick points. So we've already had some discussion about the structural deficit. That structural deficit has been in place for at least 3 years before the last 2 budgets that we've taken on that Krista and I have worked together on. So there's that issue. The teeter fund transfer has been a practice long before this year and last year, and every year we see teeter as being an account, for lack of a better term, to balance the budget. And at the end of the year, we tend to be quite lucky that we never expend quite as much as we have authorized, and we don't end up making that teeter transfer. But those are practices that have been really built into the budget that we've been working with for the past few years. So some of the things you see in the budget are history repeating itself, and the only way for us to change that is to take a real aggressive approach at the structural deficit. And at the end of the day, that means pretty tough decisions to be made on going really either to just mandatory things that we're required to do, and there's a lot of things that are not mandatory but are quite significant benefits to our public, and we haven't yet done that because of the benefits to the public. So, if we need to reframe the conversation about how we're going to undo the structural deficit, that's a new discussion over and above the historical practices that we've used to lay out the budget in this year and the previous year.
I guess we'd also like to know, what do other counties do? They're in similar positions. Unless we had a total freeze, I mean, we'd have to totally rearrange the way, and maybe we should look at the way local government provides the services. And maybe we need to do it differently than the way we've been doing it. But that's a conversation for another day. I'd like to move to staff. I know there's, I'm sorry, Mr.
Chair.
Stopper.
A few things have been brought up, and I go back and forth and I start doing the subtraction on these numbers because you're talking about the structural deficits, CAO, and I look at other budgets for, let's say, the school district and everything I've been through for years and everything, and they're like these graphs are nice and everything, one page without, with just strictly revenue, projected, or what we approved revenue, what the final budget approved expenditures were, and then, a line item there for
Mr. Stopper, could you help us so we can follow you?
I'm sorry, I'm stuttering a little bit. No, okay, yeah, no, absolutely. When I do an overview, I start going over the revenue and expenditure trends, and we start looking at the 3-year trends that CAO was talking about. And there's some, he's got the 3-year on one page for what the revenue would be, the 3-year for the adopted budget. One thing we don't have here is those lined up with the actual, I can do the math. It's not a problem. I just pull one page and then go down the line to the next page. And then actually, what's the structural deficit? Because we look at 17 to 18, we had close to a $7.7 million structural deficit that was approved by the board. 18-19, we had close to a $9 million structural deficit that was approved by the board. 19-20, it went down to approximately 5.5. My point here being is, and you brought up a very good point, luckily we haven't finished all the projects in 1 year in a lot of these cases and didn't spend all that money. So the actuals are not here. What are our actuals as we move forward? This is something that the auditor controller puts together as we go into the next year. It's part of what, the $906,000 we're talking about, the rims that should have been in the preliminary budget that didn't necessarily get addressed early enough, but or caught, but that are actually put into the actuals when the auditor controller gets done with the audits, which are generally after this part of the year, but we can look at prior years. And my point getting down to is Marita brought up something in her closing statement before we go to staff, is we have a lot of consistent practices that Calaveras County has practiced, and one of them is putting forward a budget that has a structural deficit in it. This is going to take some restructuring, and it's going to take time over the years, and it's not something we're going to be able to solve today. But, keeping this in mind as we move forward, we need to start providing solutions instead of what the hex. Where did that come from? Well, we did approve the rims thing through Josh Pack. I was here. I remember it clearly. We can go back and watch the video. It's on camera. You can go back to YouTube or our site and watch the video. We approved Josh Pack being able to take that out to address FEMA projects. We did, and then at the end of the year, there's a missing in accounting, and it didn't get applied to the preliminary budget. Somewhere the ball was dropped, but now they picked it up and they got it back in there. I'm not saying it's okay. We should have that number in there originally in the preliminary, but if we mess the bed, we remake the sheets and do it right from there on out. So I definitely, I've got a lot more in here that I've been going over and everything. We got to keep in mind our past practices. A lot of our past practices, even though I wasn't on the board then, I take responsibility now because it's my job to work forward in a manner that solves these past practices that have continued, and it's time to within the confines of the law and everything else we have set before us to change those so we move forward into the next year so that we take a step forward. This isn't something that gets solved in 1 year, but in multiple years, but it's something definitely I want the board to think about as we move forward.
Okay. If there are no other board comments at this time, I'd like to,
Well, I want to address what Mr. Stopper has to say, and it didn't address the repayment when we talked to Josh and we agreed to transfer the money. It didn't address not addressing our policies or following our policies. And Mr. Alt spoke of policies. I'm looking at Section 1, appropriation transfers of our policies. It's in our book, it's on page 36. And this board agreed to putting $4.59 million into our contingency. That's what we voted to do when it was brought to us several weeks ago on this money. And it says, number one, per Government Code 29125, the Board of Supervisors has authority by 4/5 vote to A, transfer appropriations between funds, and B, transfer appropriations from general fund contingency budgets by a 4/5 vote. That money should have been in contingency budget, and if it needed to be addressed and paid off for a liability, it should have been brought before this board, and this board should have gave authority to transfer that money. If you move down to section 4, about locally declared disasters, under A, it says, under a locally declared emergency, the county administrator, upon concurrence with the auditor, controller, can move appropriation from general fund contingency budget called an emergency transfer, and that was not an emergency to pay that back. The emergency had already passed. And he also, the county administrative officer will take such an emergency appropriation transfer for retroactive approval to the Board of Supervisors at the next scheduled Board of Supervisors meeting following that emergency transfer. We did not follow policy. It was just, and if I didn't bring it up today and ask the question, we would never know where the money went. How come it was never presented to us? So the policy, in my opinion, on paying it back, yes, we had a policy and Josh brought to us and we would pay the loan back, but it should have came before this board on how and where those money would come from and during the time of paying it back, and it should have been transparent and up to the board to determine that, and it wasn't. And that's my point about what has transpired here.
Okay, so, I mean, I understand.
And it needs to be done correctly because it wasn't done correctly.
Okay, so we can say that staff made a mistake at that time. They should have and they could have, but they didn't. But now we're where we are now. Is there something you would like us to do to correct that?
It needs, during this time, it needs to be brought to this board.
Okay, but the money that we've already repaid, do you want it brought back for us to decide?
That's a discussion with the board at this point, but we...
Doing that now, though.
Isn't that what our job is right now?
Yeah,
We're doing it today.
Yeah,
but
it wasn't prepaid before.
Nothing's been paid.
Okay.
We haven't passed the budget.
But it's not in here. We need to have that discussion is my point,
Okay.
that needs to be addressed and appointed. We need an exact amount and decide where the money's going to come from. Whether it comes from contingency or, I don't know. I'm just saying this is what the policy is for us to do.
To one point, Gary, and I do get where you're going, and I think that policy is pretty sound that you brought up. But to the point that Jack's sort of bringing up right now is that wasn't done outside policy because it's within the budget that's before us right now, and we're making that decision right now. You're talking about the policy?
I'm talking about what this policy is. We've already made a decision as a board. Excuse me, my mic's not on. We already made a decision as a board few weeks ago to transfer all the $4.59 million into contingencies. We did that. We agreed upon that. So it should have, whenever the money came in, should have been put in contingencies. And then if we need to pay back a loan, it should be here in front of us, which it says in the policy as a separate issue about putting it back to the Board of Supervisors or have this discussion. And the only reason we're having a discussion is I asked the right questions. Otherwise, we wouldn't even know that $906,000 for RIM was transferred out. I asked the question. It wasn't clear here. It doesn't say here. I said, what do you mean $1.93 million? It's supposed to be 4.5. Where did the 2.5 go? That's my point. So it's not, we may be making that decision here, but we need to make it very apparent and clear that that money is going to be transferred from somewhere at the discretion of the board.
Okay,
So, Madam Chair.
To follow the policy.
okay. Mr. Alden.
Madam Chair.
Please, go ahead.
I just spoke with Director Pack. He's got a copy of the resolution. I'll be able to distribute that the board passed when they agreed to do the RIMS transfers. So that might help inform the decision making. It might also be worth noting, I see that the auditor controller is on the line. If there needs to be discussion about whether or not this was done appropriately within the policy, I think that's typically within her purview. I know that Krista and Kathy work together on this. So if it's necessary to have the discussion, we might be able to do that, including them, and with the resolution that was passed I think it was October 8th, 2019. So that policy decision may have already been adopted.
What I hear Mr. Tuffanelli saying is, did the money come from that is to repay the RIM, and that should have been before the board.
I hear, Gary, I hear you saying you're upset because this was done without the four-fifths vote.
It was done without the board, even the board knowledge of it. And he can bring up the resolution that was passed. I don't deny that we passed that resolution. But at that time, there was no CARES Act money discussed and paying it back with CARES Act money. It was discussed about paying the loan back. I understand that. But when it came to paying the loan back, especially the $906,000 amount, it should come before this board. Rather, it wasn't even being addressed at the budget here. It was going to be, in my opinion, swept under the rug that we'll just pass this, and we don't even know what the 2.5 other than, well, it's being used to balance the budget. I have an issue with that.
I can tell you've got an issue with that. I think we all need to take a deep breath because I don't think we've moved any money yet. That's what we're voting on today. Now, whether we have to do the four-fifths, I don't know, but I would love to hear, from auditor controller if we're out of line, but I don't think we've done anything yet because we haven't voted on it. So I think your question may be resolved, so I'll take a deep breath on this one.
Can I take a deep breath?
Just a moment. Me or them? Oh, you can't hear them. Of course they can hear me. All right.
I'll lean into my mic.
Mr. Mills,
so
go ahead, please.
Let me ask this question. Maybe this will get some clarity. The 4.59 million minus the 200,000 that we discussed as to what we were going to do, that money is still in the account today?
Yes.
Yes, and thank you. That's an excellent question.
Maybe that's the way to get to the bottom line here.
Right. You're absolutely right on track with that. We haven't moved any money out. We haven't taken any of the CARES Act funding to pay for this. In essence, all of the actions that the board has taken over time leading up to this period of time create such a deficit in our contingency that when we put the CARES Act, the $4.59 million into contingency, we were so far below the policy minimums, it doesn't bring us an equivalent of $4.59 million above the contingencies. Now, if the board chooses, and it's certainly your prerogative to do so, to keep our contingencies at a lower dollar amount and allocate all 4.59 minus the $200,000 for the learning hubs, we can still do that. We didn't take latitude to go below the policy minimums. That's what we're trying to explain. In effect, you're just talking about moving the money around. And if the board says we're comfortable with a 1% contingency or whatever the percentage comes out at, then we still have all $4.59 million available for use at the board's discretion.
Yeah, for transparency purposes, I want to be sure that if we stuck 4.59 million in our pocket, that anything comes out of that pocket, the board has a chance to look at it, talk about it, decide, and that's really, I think, where this whole conversation is going. So if that's the clarity we need, we got it?
Yeah, you synthesized it perfectly. There's the money that is still sitting there, but we also have a contingency and reserve policy that's already been adopted by the board that we met that. But if the board says we're okay with being below either contingency or reserve and gives us authority to do so, we can drop that number back down to what it would be. It's going to be awfully low in contingency, but the board has the authority to do that. We're more than happy to do that. So we were mixing the direction that we have in policies, in other board actions, but we have not spent any of the CARES Act money at all yet And so we can easily unwind it and put it in its own account and show it, and there will be an equivalent reduction to the contingency when we do so.
I think the issue came up with the sheet that says that 1.9 is unallocated after closing 1920. And I think that's where the confusion came.
And the fact that the statement was that we've repaid the RIM loan. Have we paid that $906,000 repayment? Has that been done?
That is hitting the books as a liability.
Right.
The
Okay,
loan
so
is a
it's on our
liability.
books as a liability in front of us right now, so it has not been paid.
And we're not contemplating repaying it. It's just there as a liability.
Okay, all right.
And unfortunately, I try to keep things simple. I know the board can certainly understand this, so I don't mean to say that I simplify it for the board, but the public trying to watch all the moving parts of it. And I don't want to complicate it any further, but we don't have, if Josh completes all those projects, and I know he will, he's got them on the books, that's why we're making the draw from rent. Then Josh will complete the FEMA projects, then we'll submit for a reimbursement, and then we'll see the revenue come in that corresponds to that liability we're seeing right now. It just doesn't happen in the same year, and when it doesn't happen in the same year, it creates somewhat of an imbalance in our books. We're not adding on both sides of the balance sheet in this particular case because the revenue is going to come later, and we don't know if it'll come. We certainly don't believe it'll come in this current year because the project's not done yet. We haven't even submitted the paperwork. We haven't experienced the state or FEMA being able to reimburse us that fast, and we know there's been significant delays with their response of being able to pay things now that we've had COVID and all the other reimbursement type issues. So that's really what's compounding the issue here, is that we haven't plugged in the revenue stream, and it might not be for another 2 years. And that's exactly the discussion we had last year when we unwound all the FEMA revenues that we've been carrying over on the books that we didn't know if we'd even be paid.
Okay. Mr. Tuffanelli, do you have any more comments you want to make?
No.
No? Okay. All right. Pardon?
I believe I made my point.
Okay. Want to get back to any staff members who wish to make any presentation on their budget. The operative word is no, but please go ahead.
Hello, this is Lisa. Good afternoon, Madam Chair and members of the board. Lisa Medina, Interim Environmental Management Agency Administrator. We wanted to present to the board today our current agricultural vehicle with a knuckle boom crane is required to provide mandated services to test all measuring and weighing devices on an annual basis. This vehicle will be out of compliance with the California Air Resources Board CARB emissions as of December 31st, 2020. In addition to that, the crane was red tagged from the last safety inspection, just the crane alone. The truck is operable. We are looking to the board for further consideration and direction for funding sources, and we understand that this particular item will need to go out to bid. Along with me today, I have some of our EMA team members. We have Michael Boiteno, our Interim Agricultural Commissioner, who will be conducting the presentation. Doug Carson, our Air Pollution Control Specialist 2, who will be available to answer any questions related to the Carl Moyer grant. And last but not least, Janice Singer, our Department Analyst. Take it away, Mike.
Thank you, everybody.
Let me bring up the presentation for Mike.
Lisa, can you hear me?
Mr. Boitano, if you could speak up, please.
Sure. Unmute yourself.
He was, but I couldn't hear him. Could you?
Madam Chair, can you hear me now?
Yes, thank you.
Okay. Are you ready, Lisa?
Yes, can you see the presentation?
I can, thank you.
Thank you.
Good afternoon, Madam Chair, board members, staff. I want to thank you for allowing us to come before you today and talk about this issue. My name is Mike Boitano. I am the Calaveras County Sealer of Weights and Measures. Go to the next slide, please. As Lisa said, we are mandated to test all weighing and measuring devices on an annual basis. You're probably more used to driving up to a gas pump or going through a grocery line and seeing our seals on those scales and stuff. But we are also required to test cattle scales, vehicle scales, hopper scales, platform scales. And not only is this service...
Mr. Boitano, could you please speak up even louder? We're having trouble in the boardroom.
Okay, I can't, let me see if I can get I can't get the volume up any higher, so I'll just move closer to the...
That helps, thank you.
Okay, sorry. Anyhow, you have to realize too that we are mandated to do these testing, but it also is a service to the people that we that own the scales. Not many of them have a
Mike, you just muted yourself. Can you unmute, please?
Sorry about that. Anyhow, we do provide that service to our scale owners where they can at least get it officially checked once a year to make sure that they're not out of compliance. Our weight truck that we have now is a 3-axle 1987 International truck. It's got 474,000 miles on it. The knuckle boom, as has been said, has been rate tagged for safety reasons, and it was estimated to cost about $17,000 to repair that frame. The big thing is the truck will be carved out of compliance as of 12/31 of this year. Next slide, please. So what's our options? We can look at doing an MOU with another county, contracting with a service agency, or we can search for a new or used truck. And all three of these, you have to deal with the cost and the funding. Next slide. I have talked with our neighboring counties. Some of them are already entered into MOUs. Other counties are not open to sharing their equipment, even paying for them. The thing again on this is timing and cost. If we do have an MOU with another county and we're third or fourth on the line, we won't be able to do our scales in a timely manner. In a timely manner, I mean, if you try to do the cattle scales in springtime, just before they start shipping, you try to do the grape and winery scales, platform scales, just before harvest. And if we have to wait for 2 other counties to get their stuff done before we are on the list, that does not make for timely inspections. A licensed service agency is a person that's licensed by the state of California to repair scales. We could contract with them. In fact, we did this last year before I came to work to do our cattle scales. We estimate that it would probably cost around $20,000 for them to come out and do the scales as we need them done. Well, the other option is to search for a new or used truck. Some of the criteria we used was it needs to be CARB compliant. Right now, the CARB says we have to have a 2010 or newer engine model. Mr. Carson and I both believe that the airport's going to adjust their regulations sooner than later. Probably at that time, these 2010 to probably 2013, 14, 15 may come out of compliance at that time. But we have to make sure we've got a good park compliant vehicle. It also needs to meet our specifications. It needs to be powered right. It needs to have a good transmission. It needs to have a high GVW. And it needs to have a knuckle boom. I started the search by talking to Sacramento and San Joaquin County's Waste and Measures departments. They both are buying new trucks, going through that process as we speak. I basically got the specs from both of those counties, looked them over, kind of combined what we would need here. The cost of the trucks that they're purchasing are somewhere between $250,000 to $300,000. That cost was too much for our budget. Next slide. So I started looking for either a used or new truck within California. I did a computer search, run the computer for over a day. I could not find one that could meet our specification. I talked to a salesman down at Penske Truck Service in West Sacramento, and he looked on his through his contacts, and he couldn't find one either. If we stop and think about this, the reason is probably that most people, instead of turning their trucks in on a routine schedule now, are keeping their trucks as long as they can so that they can, when they do turn them in, they get a new truck and it'll last longer as far as carb's concerned. That's basically what they're doing. I started looking for both a used or a new truck outside of California. Nationwide, I found a computer site that had over 4,500 cranes listed, anywhere from 20,000 to up to 450,000. Some used, some new. After a couple days of looking through that, I found a truck that would meet our specifications. That truck is in Pennsylvania. The truck is a brand new 2020 Kenworth, got 1,300 miles on it. Basically, talking with the dealer back there that I'm going through, they had an order, Kenworth had an order for 5 trucks. Upon delivery, the purchaser refused delivery. So they put those trucks on the market at a reduced price. The gentleman we're dealing with bought all 5 of them. So the net cost was $143,500. The truck was spec'd fairly close to what we want. I think the only thing it doesn't have on it is a bed. So we have sales tax, license fees of $85, $10,000 for bed installation. We have a bed on our old truck that I believe we could take off and put on the new one. But we're looking at about $164,000 for a brand new truck, very, very low mileage and CARB compliant. Now, on the other side of the register, it probably should be funding, not revenue, but we do have the Ag Department, Sealer Department has a deputy position that hasn't been filled for the last 4 or 5 years. I would like to take the money, one-time money, from that position and use it for the purchase of this truck. That's $93,000. We can get a CARB grant for $16,000. We're looking at selling the used truck for $5,000. We have device registration fees that are charged scale owners every year. The part that we would be testing with this big truck is it generates about $11,000 worth of revenue. We have an MOU with Tuolumne County for $2,400. We go over and do their big scales. Part of that MOU is they provide maintenance and safety inspections for our truck. So that gets us about $128,000. So the total requested funds that we're looking for is about $36,000. Next slide, please. Delivery. The truck is in Pennsylvania. 2 things. I would go out and confirm the truck is what we want. I can't, a good judgment by a truck just looking at pictures. Basically, you take the red-eye, fly it out to Washington, D.C. This dealership's 100 miles west of Washington, D.C. That flight is about $200 round trip. Need to rent a car, need a hotel room. If we go through with the purchase, I would send out one staff member to pick up the truck. He's has a Class 1 license, has driven truck. I would like to start this process as soon as possible because the delivery, I'd like to get the delivery of the truck as soon as possible to keep out of the winter. Weather driving across the country. Because of COVID-19, I have made this voluntary. I asked the staff member, it's totally up to him as to whether he would volunteer to go or not. And as it is today, he was still willing to do that. So basically, to recap, we're mandated to do this inspections. We need a new weight truck. We found a truck. All costs $163,000 or $164,000. We have about $128,000. We need request about $36,000. The truck does need to be picked up out of state. We kept that. Again, I'm willing to ask questions. Thank you for your time. I know this is not an easy time for you guys. So is there any questions?
How does the Carl Moyer program fit into this? Will that help at all?
We're getting a grant for $16,000 from them. And maybe I can take a shot at answering it, but Doug could probably give you a better explanation of how that works.
Doug, are you available?
Yes, that Carl Moyer grant, we calculated that out as $16,000, and a Carl Moyer grant is based in large part on the mileage that you drive the truck. This truck is only driven about 1,500 miles a year, and so if we calculate the emissions for that, the best that we can come out with is about $16,000. Does that answer your question, Marita?
Yeah. 16,000 for a vehicle that the total cost is 163,000, that is only driven 1,500 miles approximately. I'm sort of gets my heart to stop, but, and you know, maybe this is something Mr. Boitano could answer. What would it really cost for us to rent this vehicle on an as-needed basis? I mean, 1,500 might not seem like a lot of miles, but if it's used frequently in short distances from San Andreas, the impact is a whole lot different than driving down to Copper or up to Gans Meadow.
You would not find a vehicle that is equipped to rent or lease on an as-needed basis. The closest we could get to that would be to contract with an outside contractor, a registered device repairman, to come out. And I think we projected that cost about $20,000 to $25,000 on seeing what they cost to do our cattle scales this year. Again, that is a doable thing if that's what the board wants to do, but it is also an issue of timing to get the scales done when they need to be done and to be a service to our scale owners here in the county. Basically, cattlemen want their scales done in the springtime or they start shipping. Same thing with the grape growers and the wineries. So it's not only just a cost thing, but it is a ability to get the work done in a timely manner. like I said, there's no truck out there that would be fitted with us. We put about 20,000 pounds of known weight on our truck. Those are standards that are certified back to Washington, D.C. standards, Institute of Technology and Science. We need a crane to get those off and on. The other thing to look at this is if you get this new truck or allow us to get this new truck now, you're looking at a truck that's going to last you for 50 years unless Barb throws a monkey wrench in the work. And like Doug and I both said, we have no idea.
Okay. Mr. Boitano, we have, one, the savings from a deputy position. I'm not sure if the sheriff's online, but I can hear him at the moment. We bought the sheriff a truck and equipment for marijuana eradication. Is there any way that could be utilized in the ag department?
I'm not sure what type of trucks that he bought, but again, too, we need a DPW that's up there quite high.
Okay, just a moment. Mr. Garamendi.
Thank you. Mike, can you tell us about what this MOU is with Tuolumne County? Are we paying, are we buying a truck and they're getting the milk for free? What's going on here?
The MOU with them is...
Mike, you got to talk up. I'm sorry. I'm bad of hearing. I cannot hear you well.
Okay. Is that better?
Yes.
Okay. The MOU with Tuolumne County is we provide services to them to go over and...
Mike, I'm sorry. I cannot understand you.
Are you talking in the right mic?
Is this any better?
No, Mike, can you, is your laptop, is it raised? Are you on a laptop? Because sometimes if you are on a laptop and the microphone isn't accessible ready, then you won't be able to hear your voice. And if you have the volume turned all the way up, then that should help.
I do have the volume turned up all the way.
Okay, we can hear you a little bit better.
We do some cleaning up here. Is that any better, talking down that way?
Somewhat. We definitely could hear those papers rattling, so that's something you want to get close to wherever those papers were that were rattling.
Okay, that's on top of my laptop here.
Okay, that's probably why. So just remove those, and then let's see if we can hear you better, Mike.
Okay, I've got to move. So 1, 2, 3, 4. Can you hear me any better?
I think so.
Mr. Garamendi, can you hear me any better?
Yes, I can, Mr. Poitano. Thank you.
Okay.
Thank you, Mike.
Thank you. I'm sorry about this.
Right.
The MOU with Tuolumne, they pay us $2,400 a year to go over and do their scales with their personnel. That includes a truck and a driver. Wow. Part of that MOU is also they do all our safety checks, repair on the vehicle free of charge. So that was put in place before I got here. That's basically all I know about the MOU.
Can we get that deal?
And the safety checks is a walk around the truck to make sure that the brakes and everything work? I mean, what are they saving us?
No, the safety checks are bid inspections, which are required by the California Department of Motor Vehicles. They're a certified crane inspection, which has to be done by certified inspectors every year. And the bid inspections, I'm not sure whether they're done quarterly or twice a year. The crane inspections is done annually, but those, are costs that were received. Again, I had nothing to do with implementing the MOU, and that's all I know, actually. But
Understood, sir. I just, the crane inspection's probably the one that put our red tag on it, but,
I guess, let me find out where the board is on wanting.
I think Supervisor Stomper had some questions,
Oh, I'm
and then I have
sorry.
a couple questions.
if Supervisor Garamy was done, yeah, I mean, I did have the MOU question on my list. That pretty much answers that. The other question I had, what is, with it being at 1,500 miles per year, there's an exemption on low mileage for getting vehicles that resmog. Now, I understand that that's going to sunset at a certain date, and I'm not sure if that's December of 2020. And at the same time, I do understand that, this is a 1987 International with 450,000 miles on it, I believe. Its life's at the end of its life, and we can't rent anything like it anywhere else. And it's a mandated issue. I mean, personally, I'm in a position where it's like, well, we're mandated to do this. If we cannot get San Joaquin or Sacramento counties to consider doing an MOU with us, is that a possibility?
Mike?
I'm not sure what the question was.
Okay, will we be able to get Sacramento or San Joaquin counties to do an MOU with us? Is that opportunity we have, or are they not willing to consider it?
I would think it would be very unlikely that we would get to do that, just because of their time schedules and their commitments they already have on their scales, or on their trucks, excuse me. Those were the first places I went when we started looking.
Okay. Gary?
Thank you, Madam Chair. Mike, I got just a couple questions. Being that we're buying it in Pennsylvania, is it going to meet California Air Quality Resource Board?
Yes, it is. It's a brand-new truck. The gentleman sent me out 60-some pictures of the truck and all the appropriate stickers on it that prove that fact.
Okay, and the crane certification being out of state, I think you're going to have to get it recertified in California. I don't know if they'll accept Pennsylvania's sticker on it. So just to bring that up, you may look into that. I'm pretty sure that California is going to require you to get it certified here before you use it.
I almost agree, not almost, I do agree with you on that. It was something we had to look in it. The deal is that this is a brand new crane, so it shouldn't have any possible problems passing the new certification, but we can and probably will need to get it certified. I agree with you 100%.
And I for $35,000, I mean, 1,500 miles a year, the thing's going to last more than the 33 years that the previous one did. However, I did run some numbers on the truck we currently have. It's 33 years old with 474,000. That's close to 15,000 a year, not 1,500. So was that a new truck when we got it in '87?
Actually, it was not a new truck. It was a used truck and was used on a route from Sacramento to Reno and back, hauling freight. So I don't know. That's all I could find out talking with the predecessor, Mr. Howard. Going back, I don't know when they bought it, actually, how many miles they had on it.
Okay.
So.
All right. Thank you. That's all I had.
Mr. Stopper?
Should we ask the board if we're willing to consider adding it to the list for the final, we need a tally?
Yeah,
I think we should have a tally sheet again.
Should we do the 35,000 minus 16 from Carl Moyer?
Are we sure, Madam Chair, with your permission,
just,
This 93,000 that we're taking from savings from
I
deputy
know,
position,
we
generally don't let people do that.
well.
We haven't, as my three budgets on this board, we haven't let people take their salary savings to go.
Well, I
think
thought
we've had
maybe-
this conversation with the sheriff often.
Well, I know. That's why I had mentioned it and asked if he knew. Though I asked the sheriff where we wanted to get 50,000, he said from the road department. So maybe our departments are doing things we don't know about, Mr. Garamendi.
Maybe, this is savings for this position for this year, right?
Yeah.
It's not, because we already swept last year. So does that mean we have a position we don't need?
I don't know. I think Ben's correct. Let's just put it on the list. I don't think we need to go into the details now. I think that's a good question.
Madam Chair?
Can I
Yes.
get into this conversation?
I'm sorry. Mr. Mills?
I crunched some numbers as well. If you take the cost of this vehicle and divide it by a 20-year lifespan to amortize it, you're at $8,200 a year. If you take 1,500 miles a year, you're at $4.50 a mile to run that thing. I'm just kind of giving you some numbers here that the next question would be, is this, because like the Volvos now, they're all coming up with 16-speed autos. Is this thing got an automatic or is it a 16-speed Road Ranger? And what is that going to do on the mountains? Autos don't do so well in mountains, is a point. I'm a little concerned about using a position to backfill this. I think we need to talk about it a different way if we're going to do that. But the return here is astronomically high. A red-eye flight, by the way, to Washington, D.C. for Pennsylvania, BWI is way closer, about the same cost.
Okay.
So
I think I'll take Ben's advice and we're going to put this on the list to look at later. And I think when the sheriff, I'm assuming, is going to speak with us, we'll ask him about whether he's giving up a position or not. Is there,
Just a quick question. Is that a deputy sheriff position or is that a deputy?
No.
No, it's not. It's not
It's the
sheriff
deputy
position.
ag commissioner
Right.
position.
Yeah, that's the way I had read it. That's
Yes.
what I was.
Okay, that's clear.
Yeah,
Thank you.
but with the deputy ag commission position, was that something that was calculated into the salary savings this year that's part of the 5%? Lisa?
Yes, it was.
So we don't
No,
technically
well, Mike's
have.
saying no. Mike, do you have another thought on that?
That position is funded. It wasn't wiped out to consider, it wasn't used to reduce the general. We have that in our budget. Or I'm missing something here.
It's a funded position.
Right.
That's good to know, because that clearly,
It has not gone away.
Position, but if we're going to use the money for this, we'll have to go through Judy for the position control list, if we're going to use the money for this and not fill that position.
or it's clear for 1 year, and we don't have
That's
to do
correct.
anything with Judy.
Yeah, okay.
I'm not negative to the idea, I just think we need to find a different way to fund it.
We're open to any of the board's recommendations.
How long has it been since we've had a deputy ag commissioner in there? I
And
don't
this is,
remember.
oh, sorry, Judy, I'm sorry.
So, sorry, this is Judy Hawkins, HR Director. I do want to add some clarification. That position is currently underfilled. So I don't know how much salary savings is there between the Deputy Director position and the position, there is a ag biologist being underfilled in the position, but the position is underfilled.
That's good information. I appreciate that, Judy.
Thank you.
There's a gap there in the money, so it isn't the full $90,000. But, so it may change. So back to what Marita was trying to push us on. Do we want to add this to the end? And then if someone could give us real numbers on what that would be and how much of a gap would need to be filled, we could bring that out in the final tally?
Yeah, and the other thing is, if you're going to bring it forward, the Carl Moyer, the grant, I thought Carl Moyer funds were to be used to bring existing engines into spec, and not to purchase new equipment. It was to replace the engines on existing, so the engines would come into compliance, and not go out and purchase a new vehicle for it or get a grant to add to buying a new vehicle. Maybe I'm incorrect, but that was my understanding, was to replace the bad motors in existing vehicles with new motors that are in compliance.
Supervisor Tofinelli, so our team, Doug Carson, has been working with the team from Carl Moyer to specifically address that, because that was one of our concerns. Doug, could you please supply that information?
Mr. Tofinelli, you're in part correct. There is a portion of the Moyer grant that could be used for, and we call that a repower, what you were discussing. There's also a category called replacement, and that's actually most of the projects that we do is we replace it. One of the reasons for that is that in some of these older vehicles, the space under the hood for those trucks isn't large enough to fit the retrofit equipment. You just can't put it into some engines. And so the only possibility that you can do is to just change out the entire vehicle.
Okay.
There's a third category, just as a point of reference that we've added, is infrastructure. And so we did a project last year where we put in electric bus charging for Calaveras Unified. So those are the three options that we have for Moyer.
And just to get through this real quick, if you're going to take that grant and replace this truck, you can't resell that truck out on the market without taking that motor out and destroying it. Otherwise, you're getting a new truck, and that's truck still on the road. The idea of Carl Moyer was to replace those and get them off the road.
Yes, and there is a project life when we discuss a grant, and the maximum amount that we have for a replacement truck is 7 years. So yes, we would have to keep the vehicle for 7 years before we resold it.
That's the new.
Did it for one of the ag.
That would be the new truck, yes.
Okay, I want to move on. We're going to put this on the to-do list to be discussed when we finish going through the budget. Is there?
Thank you for your time and consideration.
Okay, thank you. Is there another staff? Sheriff DeBasilio,
Yes, ma'am, I am here with bells on.
could you speak into the mic a little bit? Oh, my gosh.
How do you like that? So
Sheriff.
I appreciate you, Madam Chair, offering up my piece of equipment that I bought with asset forfeiture money. But unfortunately, that piece of equipment will not work for environmental health. It's a pickup truck, not a boom truck. But I appreciate you offering that up. Good afternoon, board members. How are we doing today?
Rick, she offered up a deputy too, so.
I saw that, but she was confused. She didn't realize that it was a different deputy. So I'll take that one back. I'm okay with that.
There's your 50,000.
I figured out the $50,000, Marita. I want to bring a couple things to your folks' attention. Your 5.3% cut that the CAO put upon us equates to what Krista said was $1.85 million. I want you folks to realize that the Sheriff's Office with that 5.3 cut is almost $900,000. So it's almost half of the 5.3% to bring this budget into balance. Out of that monies, the CAO's office did not accept our $165,000 adjustment for the shift differential pay that you folks approved. So there's some monies there. There are...
Excuse me,
Yes, ma'am.
when you say the 165, there's monies there, what do you mean there's monies there? There's monies
Well-
you're willing to give up or monies you want?
No, ma'am, that's money that you allocated, so you should be paying for it. It's $165,000 that was put into the budget that the board, or the CAO's office has pulled out. And that's for shift differential pay. And when I say there's monies there, that's money that we put in our budget that got pulled out. There's the only thing, and I've talked to a couple of supervisors, the one thing that I'm not asking for any money, believe it or not, at this point, except for the $50,000 that we talked about, Ms. Calloway, the other day. There are some things, some changes that I need to request that I brought to some of your attentions. But let me go to the $50,000. That is Avtech remote radio equipment upgrade. And what that is right now, the state of California has allocated just over $200,000 to our department to get our radio systems up and running for the new 911 system that's coming into play. The $50,000 that I am looking for is to upgrade our equipment. This equipment is equipment that was put into the sheriff's office going on 6 years ago now. It's outdated, and if it goes down, we cannot, or the company that we utilize to repair our programs cannot access in. So if our system goes down, we're done. We have no radio systems for my deputies, your deputies that are out on the street. So when I told you I was going to ask you for $50,000, I had talked to, again, some of you about the salary savings. We don't have any salary savings coming up this next year out of the patrol budget because we're completely staffed with the positions that you have allocated me. I do have some vacancies in dispatch and in the jail. However, we're doing some very strong recruiting. We just interviewed a bunch of folks for our jail and our dispatch center. So the county needs to be prepared for next year. You're not going to have that proverbial money to sweep, because if I fill up our positions, which I'm planning on doing, the county has had the enjoyment of seeing between $1.2 and $1.6 million a year out of the sheriff's office in salary savings, and you're not going to be seeing that, hopefully, anymore, because we're able to fill our positions and retain these people. And a lot of the retainment goes with the help of what HR has done. I have to put kudos out to Ms. Hawkins and her crew.
With all those positions filled, Sheriff DeVasilio, will you be cutting down on overtime hours then?
I will if our country comes back into compliance to where we don't have overtime related to BLM protests and fires and everything else that we have to deal with within the county. As far as the overtime on would not need to be fulfilled to the point to cover shift, to answer your question. But there is always going to be overtime. We have homicides. We have things that go on in law enforcement that require people to come in and spend some extra time. So I won't say that the overtime is going to go away. It will be reduced immensely, provided all those positions get filled. And they stay full. That's the other catch. We've had a history of people leaving and going to other areas. I hopefully have resolved some of those issues. I'm hoping that people start sticking around a little bit more. So back to the budget part of it, the salary savings that we're going to be seeing in this next coming year, I would like to, and this goes to you, Mr. Callaway, the $50,000 that I talked to you about, that radio equipment upgrade, I can do a budget transfer and utilize some of those monies from what salary savings we're going to have. I want to caution the county on continually, again, planning on sheriff's office salary savings to balance their budget. I wouldn't have to ask for anything if you folks wouldn't take my money, is the bottom line. I have a couple of positions I wanted to talk about. I know the CAO mentioned no new positions are being recommended, and I understand that. However, as you five know, I always come up with an alternative way to do things that not only benefits you, but it benefits my department, in the sense that I have a senior dispatcher position that I have requested that did not get addressed. I have a dispatch clerk that I would like to change to a senior dispatcher position. I have 4 shifts, 2 senior dispatchers, which leaves me short-handed on a senior dispatcher for supervision. So I'd like to take one of my positions and just make it a senior dispatcher position, not backfilling it, just make it a senior dispatch position. It's a cost of about $2,700 a year. I mentioned to you folks at budget that I have one of my detectives that is going to be leaving for a year deployment. I already talked with Ms. Hawkins about this. We cannot fill that position for longer than 6 months. So what I am requesting is that you allow me to promote a deputy to a senior or to a corporal's position. Mind you, and the HR can attest to this, as our auditor controller did a little bit of research, and when the deputy leaves for leave, the county has to pay him for 30 days, and then he is going to use his accrued vacation and accrued CTO time to continue with his pay. So we won't be paying him for a full year, but we will be saving, somewhere here I have my notes. Here it is. We'll have a savings of about $61,000. The cost for the year to promote someone is about $51,000. So there's a $10,000 salary savings for this year. Now, mind you, next year when he comes back, which would be in September of 2021, we would accrue that new, it would be a position that we would have to pick up. So there would be a cost, but it's not going to be right now. It would be a year down the road. So that's a request that I'm making, and we need that as, if we short our detective division, it hinders us not only in our marijuana program, because they work in our marijuana program, but the citizens of the county won't have the ability to have that extra detective to do the work that he does. He is very instrumental in solving a lot of our crimes. What else do I have?
Mr. DeBasilio?
Yes, sir.
On the detective position, that's corporal, correct?
Correct.
So you're talking about raising somebody from the deputy position to corporal position?
Correct, and that was a position I talked to you folks about at budget time, and I said I would not be asking for that position back until after mid-year, and I've got some other information to show you how I'm going to be bringing in more revenue to the county to help pay for that position. So go ahead.
So, you did bring forward on the, some of the savings. So, 10,000 savings this year, but going into the next year, are you planning on refilling that deputy position, or are you going to burn that position to be able to fill 2 corporal positions?
No, that's the other part of this conversation. And Ms.
I'll
Malata
wait for it. I apologize.
Oh, that's okay. Ms. Malata can attest. I have been working, as you well know, with Department of State Hospitals to secure our one section of our jail for mental health beds for the state hospital system. It looks like we'll be bringing a contract to you folks, hoping, got my fingers crossed, in October, which means the contract would be signed by the board and then be sent to DSH. They would sign it, so the contract would probably start in November of this year, and then we would actually be putting people in beds in December of this year. And what that equates to is about, and this is after paying the 2 correctional officer positions that I will be coming to you for, specifically for Department of State Hospitals. The state will be paying for this whole program. They're paying for our mental health system. They will be paying for the psychiatrist, the psychologist, the mental health clinician, the administrative assistant. They'll be paying for the 2 correctional officers. After it all has been said and done, the sheriff's office will see just over $400,000 in revenue because of this program. So to answer your question about the corporal's position, I would not be backfilling a corporal's position, obviously, or I would be. When the deputy came back, he would assume that position. And then, as I've talked to you folks before, I am looking for another person for my marijuana team and that long proverbial captain's position. The funding that I will be bringing into the jail will pay for those positions. So there would be very little, if any, money out of the actual general fund that you see in front of you today. So again, I find a problem and I find a solution so that it works for you folks and I.
Okay.
That's pretty much all I have at this point in time.
I mean, there's several components. There is right now, there's midterm, and then there's next budget cycle. I'd like to see what background he'll bring next year. So for right now, that we're to consider, Ms. Van Lott, can the sheriff move salary from one part of his budget to another, correct? That's already been, that he already has, like move from the dispatch, because that's where he has it, to pay for the 50,000.
Yes, although that's the type of technical adjustment that could easily be made at mid-year, because they have plenty of appropriations for us to just move the money from somewhere else in the patrol budget or the dispatch budget and then make the fix at mid-year.
But the sheriff's going to wants to know, can he commit to the communication system upgrade now with what's proposed?
This is for dispatch?
Yes, this is the AvTech program.
Yes.
So we would need to, when we bring back the capital asset list, we would need to add it to the capital asset list and increase appropriations in the capital assets object code and decrease appropriations somewhere else in the budget unit, but that's fine.
Okay, is that acceptable to you, Sheriff?
I'm sorry, I was talking to Oscar real quick. Can you say that again? I'm sorry, Krista.
Just that we would we would move money from elsewhere in the budget unit onto the capital assets line and update the capital asset list. And if there were any further changes that needed to be made with respect to that, we could make those tweaks at mid-year. But that budget unit has plenty of overall appropriations to get from here to mid-year.
She's saying.
Is that acceptable?
She's saying use existing money within dispatch, and then immediately we'll do the transfer from jail, for example.
Yeah, yes.
Yeah.
Yeah, that would work. That'll work.
As long as we get reimbursed.
Yeah.
Okay. Was there any funding in any of your funds that could be used too? In your special funds? I'm just putting that out there.
Yeah, the county's.
Yeah, in our the county's fund balance.
Oh, well.
AB 443, I think, has some available.
Yeah, that was my whole point, is that 50,000, we could pull that from salary savings out of the jail at this point in time, so that I can get that program upgraded.
So
I hate to push it out any further, is the point, because it's an old system. It needs to be upgraded.
No, you've got it. You have it. You're just going to come from another pocket within your budget. Is that correct, Krista?
Yeah, and then we'll fix it at mid-year
And
if
then
we need
fix it.
to.
Okay, so
Okay.
the sheriff can proceed with the communication
Once-
upgrade now.
Once we have an approved, an adopted budget,
Got it.
rather, on the 22nd.
Okay, thank you.
Okay, and then you're correct, Ms. Callaway. The other two issues are down the road, but unfortunately, those two correctional positions. Again, I'm just making sure that I put this on your radar, because if this contract gets signed in November, I'm going to need to hire 2 correctional officers for those positions in November. So that's one of the issues. Again, the state will be reimbursing us for those positions. The second issue is I would like to get the dispatcher clerk senior dispatch position done as soon as possible, so I can get my supervision back to where it needs to be.
Okay.
And then the detective is actually leaving on the 23rd of this month, so I would like to be able to do the promotion sometime in October, at the latter part of October, maybe the 1st of November, so it's going to be before mid-year, so that I can get this person online to start doing some work.
Okay,
and not get them out.
let's deal with this one at a time. The difference between a dispatching clerk and a senior dispatcher, I believe the sheriff said, was about $2,500, $3,000 difference.
About
Is there-
$3,000.
Pardon, a year? Yeah. So, Ms. Hawkins, Ms. Von Lock, do you see a problem in that occurring?
My recommendation from the administrative office's perspective would be to, as the board directs with respect to the position, but that we revisit increasing the appropriations by $2,900 until mid-year. Again, it's falling squarely into the category of something that can be absorbed in that budget.
So the 2,900 would come from where?
Elsewhere in the budget unit. That doesn't even require a budget transfer of any kind or any board action.
Well, that's $2,900 is just salary.
It's already in there, Gary. It would just be a position control adjustment to change that from a dispatch clerk to a senior dispatcher.
That's correct.
And they've offered a chill on everything, and I think that's why he's asking.
So what's going on with the differential then?
Well, we haven't gotten to there yet.
Okay.
Do you have some money, Mr. Mills, you want to authorize?
Yeah, let me grab it. Which pocket you want it out of?
Okay. So, Judy, do you see an issue once we approve final budget?
No, once you approve final budget, then the next, so on the what is the next 22nd, I can bring a reclass forward.
Okay, thank you. Is there any questions or concerns the board might have on that position? No? Okay, thank you. The other position that seems, unless I'm not hearing correctly, the other position seems to be taking a deputy, reclassifying a deputy to a corporal, not filling the deputy position. Do I have that correct, Sheriff?
Yes, ma'am, at this time.
I love that, at this time. Okay,
I always leave myself an opener.
all right. We can put that on the list. This seems to be something that would need to come back at final budget, but what is the pleasure of the board on this? This is something that, if I hear correctly, would need action sooner rather than waiting till midterm.
Well, that corporal position's already filled and funded, is it not? So when he retires in a couple of weeks, you said, you just want to move?
Military.
No, he doesn't retire, Gary. What's happening is that he's going on tour of duty for 1 year.
Oh, okay.
So I actually have to hold that position, so the board is going to have to make another corporal position.
I see. I understand. I thought he was retiring. I thought you said he was retiring.
Okay, Jack?
It seems like, it sounds like I'd gladly pay you tomorrow for a hamburger today. We're picking up, in net, it sounds like we're picking up a position, we're committing to a position for next fiscal year. I have no problem promoting a deputy. I mean, we got a lot of new guys and gals out there, and having senior officers is really important. So I'd support that, but we just need to know that we're committing to next fiscal year,
That's correct.
adding a body.
That is correct. And please get that correct, Ms. Glenville, that he is adding a position for next year. Dennis, do you have something?
It doesn't cost us anything this
But
year.
I thought he was going to lose a deputy.
No,
So-
see,
No.
that's what we just discussed, and you said out loud at the very beginning of it, Marita, is reclassifying corporal into a position. Yes,
Correct.
one corporal, let me finish, and not refilling the deputy position.
Correct.
Correct.
So, in fact, losing the deputy position.
Correct.
This year.
No,
That's
going
what
forward.
Rick said.
Well, you know what? We can renegotiate him opening another deputy position in the future.
When the
I-
time
understand
comes.
that.
Right.
But I think what Jack was saying, we're committing to 2 corporals, in essence, for the 21-22 budget.
I think
And that's-
what it would do is, check me if I'm wrong, Sheriff, but I think what you're saying is that this commits us to a corporal and a detective are about the same pay level, as I understand it.
They are one and the same. Let me be clear, because it sounds like there's a little confusion. What we're going to do here is, I'm going to promote someone to a corporal's position to backfill the position that is going to be gone for a year. When that person comes back in a year, I will have gained a corporal's position. So I'm not gaining 2 corporals, it's 1 corporal's position. And I'm going to come back to you folks at mid-year to backfill that corporal's position and get that captain's position and get another deputy for the marijuana program's position with the monies that we'll be bringing in from the hospital, from the state hospital contract. So there's not going to be any monies out of the pocket, but for today's conversation, it is promoting a corporal to backfill a corporal that's going to be gone. There will be no cost. There'll be about a $10,000 savings in this fiscal year. So in essence, next year, you will have to pick up that corporal's position.
That's right, and that's what Jack was saying, Rick.
Yes.
That's what he was
But I
saying.
just want to make sure that you didn't think you were picking up 2 corporal's positions, because I get beat up enough on positions as it is.
I was just making
Okay.
sure we're closing the deputy's position.
This year. He'll be back next year.
We'll be back at mid-year.
Dennis,
The deputy's still going to be there.
No. I'm just,
Well, he'll be in the corporal position.
Right. The deputy's going to move up, but the sheriff's going to want to fill the deputy position. So
Not now.
it's net, well,
Not till
this
next
time next year it'll be net positive one corporal, but we're not losing a deputy in the process.
Yes.
Sheriff, the way I read it, you're
Yes.
going to be able to make up the cost on this thing over the next budget cycle anyway, so as long
Okay.
as everything goes forward, I'm in support.
All right, so what we are approving is another corporal position, not filling the deputy position that the corporal will be coming from at this time.
Did you agree? Is that correct?
That is correct, Ms. Calloway. Thank you.
Yeah, you guys don't think I know how to play ball. I
No, no, no.
do. All right.
I'm sorry,
just-
but, let me run down some real numbers here. Topped out, what's your deputy cost per year? Everything. Insurance, salary, everything.
Let's see, Deputy Sheriff 2 topped out is 118 and 144. A corporal top step is 169, 437. The difference is $51,293. That would be the difference that we would be paying for this corporal to be moving up. However,
You're saving 61,000 from the corporal that's actually in the National Guard this year. I
Correct.
understand that with the $10,000 savings there, actually.
Correct.
But we move into the following year and we decide to fill that deputy position at the very same time, and we're in fact paying $172,000 more a year on top of everything else by leaving that open and saying we're saving $10,000 this year. So it compounds as worse the second year down the road. So I think it should be a
No, it
discussion
doesn't.
for the next budget. Well, absolutely does.
I disagree with you, Supervisor Stopper, because you still would have that deputy's position at $118,000. You've picked up a corporal's position, which is in essence $170,000. Yes, but you still have that cost of that corporal's position. So the difference is still only $51,000. You're not doubling it up because you haven't lost that deputy's position. You've moved him to a corporal's position.
No.
That's not correct. No, you have the full funded corporal position then going forward after that, plus the deputy position.
Right, but you have the deputy's position
So you're
now.
not, you can't just say every year it's only going to cost me $51,000.
No, I'm not saying that. I'm absolutely not saying that. I know that you're going to be.
The only other way we can do this is if we're going to add a corporal position, then you got to delete a deputy position. Then you're only talking $51,000 a year.
I understand that. You're right, Supervisor Toffenelli, but you have to remember that the position that I'm going to backfill him with is monies that I will be bringing in from the Department of State hospitals. I'm not asking you to fund another position right now. I'm asking you to fund that position once I get the Department of State hospitals program up and running,
Got it.
which should be in
Understand
December.
That's
So
general fund dollars, isn't
No,
it?
he'll be bringing in money.
It is general
for the
fund dollars, but it's monies that the sheriff's office will be bringing into the general fund in the tune of over $400,000.
It'll be similar to a grant, except it'll be a contract, an ongoing contract.
How long
And
is
he'll
it?
be
Let's continue on that conversation.
Wait, please, don't interrupt. You told me not to.
Sorry, my apologies.
So oh gosh, the sheriff, every year, we really need Valium before he talks. What he's going to be, well, go to Little Trees. Okay, so we're going to be bringing in a contract similar to a grant, and in that contract, the sheriff will need a corporal. Do I have that correct, Sheriff? That's where the corporal...
No, the contract is for 2 correctional officers
Correct.
to work the program. The money, the revenue that will be coming in because of the contract is what we'll be able to pay for the other deputies that I would like to bring on.
Okay. Why don't we deal with that when the contract comes in? I want to stay focused The sheriff's telling us what's coming. Let's stay focused on something that we need to do now. We need to do now is grant him another corporal position because his one corporal's going out on military leave. Is that something the board will support now? Or do
Yes.
you want to talk about it at the end of our?
Let's put it on the, let's put it on the list.
Okay. Rick, it's just going on the list, please, the sheriff. Okay. The other is the dispatch clerk to senior dispatch. Do you have a problem with doing that?
That was the $2,900?
Yes.
And if I might, Supervisor Topanelli, that again has already been budgeted. It's just a reclassification of the position.
But,
Yeah, okay.
okay, do you have a problem with that?
No.
Okay, no. Okay, no. Okay, that's a done deal. The other that is a done deal is the communication system. Pardon? Oh, Krista and Oscar will work that out, and that'll come back at final budget approval. And the only ones that you all would like to talk about is the corporal. Is that understanding, Gary? Okay.
I'm good with Corporal.
Ben, do you want to bring it back on the list, or are you good with it now?
I'm good with the corporal position. It's how we're doing the deputy on top of it, because that's recurring.
He's not going to seek a deputy till next year, is that
He's
correct?
not. Yeah.
When he gets the
That's
contract,
the
and I have an issue with that myself, like Ben does, because it's recurring. If that contract goes away after 2 years or whatever, he's going to want funding to keep that deputy.
Supervisor Topanelli, obviously with any contract or grant, it could go away at any time. But I have been assured, and again, Ms. Vondelata can probably attest to this, that the state said that this contract will not be going away anytime soon because of the fact that they don't have the mental health beds to put people in, and they're actively trying to recruit more jails to do this program. The contract that they're giving us, the contract they're giving us now is a 3-year contract, but they don't see it ending anytime soon. And again, I admit that you never know what could happen in 3 years.
Okay.
But they're stating that this is going to be an ongoing contract, just for information.
All right, so go ahead, Ben.
I have full confidence in that contract's going to be going for quite some time, and I do appreciate all the work going into that. This deputy position in patrol, that's going to corporal?
Well, no, the corporal's position is in the investigations unit, Mr. Stopper.
You're pulling from a deputy position, correct?
Yes, it's a deputy that is on patrol that will be going into investigations.
Right.
Correct.
So that's separate from the jail end. Now,
Correct.
Right. So that's an open position in patrol still. And then when you come back at mid-year, you said you were going to request for this grant a captain, two correctional officers.
No.
No? What is
with the grant funding, I'm looking at the captain position and 2 deputies positions. One for the MET team and one to backfill where that corporal just came from. The 2 correctional officers that I will be coming to you when the contract is signed will be for the jail. They're correctional officers that will work specifically with the mental health program. And that is part of the funding that is within
the $400,000?
No, it is not. It is
separate,
above and beyond the $400,000.
That's better understood. Now I understand that. That's something I wasn't understanding fully before, so now you've brought it closer to flush. Okay, that makes more sense to me.
Yeah, that makes more sense. So you're saying you have, above and beyond all what the state's paying for, you have an additional $400,000.
Correct.
That you can play with, or whatever you want to use to backfill.
Whatever you allow me to do with it, Mr.
We'll
Toffenelli.
read the details. So
My apologies, sir.
the question on the table now is, do you want to approve now the reclassifying of the deputy, or, excuse me, establishing a new corporal position? Mr. Mills said yes. Mr. Tuffanelli wants it on the list. Mr. Stopper, would you two quit looking at each other to see what you're going to do?
I'm just trying to get a hairdo right.
Come on,
But-
tell me, are you a yes or a no here? Do you want him to have the corporal now, or do you want it to go on the shopping list?
I think as with everything else, it should come at the very end of our budget hearing. I'm
Okay.
totally in support of it, but, you know.
want it on the list?
I want it on the list, so I see
Jack?
all the numbers before I say yes.
No, I'm a yes. I'm a yes, so it's 3-2. Dennis and I. Dennis, you and I are agreeing.
Did you hear that, Rick? Marita is a yes.
I guess I owe her a scoop of ice cream now.
What the heck happened there?
So do you want it on the list, Jack, or do you want him to look?
I don't know, we'll have to figure out what we're going to pay for it.
Oh, yes, the sheriff will have to figure that out because he's not getting any money for
I
it.
mean, I can say yes, but if we don't fund it, then
Well, then I'm a yes if you're not going to fund it, then.
Sheriff, on the contract, are we going to get our administrative cut?
What was the question, Dennis?
Are we going to get a 10% administrative cut on that contract?
We'll see when it comes to us, Dennis.
He's not smiling.
10%
I want to keep moving, please. Okay, Jack, do you want it on the list, yes or no? Or do you want to just say, yes, he can have the corporal now?
yes, yeah, the corporal.
Okay, 3-2, he can have it. Judy, Krista, did you get that?
Yes.
Okay.
So I will be bringing back a corporal position. Then when he promotes up, the deputy position will be frozen at that time.
Correct.
Got it.
Excuse me, don't we have to tell you where the funding is coming from to do that?
No, Rick's going to get it within his own department.
Funding is already there, Mr. Toffanelli. It's because
Okay.
the deputy will be
All right.
leaving. It won't occur until after the deputy leaves and he clears the books.
Okay.
We're going to have to pay for it next year.
But yes.
Gladly pay you for it.
Okay.
Tomorrow for Saturday.
Now, the shift differential, I think we need to put that on the shopping list.
CAO took out, he said, we voted and funded, and the CAO took it out in this final budget for the shift differential, which,
We agreed to it, Gary. We're already going to have to pay for it. Why is it a
Well-
discussion?
Krista, did you have something you wanted to add?
Yeah, I mean, essentially what we're recommending here is that we table this part of the discussion until mid-year when we have more information. I understand that the sheriff's not anticipating the same level of salary savings necessarily in patrol, for example, that they've had in prior years. But he was quite correct when he quoted in this case, 1.17 million is what across 4 budget units in the sheriff's department had for salary savings as of June 30th, 2020. And altogether, there was another $200,000 or $300,000 of savings just for last year among 4 of their budget units. So our recommendation is to revisit anything related to salary and and benefit increases or additional appropriations until we have the benefit of additional information at mid-year.
And Madam Chair, it's my recollection that that's what our discussion was at preliminary, that we didn't hard know it, that the board didn't agree to put it in, that we agreed to look at what their expenditures were at mid-year and make a decision then. So I don't think it was ever reprogrammed in after preliminary based on the board's direction.
That's correct. I have, it was to be reviewed at midterm. Okay. You've come out with a 3 now, Sheriff? That's enough, that's all.
I appreciate the board and admin's due diligence on making me look pretty yet again. Thank you.
Okay. Jack?
Can we take 5 minutes, Madam Chair?
Yes, please. We'll take 5 minutes. Well, in fact, we're going to take 10 minutes.
We should put this for a picture with Dennis and Rita and Jack boat.
That's scary all by itself. Rita, are we going to cut it at 5?
Okay, let's get back to the Monty Python show. Okay, are there any other departments that wish to? None? Okay, so CAO alt, Ms. Von Lada, do you want to?
Yes, Madam Chair.
We could possibly finish today, but we still have to come back tomorrow for items 18, 19, because we have to have an approved budget before we can do 18 and 19. Or we have to maybe modify the budget for 18 and 19. How would you like to proceed? We can go in and start talking. Really, the only item that I see on the book is the ag truck. Krista said, we'll be updating the capital asset list. And that'll come back. Is there anything else you think we need to deal with?
We've given you all the material that we have for the recommended budget, and the transfers that are outstanding that you referred to that from public works. So it's really the prerogative of the board how you want to go about making the decisions now. We have the question about our policy level minimums, whether or not you want to maintain those at policy or move the CARES Act money into a separate fund, and then any other potential expenditures that you might add to the recommended budget.
Okay. What's the pleasure of the board? Do you want to take these items up now? Do you want to take up the ag truck now? I do want to close budget discussions for the day by at least 5 o'clock, if not before. Ben?
I think it would be prudent to bring up the ag truck now, and also with the understanding of what's the difference between the deputy ag position and the position that's using some of that money. So is that going to be a difference of more than $40,000?
Dennis, did you?
Keep trying your mic, please.
I have the position control list here, and I'm not seeing the same amount of money between the underfill and the actual position to...
What page are you on? It's under the...
No, it's,
The page's numbers are on the bottom.
I was
Yes.
just looking at,
It's on ag.
Yes. I thought it was under,
I had it
under
earlier.
environmental.
It would be under environmental.
Environmental.
And then it's under ag.
It's page 15.
thank you. Somebody's watching over us. So you're looking at an underfill on Division 42, Assignment 06, Deputy Ag Commissioner. And look at the hourly rates between that and the underfill rate.
It's $5 and some change.
That isn't, in other words, that's not a fully weighted number.
Right. So
Do you agree, Ms. Medina?
max hourly, $29.72.
Judy, do you want to translate on how they would get to 93,000? Is it from the hourly rate, let's say the maximum?
So I did, while we were on the break, I did some rough estimates, and I was talking with Ms. Medina, and just the difference, and if we added in the fully weighted and everything, you could possibly come up to about 23,000. But another possibility that could have occurred, they also have a vacant position that was added for cannabis regulation, and if the employee who, the ag position, biologist position that is underfilling, if some of the time was charged to cannabis regulation, that may have also created a salary savings in that position.
Judy, how much would that be?
I personally don't know, because I don't know how much of her time could have been spent on cannabis regulation.
I guess what I'm trying to say is, are we shuffling enough of the hourly rate here to get to 93,540, or are we going to be short?
Can I ask a quick question? Sure. It says that the ag inspector 3 is the position added for cannabis regulation effective 12/21/2019. So that would be a full year this
December.
This year starting July 1st. So that's 60.
So what's the value of that particular position, all in or fully weighted, would be the question.
So, Madam Chair, might I help the discussion a bit?
Please.
Madam Chair. So if the board is of the perspective to allow us to work with the department, both EMA and ag, to find capacity in their existing budgets, we can do that. If you're in agreement, we bring back the transfers. That's pretty easy for us to do, as opposed to adding additional expenditures for the vehicle. So to me, it feels like it's a yes or no type of response from the board. And if the board's response is no, we don't want to add an additional expenditure which further decrements our contingencies, then we can sit down and work with the department where they may have areas that they can fund the truck themselves. And we can do all the work that you're prepared to do right now in the board meeting. Or in the alternative, if you're willing to add the expenditures, we can build them into the budget. It'll further reduce our contingencies, but then we can also work with the department to minimize the expenditure as much as possible.
Mr. Alt, I would support that with one condition. I want to know what that MOU with Tuolumne County really is. I really do. Because I think that there's something here that might need to be renegotiated. If we know how much this is costing us per mile or per year to operate, 2,400 doesn't even begin to start. So.
Understood.
Jack?
Yeah,
I think we got to flush this thing out a little.
I
This
agree.
MOU, I'm not feeling like, San Joaquin's got a pretty good equipment replacement program. I think they got some awards for that. So all their equipment may not all be junk. I would like, this needs some work. So I'd be a no at
Okay,
this time.
so we're not saying no to the concept. We're just saying we don't feel we have the information that we need to make the decision.
Right.
And it can always be brought back to the board. And if it's something that we're comfortable with, then we'll find the revenue to do it.
I don't like being jammed up at the end of the year, knowing that this thing's not going to be CARB compliant at the end of this year, and we're in September. We haven't seen this in preliminary budget. Certainly, missing a 3-axle truck is not something you just overlook. So I'd like to have this unpacked some more.
I'm not really familiar with this. Did Mr. Boitano say we could lease it if we needed one or rent one?
Nope.
I couldn't.
That was a negatory.
Oh, that was a negative. Yeah.
I'm in disagreement. If you read what it said, they can't even use the truck right now. They need $17,000 to get it even fixed to where they can even use it. We're mandated to do this service to the county for weights and measures. This piece of equipment, if any piece of equipment, even in Public Works, lasted us 33 years, if that's how long we've had it. He couldn't tell us, but we've had it for a number of years. And they're asking for $35,000, even if we bump it up to $50,000 to cover the difference in the salary savings. We're going to get a truck that they pretty much put everything they can in to get what they could for $50,000. That's going to last us a number of years that we don't have to worry about. What we're talking about is MOUs and other things. I think it's a no-brainer myself to just give them $50,000 and go get the truck, bring it back and put it to work, because we're already in September. I don't know how long they're been out of compliance of certifying everything that needs to be certified, because we don't have a truck. I'm in agreement with Jack on the MOU with Tuolumne. I need to know exactly what that is, how long it's been in existence, and is it costing us more than with the man and the truck and the diesel and the equipment? Is it costing us more than $2,400 for just one trip to Tuolumne and back? What are we performing for that? He said that they are certifying the truck up there. I don't know if he meant the crane or they're just certifying the truck that it's road ready and riding it off so they can put it up to the CHP saying, yes, the brakes work and the transmission works and what have you, what a CHP inspection does when you pull into the scales and they want you to come here, buddy, pull over and we need to verify. So I'm in favor of it. I don't think I think it's something that we need to do. And they've obviously done everything they could to find the money as much as they could. Their original request was $35,000. I'm willing to at least bump it up to 50 to cover any discrepancies that they may have. But I don't think Mr. Boitano would have been there asking us if it wasn't something that he thinks that department definitely needs to meet their mandates. So that's where I'm at.
Yeah, all very, very good points. May I also bring up, in agreement with Mr. Toffanelli, that it's a capital asset that we'll be purchasing. It's going to have to go through the same process as what we've had to go through with patrol cars in the past and the lag time. So the longer we wait, the longer that lag time is going to go past that day. And for that very reason, I think we need to expedite the process to be able to obtain something that's mandated. And then, along with the Tuolumne MOU, when is that up? That's a crucial part. I mean, we can sit here all day and talk about it, but if we got another 3 or 4 years on it, just a note to Ag, next time it gets brought back, that's when we're going to revisit it and see if it pencils out then. But I'm in agreement with Mr. Toffanelli. It's a capital asset that, we need to facilitate the process going forward.
Where do you see the money coming from?
That was going to be my question, I think we need to let staff decide how they're going to work out the funding on it, because it's going to be an amortized.
I don't care if they figure out the funding for it. I think they need to figure out the funding, and on the 22nd, when it comes back to us, have it figured out for our approval is what I'm saying. The problem is this truck, even if we pour $17,000 into it to get it out there compliant so we can go do what we're mandated to do, the carb on it is going to be up on December 31st this year anyway, so it's only a couple of months. Then where are we going to be? Are we going to be paying thousands and thousands of dollars to have Sam Joaquin drive up here to do our job for us? In the long run, that's not going to be the right way to be. But if they can find, when it comes back to us on the 22nd of September, the answer to funding for this truck, then I'm all for that.
Madam Chair, just to be clear, can I summarize the direction that I just heard?
Well, wait a minute, I want to make sure.
Or at least summarize it in the context that you may be able to try and discern whether you have 5 people in agreement or not.
3.
3 out of 5.
Go ahead.
So I believe what I heard right now is that the board would support in the affirmative the addition of the capital asset at final budget, provided we come back with a recommendation that does not add to the expenses of the budget we're recommending now.
Well, yes, that's correct.
I wouldn't.
Not.
Okay, go ahead.
He could be taking the money from somewhere that's already budgeted somehow or other, not from a contingency or reserve.
Well, that's in fact what I'm saying. I'm back to the original question that I have for the board is if you want this to come out of contingency or not. If it comes out of contingency, we should probably, actually before you have any discussion about whether or not you're going to add any expenditures, we should have the discussion of whether or not you want that $4.6 million of CARES funding to come out of the backfill of contingency to the policy minimum. Because until we decide that, every discussion the board has here following continues to lower the contingency. Or, in the alternative, uses the backfill that CARES funding has provided for the contingency. So that's a much bigger nut to crack. And we don't need to crack it if the board's saying they'll support the add of the capital asset, but not the add of the expenditure. Then it's just a matter of us figuring out where to get it under the current budget, but we're bringing back an asset that the board would vote on at final. But it's a really important question because earlier in the meeting, we had discussions that it may be the policy direction of the board that we're going to fall below our policy level minimums on our contingency. And if we take the CARES money out of that contingency, I don't know what the dollar amount is going to be, but we're going to be well below the policy minimum if that CARES funds come out. In which case I would highly recommend against adding any expenditure to the budget at all, including a $50,000 add. At this point where our contingency will be if we take the CARES Act funds out, we won't have the capacity to make that kind of discretionary expenditure from the contingency.
Mr. All, one thing that I'm looking at here too is this 3-axle vehicle is almost like a rotator. It's a unicorn and very difficult to find, and I really appreciate the effort the staff has put into it. Is there any way within that department's budget to shuffle it around to make this work without adding to contingencies?
I haven't worked with Lisa directly on this. I know Krista did. Maybe she's better positioned to answer the question, but I'm sure they've done a lot of work trying to do that already and minimize the expenditure. That's why they're before the board. But that doesn't mean we can't try to look at other budgets and see if we can find a solution that doesn't add. It just means it may well come from a different department that has to make a sacrifice that has already made a cut.
Can we do what we did and we discussed with the sheriff? Can we find the funding in their budget and then revisit this at midterm?
Yes. Yes, we actually can.
And then that way we'll be more settled where we are in midterm and where we are in contingencies or whatever. At least find the funding, let's get the vehicle here, and then at midterm we'll look at it.
Right, which is precisely what we did with the $50,000 for the AvTech. We'll just be moving that off of a different line item in that budget unit in the short term, and then we can look at mid-year and see whether the budget can actually absorb that or we need to refill the pot there at that point. And we can do the same here. What we would do as a practical matter is simply update the capital asset list and move certain of their existing appropriations onto the capital asset line, which we could do with just a very simple addendum that would go with the budget and not actually require totally and completely redoing the budget.
Wait a minute.
Yeah, she may have enough at midterm in salary savings of the 3 vacant positions to cover that. We just.
Yeah, when we go through and we look at what Ms. Hawkins just suggested, we look at when we combine all of those things, and depending on how the rest of the their budget expenditures go between now and then, there might not even be an adjustment necessary.
John?
Yeah, you done. Can I?
Yeah.
So, just so I understand, so you're suggesting we put it on the capital assets list. They find the money somewhere in their department, and then we see if they could pay for it at mid-year? Or what if they can't pay for it at mid-year?
Then.
What if the salary savings doesn't really exist? What are we actually doing? So it's, I mean, we just paid for a Hamburger Tuesday for one today. I get that with the sheriff, but I don't know. Does that fit policy? Is that within our policy to do that? Because we're putting something on a capital asset list without putting a revenue source next to it.
Well, it will have a revenue source next to it, but you're correct. The board would have to agree to increase appropriations at mid-year in the event that that budget unit really couldn't absorb it. So, I mean, you're not wrong about that. I do want to note here that we still don't have final numbers from the department on the vehicle so far as I'm aware. But if we do, then I'll need that to be provided to me by email so that I can update
And
accordingly.
Does this $120,000 purchase, I'm assuming, don't we have to go through some sort of purchasing process before we make an investment that big? I mean, it's got to be more than just the ag commissioner going on the internet to Truck Trader or wherever we found it.
I expect that they would be working with Ms. Rich in terms of what the proper procurement protocol is in order to effect this purchase.
I mean, since we just went through the whole thing about staying within policy, I just want to make sure we are.
And the total cost, I think Gary brought it up earlier, or Ben, they have to re-register the vehicle in California, don't they? We have to pay a sales tax on top of that when you register a vehicle one time.
It's a one-time. I used to sell cars, it's a one-time.
Right, but that's a cost incurred now.
Yeah, there's one in here, there's sales taxes in here.
I mean, I'm for a truck. I just
the
want to make sure we do it right.
registration, thank you.
Yeah.
I'm not against the truck.
I mean, the ag department never asks for much, so I'd like to, but I'm not comfortable with this. But
You're not comfortable with it?
I think I understand, I'd like to see how often are we using it? Is it something that we could still utilize in other county?
Why don't we, just have admin come back to us on the 22nd of September with suggestion how to fund it. Look at what salary savings are, see if the actual funding is there, and give us a couple options, whether we can do it at mid-year, or we can go ahead because the funding is there within their budget, or other areas. I think this truck is vital in order for us to do what we're mandated to do.
Okay,
And ag, you're right, ag, I can't remember ag ever coming before us. Mary never came before us. Kevin never came before us.
Brian did.
Brian did, Moss, but we always told him, thanks, Brian, but
That's fine. So, Gary's recommending 50,000 for that allocation. Krista? What?
I'm sorry, 50,000 for,
Well, he just was thinking of just upping it from 35 to 50.
excuse me, and the reason I'm saying that, I don't think everything is there on that list, and that they're going to need to do is crane certification and other things that needed to be done that aren't reflecting there that are going to come up.
The fuel cost to get that thing back here is going to be something isn't in the list either.
so do you all have a final number, an actual number that I can,
Well, 163 plus 30 plus 50, not 35.
163?
He's requesting 35,000. I'm saying make it 50 because there's going to be costs associated to getting that truck back here, getting it certified and ready to use so we can do what it's supposed to be doing, and certifying weights and measures here in Calaveras.
Okay.
And then see if that money's available in coming back to us on the 22nd. If it is indeed available, the 93,000 in their budget somewhere, plus the additional money.
Okay, so it's 93,000 plus 50, or it's 163,000 plus 50?
163.
It's in the presentation, Krista. I'll send you the page from the presentation.
I'm going to find, is there support for what Gary's recommending, Ben?
yes.
Dennis?
Yes.
So before we make a decision, that's part of why we have the hearings ahead of time. I'm sorry to interrupt, Madam Chair, but we need direction on what changes to make now. If we come back and we don't know what we're putting into the final budget, we won't know how to make the final budget balance if we bring back 2 or 3 options. So, and I know it's a bad situation for everybody. With all due respect to ag, I appreciate their request, and I understand the need for the vehicle. I don't disagree with the need at all, but it's part of why we have a preliminary budget and a final budget, a budget hearings, so we can net these things out in advance. And I think we've hit the finality of this where the board has to make a policy decision whether or not they're going to agree to go below policy level minimums on the contingency and fund this out of contingency, and we allocate the money to them from contingency. And in the meantime, we work with them to minimize the cost as much as possible out of their existing budget or any other ways that we can do that. And then we might be able to make an adjustment down from the expenditures that come out of the contingency at mid-year. I don't see another way to skin this cat this late in the game in such a way that doesn't have a huge impact to the final budget that we're trying to bring back to you that's balanced. Krista, do you disagree with any of that?
No, I completely concur with that. Everything you said, CAO, at this stage of the game, we do need to know. This budget unit has, right now, what's before the board is an overall appropriations limit of $795,000. So to absorb 213 is not reasonable. I don't think it could probably be done as a practical matter, but we could do other things as CAOL suggests, or we could table this discussion and bring back a more fully fleshed out agenda item in October. Of course, those appropriations would require forfeits vote of the board. Either way, in terms of what we bring back to you on the 22nd, it does indeed need to be final at that point, as it is not possible to actually incorporate those changes into the budget at that point.
Madam Chair?
Yeah.
I'm willing to consider throwing in my vote once this thing's flushed out in October. I won't be supporting it now. It just doesn't feel right. I mean, if this was the most vital piece of equipment in ag, why are we hearing about it now? It seemed like something that you'd see coming down the road over the last 33 years of owning this. So, or that we've had this. So I'm willing to take it on in October, but I won't be supporting it now because I don't think it's flushed out.
Yeah.
Jerry?
I understand what Jack's saying. I do, but again, you don't know. Mike hasn't been there that long. You don't know what Kevin was going to retire. You don't know if he just didn't care or whatever. I don't know why it wasn't brought to us. It is a vital piece of equipment. I'm looking at Ag's budget right now, and you're right, Krista. There's only $758,000 in the total budget, $795,000 in the total budget. To take 200 and something thousand out of it.
That's a big
So the question is, are we willing to take it out from contingency? Whether we sort of do it now or we do it in October after this has been massaged.
Yeah, whatever's the board's preference, I think there's a couple issues here on it, and one is you don't know if that truck's going to be available in October, that he's found. It's the only one he could find. It's a new truck. He has in his presentation that all the other new trucks that he found were $250,000. He found this one in Pennsylvania for $128. Excuse me, 143. But, you know,
Gary, was it a new truck? I thought it was used.
New, has 1,500 miles on it. It's a 2020 with 1,500 miles on it.
Okay, so the question is, would you be willing if there was no other option to take it from contingency? Then we'd be going below what our policy is. Dennis?
For an asset like this, with what it is, I'd be willing to take that, yes.
Okay, Gary? I'll come back to you. Ben?
Well, you know, we still have to decide how we're going to do that other fund that you're talking about pulling it from, so we don't know until we made that decision whether we're flush or not. But, you know, with that in mind, it's an asset that is needed. Things won't change by October. We'll still need it. So, yes.
Jack?
I'll consider in October, but not in this budget.
Okay, thank you. Gary?
Yes.
Okay, there's 3 yeses. That worst-case scenario would be that we would be taking it from contingency when we review it in October. Until then, we expect you to work your magic.
Just, Madam Chair, just
Yeah.
curious, how much are we saying we're taking out of contingency? Or are we leaving that open-ended?
There's the 163 plus 50, right, Gary?
It's just 50.
No,
Minus the 30.
whatever money that they can't find in that budget that they presented to us, whether it's salary savings or whatever the difference is to get that truck, I'm in favor of taking out of contingencies.
But what Jack's asking is, what is that dollar amount, give or take?
That's up to them, and when they bring it back to us on the 22nd, they were going to do that anyway. They were going to try and find from other budgets and...
So it's from somewhere from 0 to 160 some odd $1,000.
So
we have to
I guess I
reserve that out.
need to be clear what I'm trying to ask for. And my apologies for not being clear. It's my opinion for us to be able to close, to bring back a balanced budget that's finalized for the board in the next vote, the board's in a position where they, in my opinion, need to make a go or no-go decision on looks to me like $168,000 purchase that's going to come from contingency. We'll build that into the budget and we'll bring a balanced budget to the board. In the meantime, working out into mid-year, we'll keep working with the department. There's several things that we don't know that are there. Frankly, the numbers are too round. Anything that ends in 00.00 is an estimate and usually are not 100% accurate. So there's $10,000 for a bed installation. Could be 5, it could be 15. Licensing fees, $3,000. Sale of the used truck, $5,000. Savings from deputy position, $93,000. None of those are accurate numbers, and we won't be able to get all of those numbers accurate in the meantime without knowing we can go through and work on a procurement process for the vehicle. I'm inquiring with Bonnie. She's on the line now, on this call now. I'm not even sure what we need to do to procure it, that we can go to this particular vendor and procure it. So unless we know that the board's willing to make an adjustment in the contingency up to about $170,000 now for us to program into the budget, for us to go do all of the finalization of this, we won't be able to move forward on it, at least in my opinion. My recommendation to the board would be to make the decision whether you're going to allocate all of the money out of contingency, let us work it through, and in mid-year we'll have to come back and make the adjustment if the expenditures are not as high. We'll put it back in the contingency, whatever you allocated out of their allocated to them in their budget. That I feel like is the only way we can actually meet the board's policy directions that are going to happen here today and procure the vehicle at the same time. And Krista, I know I'm kind of stealing the show from you. Do you see any other way that we can do that and bring a finalized budget back to the board?
No, I concur.
Yeah, I don't think you're going to procure that truck any other way. I don't think they're going to take a $5,000 deposit or anything like that. So if they want to sell the truck, they're, you know, because they'll take $5,000 and then a month from now we say we can't do it. We're out $5,000, and you know, so.
So the question on the table is: are we willing to go 170 out of contingency? Worst case scenario, or that's a scenario.
To facilitate the process, that's the reality of the situation, yes.
That's the reality. So Ben's a yes, Dennis is a yes.
Yes.
Gary's a yes, Jack is a no, I'm a no. So 3-2, Al, Krista, you may make that 170,000 adjustment into, I'm sorry.
Madam Chair, along with that, I think I heard the clear caveat from the board that we will work with the department and identify all the areas that we can reduce that expenditure so that hopefully at mid-year we'll be able to minimize that transfer from contingency.
Yes.
Correct, yes.
Right.
Absolutely.
And I'm sure every other department's going to come running in here with the capital request and say, we'll figure out the money, but if we can't figure it out, you're going to cover it for us anyway. I just think we're setting a risky precedent.
I
But
understand.
the vote's done. It is what it is.
Okay, vote is done. Is there anything else we need to do today, or we'll close this up? Krista? Oh, no, why don't we do public comment unless there's anyone on the line now?
Madam
Okay.
Chair, is this an action item or is this just a hearing?
This is public hearing. The action item will be on the 22nd, when we approve the budget.
I have questions while we're waiting.
Yeah.
Krista, I am looking again at the Teeter Fund balance sheet on your presentation of the $688,000. It's for transfers for projects. And I'm looking at the capital improvement projects page.
What page, Gary?
It's there's no page number, page number 221 of our budget book. And it lists our capital improvement projects. And the only funds that I see coming out of Teeter are Government Center UPS battery backup replacement for $70,000. And the SO jail camera upgrade and expansion of security cameras with $179,189. But did you not suggest, Al, that project be put on hold? No, it wasn't that project. I'm sorry. It was the parking lot. Yeah. So
Yeah,
179 and 70 aren't 688. So I'm wondering where the remainder of that funding that we're transferring is. It says projects, and I'm not sure what other projects.
A substantial portion of it is going into the facilities budget, and I'm trying to pull up the itemization just now. If I can get OpenGov to work, I can tell you, or perhaps Ms. Rich would like to jump in.
Facilities under admin. What?
Let's see.
And then I had one other question that I wanted to clarify when we get done with that. It has to do with the Judicial Construction Fund for the DA's building.
Okay. All right. So, all right, so in terms of the Teeter transfer, so 150,000 of that would be for a transfer into the assessor's office, and I believe this is the county match for the scanning project that you've heard.
What project?
The scanning project, I believe it is, although I'd certainly defer to.
What line item are you talking about?
So it would be as a transfer out, and it is for the assessor's budget. I defer to Ms. Davis to speak more about that, but it would be the county match, and I'm just checking her narrative now.
So the CAO recommended to put that project on hold if it's the assessor's improvements.
I'm not sure we're talking about the same project. So far as I understand, this project is still in the works, although and it's not a remodel or anything like that. It's the project that she was doing with her grant funding. I don't see her on the line at the moment.
Gary, it's page 178?
Sorry?
Page 178?
Page 178?
Yeah, that's where the statement is from the assessor. Is on 178.
Right.
I do believe that that's a match on grant funding, so I don't know if we can hold off on that for too much longer. It's been held off on for quite some time already. So I think there's a sunset on that we're barking up on real quick.
There is. I believe we're in year 3 of that grant, and it's a 3-year grant. So, okay, it looks like...
It would be a $150,000 match.
I'm unsure on that.
The grant includes $33,000 to accommodate the project. The match isn't...
So, Gary, why don't we have the question on the table, Krista, is...
Okay.
Where...
May I present Ms. Davis, who is on the line and available for questions if you would like to discuss with her directly.
No, I think I'm sorry. I think the question on the table is whether it's the assessor or the auditor or the board of supervisors isn't the issue. The issue is where is that money being spent? And my recommendation is that if you could, by tomorrow when we meet, explain where it is, so we're not saying, well, here's 33,000 for the assessor and 70,000 for this and 100,000 for that. Because the question is where did all the teeter funding go? Is that how I have it, Gary?
Yeah, I want to know the 688 for these projects.
Where did it go?
Are these still current projects, or what projects are they? I just want to know what projects that they are.
So
It's 179,000 and a little bit of change for the security camera upgrade for the sheriff's department. That's in CIP.
Yeah.
It's the $70,000 for the UPS backup, which is in CIP. There is $289,000 that is allocated to a variety of projects in the facilities budget. Things, for example, are like the Cal Fire Vallecito crew. That's 12,000. Locksmithing, 20,000. CPPA grant, LED lighting retrofit, 20,000. Other things like minor HVAC repairs, minor roof repairs, elevator repairs, all told of that, of all of these types of projects, and I did not name all of them. Teeter is 289,000, and then the remainder is the 150,000 that we spoke about for the assessor's budget. And I see that Ms. Davis is on the line and available should you wish to direct any questions to her. And that is the amount.
No, that's fine. I think that satisfies my question of where the money's going. I just wanted to make sure there wasn't any money there on projects that we aren't going to do or are on hold or something for that funding. I was thinking about this truck that we just talked about. The other question I have is the Judicial Construction Fund, $1 million. And that money, and we're adding $254,000 from contingency.
Let me pull up that.
I'm on page 155.
Right, so I don't know, but actually I think I kind of do know. So at the end of the day, this is money that, and I invite either our auditor, controller, or DA Uke to jump in here, should either of them wish to do so, but that these are monies that were made available for us by the local courthouse or court, and so it would not be an appropriate use of those funds to backfill an agriculture department vehicle purchase. But perhaps I'm not understanding your question.
this is old money.
I know, and I'm not, that's why I'm asking that before we spend this money, that we're able to spend the money on what we're asking to spend it on. Because this question, I think, was brought up at preliminary budget as to where this money came from and whether or not we can spend it. If it was for the courthouse project itself, or whether it was money that was supposed to be used for the improvements on the roads leading up out here in Mountain Ranch Road and possible signalization of 49 and Mountain Ranch Road. There was a lump sum money put in, as you know, Marita, a long time ago for those improvements.
This was way prior to that, these funds.
Way prior to that?
There was two funds. One fund was controlled by the courts, and one fund was controlled by the county. If I remember correctly, there had been a dispute dispute between the county and the courts who got this $1 million. The county's saying that it's our money, because we discussed it when we decided to use it. As far as I'm concerned, the courts haven't said anything. It's ours to use for public. We did it in the auspices that it's public safety, and
Is
that's
it-
how we got it. I mean, I can go to.
Is the auditor, or not, is Kathy on the line? The auditor controller?
Huh?
Yeah, the contingency proportion.
He's concerned about the contingency.
Well, apparently we're taking $254,000 out of our contingency for this project.
Oh, I misunderstood you. Please forgive me. No, what that is the delta between the fund balance and the amount that is actually budgeted as a transfer out for the project this year. So that $254,000 is in effect sitting in a savings account in that fund. They are not our general fund contingencies. Rather, they're the contingencies relative to that specific budget unit and fund.
Okay.
Those are not general fund dollars.
The DA's on the line. Could you please ask Barbara?
Barbara, you can go ahead and talk to the board now if you'd like.
Hi, this is Barbara Uke. Marita, I'm sorry, but I could not hear a word you were saying, so I don't...
I apologize. I was talking about the dispute between the courts and the county. There have been 2 construction funds, and one construction fund was under the control of the courts. The other one, the county said was under their control, which is that $1 million that we're putting towards your project. So unless there's something that comes up, this goes back 20-some years.
Right, and that's my understanding as well. And now that I heard you say it was for my building, then I can step aside at this point. I just want to make sure that it's that it is for the construction for the building, and not that it's going to be spent on other items. Because my understanding of the intent of it was for the criminal justice partners, and it was either for the sheriff's office, and they clearly don't need a new building, and the court obviously doesn't need a new building either. And way back in the day, I believe that probation was also intended to be housed in what was to be a complex for the sheriff's office, the court, my office, and probation. But everybody agrees at this point in time that my building is the one that is most in need. So I'm hopeful that those funds will be reserved and only used for
Barbara,
construction.
I don't think that's the question. I think the question that Gary and I might have, is there any reason that the courts might come in and say that that's their money, which is why the money's been sitting there for 20-some years.
No, we don't want to spend it and then find out the court
Yeah.
comes in and says, hey, you can't
That's
use
our
that for
money,
that.
Right.
Right, well, and then that would
You'll
be
represent us pro bono, is that correct?
Yeah, no A87.
Yeah, I mean, we have allocated it for the construction fund for the district attorney. I think at least what Gary and I are saying from history is to make sure that there will be no asks on that money other than what we are saying it's for. So,
what I can tell you about that is that my last conversation with a presiding judge, and it was some time ago, was that there was not going to be any ask by the courts for that money, except for possibly a couple of small projects that they realized after the court was built that they might need. And it was a very small amount. I don't have the numbers in front of me. But it was a very, very small amount, and it would not bring the balance for my building anywhere close to below $1 million. It was at least $1 million, if not $1.2 million.
okay, fine.
But as far as a portion of that's been budgeted for this year, and I might be misunderstanding what has been parsed out, But if there is some of that that has been budgeted for this year, I'm not aware of what that's budgeted for.
Okay.
But I might have misunderstood parts of the.
I can't answer that question at this point, but Gary?
Well, the budget for this year was to get the planning and the drawings and the whole phase ready to go for construction. And that's what that money was going to be used for, some of that money, through Aspen Architect to give us a rendered set of drawings for us so we can go out and get a bid for it.
Oh, okay.
Yes?
Aye.
Well, I don't know if the ad hoc committees had an opportunity to meet again. I do appreciate the members, Supervisor Garamendi and Supervisor Tofanelli, pushing forward and making sure that the whole project does not stall out. But I'm not aware that we've had another meeting, and it's been some number of months from the last time we met with Aspen to talk about some ideas and our functioning, and I haven't heard back on what developed out of that last meeting.
Al, can we send an invite to our next ad hoc meeting to Barbara?
Yes, sir. For this Thursday?
Yes, this Thursday. Yeah, I haven't seen the agenda. I haven't looked at it. I'm assuming the DA's office is on that agenda.
It's one of the projects that has been prioritized, yes. The building itself and the funding of the building wasn't an agenda item, but I can add it to it.
Okay, thank you.
Definitely.
Is this going to be the standing committee or the ad hoc committee? Oh, that's not on the agenda.
And Marita, you're correct. I just want to make sure that we don't spend that money and then the courts step in the state of California and say, hey, wait a minute.
I know.
So that was the only question.
So we heard Barbara say they only want very, very little. I'm interested in what that is. You don't need to remind them, Barbara. Is there any public comment?
Chair, while we're waiting, I've got one item. For 2 years ago, the board put together a PARS account, and we have never transferred our 27th week payroll into that PARS account. And I know there's been a commitment over the years to do that. I would like to see that get done.
I believe we used some of the 27th payroll for the PARS, but let's get back to that in a moment. Oh, they did. Well, we'll be reconvening this meeting tomorrow at 9 o'clock if somebody would like to call in on the budget. Krista?
Yes.
On the liability, PERS liability, Dennis said we were going to transfer. Was it transfer the whole 27th payroll or just part of it?
We have right now the entire 27th payroll budgeted as an expense to fund the Section 115 trust per previous board direction.
Okay.
115 trust is what it is.
Madam Chair,
Yes.
what are we coming back tomorrow to do?
Well, we still have items 17, 18, and
Finishing up.
I mean, can we just, there's 2 items.
Excuse me, 18. Can we take a 5-minute break, please? Thank you.
2 items. Okay. You know more than I do.
You don't want to come back tomorrow?
Well, if I don't want to come back for 20 minutes of work, but
You enjoy our company?
I love your guys' company. Gary, you and I have done well over 100 plus meetings. I'd feel vacant if I didn't have it in my life.
It's moments like this.
Obviously, I'm missing a piece of the play here, so that's okay. Madam Chair, I take your word on it. I don't know.
Okay, we have on we can either stop now and come back, or we can power through. And what we have to do is the fire departments, the JPA, the CARES funding, 18, 19, and 20. So I don't think it's going to be something that we'll do in the next half hour, but I'm open to the pleasure of the board. Dennis?
I'd rather go home. Well, I've got no power at the house, remember?
Well, I don't either, but at least you have a generator. I'll be over for dinner. Gary?
I'm okay, but we said, I've already texted my wife that we were, sorry, I already texted my wife that we were going to quit at 5 because that's what you said we were going to do. So, but I could text her we're not, but I don't think we're going to get done before 7 if we do those.
Ben?
Tomorrow.
Tomorrow, Jack, tomorrow, Maria. Okay. I would...
Thank you.
What we're going to be doing tomorrow is for the fire departments, or excuse me, for the JPA, CARES Act funding, items 18, 19, 20, and which, of course, 17, which is a continuation. Excuse me. So I would like a motion to adjourn until tomorrow, please.
I'll move.
Second.
Motion by Supervisor Tuffanelli, a second by Supervisor Stopper. All in favor?
Aye.
So moved. Thank you. We're done for the day. See you tomorrow at 9 a.m.